Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed. This is the Northern Ireland Assembly Plenary Programme signed.
Please take your seats. Members, the next item on the order paper is the second stage of the Health and Social Care Bill. I call the Minister of Health to move the second stage of the bill.
I beg to move the second stage of the Health and Social Care Northern Ireland 2021 and I move the bill be agreed.
Thank you. The second stage of the Health and Social Care Bill has been moved. In accordance with convention, the Business Committee has not allocated any time limits on the debate, and I call on the Minister to open the debate on the bill. Minister.
Thank you, Speaker. The objective of the Health and Social Care Bill is simple. It is to facilitate the closure of the Health and Social Care Board and transfer responsibility for its functions in the main to my department. I am pleased to be able to open the debate on this bill today, not least due to the fact that the closure of the board was first announced some 5 years ago. It is important that we now take the steps required to bring certainty to those staff within the organisation, but also that we respond to the clear evidence that our current system is complex, bureaucratic and no longer meets the needs of today's society. We know from the various reviews and reports that have been commissioned from Donaldson to Bengoa that we must transform how we plan and manage our services to meet the needs of our growing and changing population, and the closure of the board is an important step on this journey. Before I move on to the bill itself, I think it would be helpful to set the scene for what this legislation will actually mean in practice. The bill in closing the Health and Social Care Board will transfer responsibilities for its functions in the main to my department. The staff of the board will transfer to the Business Service Organisation under a hosting arrangement. Crucially, these staff will retain their HSE terms and conditions and will continue to undertake their current roles and functions, albeit they will be directed by the Department and will be led by a senior civil servant at Deputy Secretary level. This is an important point, Mr Speaker. As we seek to transform how we plan and manage our services, we must do so in a staged manner that ensures we manage any risk to our service delivery. In this first step, we will see the closure of the Health and Social Care Board and its staff supported as they move to a new operating model, where they will continue to undertake the same roles and functions as before, but as an integral part of my department and not as an arm's-length body. This will ensure the continuity of service delivery and mitigate against any risk. Right from when the initial decision was taken, this has not been about people involved, but rather the need to streamline our structures and reduce bureaucracy. In designing this operating model, engagement and analysis has taken place across the health and social care system. Work has continued in this vein as multi-organisational project strands have been established to not only take forward the necessary steps to ensure a seamless implementation, but also to identify and take forward improved ways of working. Building then on this first step, I recently approved the commencement of a programme of work which will look at how we plan and manage our services in a way that promotes integration, collaboration and service improvement. Key to this is that it seeks to harness not just the strengths of our health and social care sector, but looks beyond to what can be achieved when we work in partnership with the voluntary community sector and with government and with our service users. This has been a key learning from our response to COVID, and one I am sure we can agree we must work now to ensure we do not lose as we turn our attention to the future. But as I reiterate my earlier point, this bill deals specifically with that first step, which is the closure of the board, the origins of which can be found in the review of commissioning arrangements published in November 2015. The review identified a number of weaknesses in the system, which I have already referred to, such as the complex and bureaucratic structures and the lack of clarity of accountability and decision making. And it was on this basis that the decision to close the board was taken, a decision which I can assure the Assembly has been subject to engagement and to consultation. A public consultation exercise ran from December 2015 to February 2016 and received over 180 responses from a wide range of stakeholders. The consultation report, which was published in March 16, reaffirmed the need for change. While acknowledging the closure of the board would not cure all the issues facing health and social care, having more effective structures would allow for a better focus on resources and support the system to operate more effectively and innovatively. I want to put on record my thanks to those groups for their contributions. I must also acknowledge the concerns raised at this time on how services will be commissioned. However, as I pointed out earlier, this first step is about streamlining structures, providing clarity of decision making and enabling effectiveness and greater efficiency. This is not about changing process. This approach enables us to move forward in a way that minimises any risk to service delivery. However, I can assure those who contributed and this Assembly that those views will be considered in the work that is now commenced to look at how we may plan and manage our services differently. Mr Speaker, now to the bill itself. The Health and Social Care Bill seeks to provide the legislative framework for the closure of the Health and Social Care Board and the transfer of its functions. It is a relatively small bill, technical in nature, with 7 clauses and 3 schedules, and I will cover the essential elements of the proposed legislation. The first clause, the dissolution of the Regional Health and Social Care Board. This clause provides for the dissolution of the board, and as a consequence, local commissioning groups will cease to exist. The board currently has a statutory duty to appoint local commissioning groups, but this statutory duty will end on the dissolution of the board. There does, however, remain a statutory duty in my department to secure the commissioning of health and social care services, and in doing so to set the priorities and indeed the outcomes which the system is expected to deliver. Whilst the dissolution of the board will remove the requirement for local commissioning groups, let me be clear. This is the removal of a construct and does not in any way detract from the need for local intelligence and input into the planning decisions. As I referred to earlier, work has begun to look at how we plan and managed services based on collaboration and integration, one which is based on local need and local input. Clause 2 refers to the transfer of the regional board's functions. This clause introduces Schedule 1, which is the core of the bill. It details all the amendments that are required to existing legislation to achieve the transfers of powers, duties and responsibilities as a consequence of the board's closure. The amendments to health-specific acts and orders result in duties and responsibilities previously held by the board now being placed in the main directly upon the department. This includes contracts for primary care providers, which now become the responsibility of the department. Following on from that, the bill provides my department with regulation-making powers to ensure practitioners have access to an independent appeals process following the closure of the Health and Social Care Board. In other areas specifically related to social care in children, amendments will result in these functions being directly placed on health and social care trusts. It is important to note that currently trusts already exercise these functions as a consequence of their delegation from the board. In this respect, the bill merely ensures the continuation of the trust's ability to fulfil their role in this area. The bill provides for my department to be directly responsible for the oversight of the trust's exercise of these functions. That oversight will be facilitated by regular ongoing performance reporting by the trusts to my department. The bill provides the trust must, at the very least annually, submit a scheme detailing how they are exercising the social care and children functions of the department and for its approval. Turning now to Clause 3, which is the schemes for transfer of assets and liabilities. In order to help effect the dissolution in practical terms, this clause places a duty on the department to make one or more schemes for the transfer of the board's assets, which includes its staff and its liabilities. Whilst a transfer scheme for staff is not new or novel and has been used on many occasions in the past, this is a novel arrangement and one which has been fully considered. In this case, the staff of the board will transfer to the BSO. However, in the operating model, they will be directed by my department and will be led by a senior civil servant. Again, this comes back to the need to maintain service delivery. This approach, while streamlining structures and reducing bureaucracy, will also provide the flexibility for the work on new planning approaches to evolve, and importantly, through their employment with BSO, the former board staff will retain their HSE terms and conditions, and those staff will be made redundant. Staff engagement has been and continues to be a fundamental part of the process. Consultation with staff and their representatives will be a key part of the development and operation of the transfer scheme for those staff. Clause 4, the transitional provision, includes Schedule 3, which ensures an ordered winding up of the board and the continued proper operation of the health and social care system. A power is included here to provide for regulations to be made, if required, to address any non-alignment of existing legislation not already identified as a consequence of the closure of the board and commencement of the new arrangements. Again, this is not novel or contentious and was evident in the 2009 Reform Act, which provided for the dissolution of a number of health bodies and the transfer of their legislative functions. Schedule 3 places a duty on the department to make arrangements for a statement of final accounts of the board, and together with a report from the Auditor and Controller General, these must be laid with the Assembly. It also provides provisions to ensure continuity in terms of previous directions issued to and by the board. In addition, the department may continue anything being done by or to the board, and that includes legal proceedings, following the closure of the board. Clauses 5, 6 and 7, Mr Speaker, are standard interpretation, commencement and short title clauses respectively. In conclusion, it would be clear to members at this point that this bill is relatively straightforward in its objective, though technical in nature. The closure of the board is a step forward as we seek to reduce the bureaucracy and complexity so keenly associated with our system. As part of a wider transformation, it is a step which will enable us to better focus our resource and enable the system to operate more effectively and efficiently. And I think we can all agree that that need has never been greater. Mr Speaker, I look forward to hearing what the members have to say today about this bill.
Thank you, and I call the Chair of the Health Committee, Colm Gillernew.
Caoimhe Archibald, Caoimhe and Caoimhe Archibald, Puji and the Minister also for coming this morning and making his remarks in relation to this change. So I welcome the opportunity to make some initial remarks on behalf of the Health Committee, outlining the Committee's consideration of the bill before speaking as my party's health spokesperson. As the Minister has outlined, this bill gives effect to the decision to close the Health and Social Care Board and transfers the responsibility for the functions to the Department of Health and the transfer of staff to the Business Services Organisation. The decision to close the Health and Social Care Board stems from Liam Donaldson's report, The Right Time, The Right Place, in 2015. That report highlighted a number of weaknesses in the health system and outlined the need for change that would allow more effective and efficient structures in the delivery of health and social care services. The decision to close the Health and Social Care Board was reaffirmed by the then Minister for Health, Michelle O'Neill, who confirmed the closure of the board as part of the wider transformation agenda. The aim of the bill is to simplify the administration structures, and in the current challenging climate of the pandemic and its unknown long-term physical and mental health impacts, with ever-increasing waiting lists for surgery, any advancement of that transformation agenda is to be welcomed. Indeed, in recent weeks, the Committee has heard evidence from the Department and other stakeholders that there are concerns that the transformation agenda will not be able to be progressed without significant additional resource for the Department of Health. This is disappointing, as the Programme for Government clearly outlines that the transformation of the health service will contribute to the Programme for Government Outcome 4. We enjoy long, healthy, active lives, and the New Decade New Approach Agreement included an executive commitment to deliver reforms on health and social care. The Committee wishes to see the transformation agenda driven forward by the Minister and the Executive, and this bill indicates a step towards the streamlining of decision making. The Committee first considered this bill at its meeting on the 4th of March, just before introduction at first stage. I thank the Minister and his officials for their early engagement on the bill and the briefing on the principles of the bill. This briefing was a useful session for the Committee, and a number of questions were raised with officials. Members sought clarity on how the bill would improve accountability and decision making within the Health Department and how the Department will manage performance management. The Committee also sought further information on how the Department will ensure that there is a smooth transition when the functions are transferred and the board closed. Members highlighted to officials the importance of enhancing engagement with stakeholders and asked how the Department will ensure there is enhanced engagement with key stakeholders in the commissioning of health and social care services, including trade union representatives. This is especially relevant given that the board and its non-executive directors and committees have significant expertise and knowledge on the prioritisation and commissioning of services, and the closure may result, therefore, in an expertise and knowledge gap. There was some discussion in relation to transfer of staff from the board to the department and roles and responsibilities of officials and their lines of accountability to the Minister. Members again highlighted the need for early engagement with trade unions and staff to ensure as smooth a transition as possible in that sense. Providing the bill passes second stage, the Committee looks forward to engaging with stakeholders and scrutinising the bill in further detail. And now I would like to make a few remarks as Sinn Féin Health spokesperson. So this Health and Social Care Bill is an effort to reform and address some of the weaknesses across the health and social care sector. It promises to create a more effective and efficient healthcare system with improved structures that will in turn, we hope, improve the delivery of services and of health and social care services. The HSE Bill is an integral part of a wider transformation agenda. It proposes to simply and clearly demarcate the structures within the healthcare administration, increasing transparency and accountability, which is much needed. Also, reducing the levels of bureaucracy in any organisation is, I believe, a positive development. But there is little point in simply reorganising the deck chairs. This transformation of the healthcare structures must result in simple and clear lines of responsibility and accountability. There must be a clear chain of command for that accountability. In the restructuring of the healthcare administration, there must be an effort to protect the jobs of those within the structures, and redeployment must be assured to all, as the Minister has indeed indicated. And I suppose I suppose that one of the key issues that the committee will be concerned around is the very important social care and children's functions, and it's crucial when you talk about issues like that we do see that continuity and that there are no gaps in those very different areas. We look forward to discussing how the effective and innovative approach can be increased, and I am slightly wondering the Minister's remarks in relation to the staff being under the direction of a senior civil servant. I'm just wondering how that can be achieved in light of the fact that the staff are being dispersed to trusts, to BSO, and in some cases I think to the department. But I look forward to drilling into those issues in more detail at further consideration stage in the committee. Caoimhe Archibald.
Thank you. And I call Pam Cameron.
Thank you, Mr. Speaker. And I welcome the opportunity today to say a few words on the second stage of the Health and Social Care Bill. This bill will present a major bureaucratic change in the manner of governance in our health system and the transferring of responsibilities from the Health and Social Care Board. On the 8th of April 2014, then Health Minister Eben Poots announced his intention to commission former Chief Medical Officer of England, Professor Liam Donaldson, to advise on the improvement of governance arrangements across Northern Ireland's health and social care system. Several months later, the report was published alongside a set of recommendations that are intended to modernise and better equip our health system to meet the demands and the needs of today's society. DUP Health Minister Simon Hamilton set out this very proposal we are discussing today on the 4th of November 2015 as part of a package of administrative reforms. Much of it was based on the Donaldson report, which found our current structures to be overly complex and bureaucratic, a lack of clarity in relation to accountability and decision making, and a lack of challenge to providers. The review also highlighted that the annual nature of the financial and planning cycle inhibits long-term strategic planning. This is an issue which I had mentioned recently in the budget debates regarding the need for multi-year budgeting. Strategic planning cannot be properly done without that foresight. The public consultation also found that current arrangements are not lean or agile enough to respond quickly to the changing demands within health and social care, and that changes should be part of a broader strategy for transformation. If implemented effectively, the closure of the Health and Social Care Board will allow the department to take firmer strategic control of the health and social care system, allowing cleaner accountability, removing complexity and ensuring decisions are more efficient and responsive. The proposed changes as part of this bill must be part of a broader strategy for transformation. On its own, this restructuring will not resolve all of the problems facing our health sector. Significant investment in present and new services is required, and a solution to fill many staffing vacancies and end the reliance on agency posts. The present pandemic has served as a reminder that we cannot keep doing the same things over and over again and expect different results. Health transformation is needed. It is needed in a manner that supports staff and patients alike to deliver the best services possible to our country. Speaking as a DUP representative, we are pleased this bill is being introduced, and I commend the Minister, Robin Simone, for ensuring this progress has been made under the challenging circumstances for his department at present. Unfortunately, delays caused by the collapse of the Assembly and the COVID-19 pandemic has pushed much of these efforts to properly transform our health service back. We must ensure that there is no more delay and strive to earnestly implement what has been recommended to the Executive by many experts for years. I very much welcome that all staff in the Health and Social Care Board will be redeployed to other roles and their terms and conditions will be protected through this reform process. It is vital that staff affected by the closure of the Health and Social Care Board are kept fully aware of the changes and are given adequate space to make their views and concerns known. It is important that these reforms are viewed through the lens of a wider transformation agenda for health and social care and not taken in isolation. The reform of social care, for example, will have a bearing on accountability arrangements and performance management. Whilst it has been going through a number of very challenging years, not least of late, we should all be very proud of our National Health Service here in Northern Ireland. I, for one, am proud of all our staff who see their role not just as a job but as a vocation, their hearts in serving and caring for others. We owe it to them to ensure that health transformation is progressed, to give them the resources and support needed to face the challenges today. With these proposed changes, the Department of Health will and must take on more responsibility for the strategic steps necessary for taking our health sector forward. It must ensure true equality of services available to service users across all of the regions, allowing more joined-up strategic measures to be made between trusts to improve outcomes and share resources when needed. The public perception is often that our health service is far too bureaucratic. The bill is intended to simplify the administrative structures. Having a more streamlined structure in place will help to better focus resources and enable the system to operate more effectively. Mr. Speaker, if and once agreed today, I look forward to further scrutiny of this bill through committee stage. And to conclude, I welcome the second stage of this bill today and trust that it will be just one of a number of future legislative steps taken to protect and develop our health service as promised most recently to the people of Northern Ireland under the new Decade New Approach Agreement. Thank you.
Thank you. And can we bring Cara Hunter on screen, please? Can I invite Cara Hunter? Can I invite Cara to ask her question?
Thank you, Mr. Speaker. I welcome the opportunity today to speak on the stage of the Health and Social Care Bill and welcome that the bill has finally come before the Assembly for debate after the decision to close the Regional Health and Social Care Board was first announced in 2015. My party colleagues and I are largely supportive of the bill. However, there are a number of points that I would like to raise today and hope that the Minister may be able to address some of our concerns and give assurances. The bill has had a long time in coming, and I now hope that it has reached and provided at least some clarity for the staff of the Health and Social Care Board. Some have voiced that they have felt great job uncertainty over the last 5 years, and I really think that this is a very regrettable outcome of the delay as well as the way in which the original announcement was made. It is, of course, welcome that a hosting arrangement has now been agreed. An issue raised today by Pam Cameron just moments ago and at committee is the reliance on agency nurses, and I feel this is an issue we must urgently address, is the lack of nurses in our health service. This is a very important transformative step in ensuring that our health sector will be able to provide true equality of services right across the north. Another concern I have, and I'm sure others across the House will share too, is around the closure of the Regional Health and Social Care Board and local commissioning groups. They have been an important part of the Health and Social Care Board, and local health professionals are best placed to know what the specific and emerging healthcare needs are within their respective areas. And I hope that we will continue to have an aspect of that in our new system. Partnership and co-production working with communities is how we will deliver better services that meet the needs of local people in each of our constituencies. Can the Minister assure us that local voices and expertise will still be heard and be able to feed into the commissioning of services process in the respective trust areas as we move forward? Another concern I have is in a similar vein, and that is the issue around the centralisation of power within the department. Whilst I certainly note the merits and the intended consequences of this bill in giving the department greater oversight of those functions which will be placed directly on the health and social care trusts, centralisation of power when it comes to commissioning of services can have unintended consequences, and I do worry about the regional and rural imbalance and impact of this. Often I think the temptation for services to be placed in Belfast and other cities is an issue, and as an MLA for a largely rural constituency, I'm all too aware and often see the impact of a lack of services being evenly distributed across the north, not least in terms of accessibility and difficulty in travelling for many. And I think social prescribing has been a real positive in these kind of rural pockets. But I think now, as we hopefully move into this post-pandemic world, reflecting on the amazing work of our health service, we also look at how we want our health service to be, how it's seen in the future. This is, of course, a huge task, part of a bigger conversation, as much more than the bill before us today, but we can speak at that at the next stage. However, I think that local communities and services should be at the heart of our health service, and I wonder what assurances can the Minister give us today that this legislation will not go any way into negatively impacting more rural communities. Thank you.
Thank you, and I call Alan Chambers.
Mr. Speaker, the Minister has said that this bill it's relatively straightforward. in its objective, though it is quite technical in nature. And I certainly welcome this bill coming at this time and the certainty it will bring to staff, given that it has been on the books since 2015. The Minister has stated this morning that staff engagement has been and continues to be a fundamental part of the process, and consultation with staff and the representatives will be a key part of the development and operation of the transfer scheme for staff. And certainly, again, we should welcome that and hope that staff will be able to buy into these changes and understand and indeed support them. I know that there has been quite robust consultation back in 2015-16, as the Minister has outlined, and it certainly, as I said, does appear to have been quite robust, and the subsequent assessment of the consultations received also have been given quite considerable consideration. The advantages, the immediate advantages that I see, is that there will be consistency of decision making and delivery of services across the board as a result of this bill. In terms of transformation of our health and social care system, I think that this bill does indicate it's a small but extremely significant step in that process of transformation. And I know that my party has had a policy of quite some time of bringing the work of the various health trusts under one umbrella in the interests of efficiency and the better deployment of resources and enhancement of services to patients. I wonder if such a move is on the Minister's department's radar at this time. Thank you, Mr. Speaker.
Thank you. And I call Carol Nicola Carol Nicola.
And thank you to the Minister for bringing forward this bill. It's been described as tactical in nature, and I think that's an understatement, even though there's only 7 clauses. And when you read through the schedules, I think the purpose of it was so we'd maybe put our screens down and give up, but we're not going to. So while this is really around the general principles of the bill, and we all accept that, even, as other members have indicated, there is broad support at this stage. I don't think anyone could argue against less than the bureaucracy within health and social care. But we all are reminded that under Bengal, which is about systems and not structures, and indeed the new decade new approach around code production, code design, I would see this as an opportunity. Not to go back and look at it again. I mean, you mentioned yourself, Minister, the consultation report in 2016 was quite detailed. It was a good consultation in terms of the responses, varied in terms of responses, but I think everybody, the general thrust of it was that everybody wants better outcomes for patients. The difficulty that I have, and while I appreciate this is only the second stage of the bill, and when we get into further scrutiny, as all members have indicated, perhaps even you could take some of these considerations on board. So, for example, when all the staff under Clause 3, so the schemes for transfer of staff, assets, liabilities and that, and again I've pointed out that was in Schedule 2, which I referred to earlier, but perhaps the Minister could outline, say for example, even yesterday, the whole issue around the neurology, what happens there, what happens with the hyponatremia, what happens with ongoing issues that have been done. I think the public do need assurance, and they'll not get it from anybody in this chamber other than yourself. And particularly given some of the issues that were raised yesterday, I do think we do need to have some, not just detail. While I appreciate you probably found out about these revelations in the Irish News yesterday, like most of us, but the patients under Dr. Watt and now this other consultant, which is now under investigation from the GMC, and indeed other scandals and other reports that have came before that, that is something that people will be really keen. They'll not look at the detail, they'll just want to know what this means for us. Other members mentioned the issue around staff, and staff are assets. So it's not just our physical assets, it's our human resources that make up the health and social care services. So I would be very keen to find out what's happening. I also think we need to have a bit more detail around the local commissioning end of things. And I think it was Alan had mentioned in his remarks, and certainly Cara and indeed others. There are concerns around, for example, what this bill will have an impact in terms of the urban-rural, but also addressing outstanding health inequalities that are already there. So, I mean, you know, our Leah Flynn, you know, our work around champion mental health, and certainly it's accepted right across the board that when, and indeed even by the Minister in his own high-level impact assessment, that when it comes to certain conditions and issues, unless there is additional investment and support, and that's a decision he alone must make, but certainly the call for additional investment in health is noted, and if not supported. But what are those services going to look like for youngsters in North and West Belfast, particularly who are struggling with mental health and addiction? What is the transfer of those services under Clause 3 going to look at for people like Danielle O'Neill, who's subject to the neurology issue, and you know, our whole life-changing diagnosis, not diagnosis, whatever comes out of this, those people need to know what the issues are and how they're going to be impacted. I also think, and I know legislation is legislation, but in terms of the Clause 6, and it talks about the commencement, that the Department of Health may by order appoint on which clauses of the bill come into force. I would like a bit more detail on that. Is it all? Because given there are only 7 clauses, and not to be dismissive of any legislation, but there are probably 2 or 3 which are really germane to the dissolution of the Health and Social Care Board. The rest of them are there because they've got a legal responsibility about transfer and all those schedules and all that language and narrative that goes with it. But I do think, I mean, given the fact that we have come through and are still going through probably an historic phase in all our lives, particularly and notwithstanding for those working in health and social care. So I do think a bit more detail, certainly a lot more detail on what responsibilities are going to the department, what responsibilities are going to the health and social care trusts, notwithstanding his colleagues' intervention there about bringing it into one trust. But irrespective of that, I don't think you'll find anybody who will disagree with certainly more accountability, more transparency. But, and I say this with all genuineness, health and social care staff need to feel that whatever legislation is coming through this Assembly, they need to see themselves in it. And rather than, we talk about assets, and we all agree they are our assets, but we do need to know what and when and how it's being transferred. We need to know where the lines of accountability are. We need to know what's happening with our local commissioning groups and where those powers and those decisions are being transferred to, and what democratic accountability there are in any new groups or forums or partnerships. And above all else, we all need to know what's happening with the issues that I've outlined around neurology, hyponatremia, care homes, services for people with learning and physical disabilities, all those issues that have exercised a lot of time in this Assembly, and rightly so, need an explanation. And while I do appreciate we are talking about general principles, and we will have many opportunities for further scrutiny, I do believe this is an opportunity to point these out, so the Minister will have, and his officials, time to bring forward some of those outstanding questions, if he can't provide them now. But certainly I would implore to him that, particularly given the revelations in the Irish News yesterday, if he could provide assurance to those people as quickly as possible, because I know that he probably was as uncomfortable as I and many others reading that, and that is not the way for those people to find out what's going on. So I support this second stage of the bill.
Thank you. And I call Paula Bradshaw.
Mr Speaker, thank you, Minister, for your statement today and your outlining the bill. I rise to support it, although I do with some reluctance, as I am unclear about precisely how the implementation of this legislation will provide a genuinely streamlined, more efficient and more transparent system. The fundamental question is how the removal of publicly appointed board members and members of the local commissioning group, who provide expertise on how the health and social care sector operates and scrutiny of performance drawing from their own work and background, actually enhances the delivery of health and social care services. And at Health Committee I drew a comparison to the removal of the Education Authority as that sort of middle layer around the commissioning and operational delivery of education services. We've already seen in the last few months that the mass resignation of the RQA board, I felt in my own opinion that undermined this expertise, and I'm just wondering how the removal of this Health and Social Care Board will actually improve oversight, scrutiny and indeed local democratic input. The bill also says very little exactly about how the BSO is going to be improved as part of the process. Currently there are far too many positions in the health and social care sector which are held on an interim basis, and it can take months and months for a post to be advertised and filled. How exactly does any of this constitute streamlining bureaucracy in practice? The apparent loss of local accountability and input perhaps concerns me most. LCGs, and I would put on record that I was on the Belfast one as a councillor before coming to Assembly. I saw the potential they had and how it happened in practice to inform local population planning, exactly in line with Bengoa, and to establish pilot projects such as the ICP Falls service, which in that case was then rolled out into other areas. Having consulted the policy background documents again since we discussed this at Health Committee last week, I remain unclear also about why the Public Health Agency, which has a commissioning role, is untouched by the legislation. And again, in a previous life in the community and voluntary sector, I found the Public Health Agency one of the few agencies, statutory agencies in the public service that was responsive and effective, and that was really because it had a very much a front-facing culture, and there was meaningful and ongoing engagement with those people who were working in the communities and with groups and sections of society who they were aiming to support. As such, it would be helpful if we heard alongside this bill how precisely the department will be restructured to accommodate this local input and engagement and the additional responsibilities it is taking on almost in their entirety. I should also put on record, Mr Speaker, that the bill is predicated on the notion that commissioning is not a cross-cutting issue. This is stated in the accompanying documents, which is interesting because commissioning, as we debated in this chamber yesterday, is one service that the Minister has argued in the past is not cross-cutting. So we would like a bit of response from the Minister on that. One final issue I would raise is that the bill, while apparently being all about streamlining, does mean that additional costs are incurred. It would be useful to hear what savings will arise from it in the years to come. So, Mr Speaker, although there is little wrong with the bill in itself, in many ways it raises more questions than it answers, and I do look forward to further scrutiny at committee. Given this legislation is largely about how Northern Ireland is not large enough to do full commissioning on its own, how exactly will commissioning or contracting of health and social care services be improved for the future? How precisely will new services such as ME, Huntington's disease, long COVID and other conditions currently lacking a fully resourced pathway or service not get lost? How will they be commissioned? Lost within the Department of Health, how will they be commissioned? Where will responsibility lie in identifying, planning and engaging with primary and secondary care? And how will this in fact make things more efficient? Thank you.
Thank you. And can I now call on the Minister, Robin Swan, to conclude and wind on the debate?
Thank you, Speaker. Just bear with me. I was expecting more contributions, as you can tell, Speaker.
A few contributions.
And it's not often I say that in this place, I can assure you.
Your contribution with all quality.
Thank you, Speaker. Speaker, it is clear from today's debate that the construct of the bill is accepted and agreed. But understandably, there are some concerns about its impact, particularly in relation to accountability, staffing and local involvement in the development and identification of future services. I therefore welcome and thank members for all the points that they have made today, and I thank the Committee of Health for its engagement so far and its engagement in the future as well. But let me now turn to some of the specific issues raised in regards to members' contributions. In regards to specific points that were asked, in regards from the opening contribution from the Chair of the Committee asked a number of questions and a number of points. The first one was in regards to how the Department could ensure a standardised approach in placing regards to the approach to tendering and services across the health and social care trusts, because the trusts will continue to work with agreed current procurement guidelines, as the bill will not impact trust procurement or tendering processes. In regards to accountability, which was touched on by a number of members, and to provide that, was asked to provide that granular detail and accountability. The Department will be accountable to me for all of the functions delivered by the former board staff under the direction of my department, and the staff will be led by a senior civil servant at Deputy Secretary level, who will be directly accountable to the Permanent Secretary of the Department for the performance of the former board staff, and the Permanent Secretary is then accountable to me for the overall performance of the Department. There were queries also raised in regards to the business service organisation hosting arrangements, and a number of queries raised by Ms Bradshaw. As part of the hosting arrangement, the business service organisations again will be accountable to my department for the delivery of the HR services and support in relation to the former staff of the board who will be in their employment but who will be directed by my department in the operational discharge of their day-to-day responsibilities. A number of members raised, Mr Speaker, the loss of scrutiny and the question in regards to how this will change the accountability of expertise as a result of the loss of scrutiny by members of the board. I recognise that the expertise brought by all board members appointed through public appointments, and wish to place on record my thanks for the valuable work they do and will continue to do right up until the dissolution of the board. But following the closure of the board, the Department will be accountable to me for all of the functions delivered by the former board staff under the direction of my department, and the Deputy Secretary again managing the Deputy Secretary directing the former board staff will be a member of our top management group and the Departmental Management Board, and the delivery of these functions will be subject to the appropriate level of scrutiny. And as you will be aware, the composition of the Departmental Management Board consists as well of non-executive directors. Mr Speaker, in regards to contributions from the Vice Chair, Pam Cameron, in regards to, I think, her initial point, and also one that was raised by the Chair and other members, was that of multi-year budgeting and the funding of health, never mind the generality of the health service, and also the call for cleaner accountability. And I think the recognition that this is the first step for significant change across the health service in Northern Ireland, something that has been promised and proposed in many reviews, many documents that have been referred to by a number of members here today as well. And again, I would like to thank all our staff working across the health and social care system in regards for the work that they do and continue to do as we look to streamline these structures. The Deputy Chair talked about the changes to workforce and workforce shortages. The Health and Social Care Bill makes provision for the closure of the arm's-length body known as the Board, and the bill relates solely to that board and will not have any material impact on any other health and social care body. And I think that covers Ms Bradshaw's the inquiry about the PHA as well. The PHA will not be affected by any change in this piece of legislation, because the new operating model will see the former staff of the board continue to undertake those functions, albeit under the direction of the department. This approach, while streamlining structures and reducing bureaucracy, will provide for the continuity of service, thus minimising risks of the overall system and the staff will be employed by the business service organisations, but as I said, will be led by a senior civil servant at grade 3. And all staff, and I want to make that clear to members and staff who may be listening to this, will retain their health and social care terms and conditions throughout employment by the business service organisation, and no health and social care board staff will be made redundant as a result. A programme of work is underway to build capacity and capability within the board structures. Members have raised about consultation and engagement. The staff side forum has been in place since June 2018 to facilitate trade union engagement and consultation on the change programme, and the forum currently meets on a bi-monthly basis. And additionally, trade union representation is an integral element of the project work strands set up to co-design new ways of working. Cara Hunter raised a number of queries and a number of specific questions, one in regards to the lack of nurses, which was raised, although Speaker not currently connected to this bill or in any way change. I will point out that part of the return to this place over a year ago was the commission of 300 additional training places for nurses over 3 years. That has commenced. Those training places are in place, are funded, and are working through the process of training. A number of issues that was raised, I think, by Ms Hunter and Ms Carl McCullen as well, was regards about the regionalisation versus centralisation. I think one of the very clear approaches that I have taken since coming in here, we have looked through the pandemic about the regionalisation of services rather than simply centralising everything towards Belfast, because we have seen the need of using all our structures, whereas in the past there was always a perception that we would end up closing something or looking at downscaling something, whereas we've realised now that the regionalisation approach is actually something that will benefit us coming out of the pandemic. A number of members raised, and Cara Hunter I think was the first one to raise, in regards to the local commissioning groups. The bill, in effect, the closing of the Health and Social Care Board will remove the statutory requirement for local commissioning groups. However, Mr Speaker, let me be clear, whilst the bill will remove the construct that is local commissioning groups, it does not in any way detract from the need for local input and intelligence into our planning processes. And as I've mentioned, work has begun to develop a new way of planning services based on an integrated care approach. A key part of that process will be taking on the learning from the local commissioning groups and bringing forward a mechanism to ensure the continuation of local input. Ms Hunter also talked about the impact on rural communities, and I will make clear that the statutory obligations of equality screening and impact assessments have been observed in the development of this bill. An equality screening, a human rights impact assessment and a regulatory impact assessment were all completed without any impact being noted. In regards to Mr Chambers' contribution in regards to this being a small but extremely significant bill, I think he's right, because it does set a train of direction that many other ministers have talked about and brought forward proposals, but this will see the first significant step in making a major structural change to health and social care here in Northern Ireland. There have been many reports, many studies produced, but this is the legislation that starts to enact some of those recommendations. And again, Mr Chambers referred to our party policy in regards to looking at the regionalisation or the need of one trust. That is a conversation that has been had many times. It's not part of this bill, but as I said in an earlier response, I think what we've seen through the regionalisation of services, we really see the benefit of all those trust specialities coming together and working collaboratively together, especially over the past year, has benefits, not just for the delivery of service, but especially for the input for and output for our patients, who are at the centre of everything that we do. In regards to Carol McCullen's contribution, although she noted that this bill is technical in nature and she felt that sometimes she could put down her screen, I note from her contributions that at no time she did, and she has read the detail of this bill, as I would expect her to do. And I think that is highly identified in regards when she talks about the transfer of powers and all those functions that are especially covered in Schedule 2, when it shows the small impacts that this bill does have, but the wider implications of what it does by those transfer of powers, because it is about achieving better outcomes for our citizens and for the patients that are in it. She also asked about the public assurances that I could give, and I think she was right. I was shocked when I saw the headlines of yesterday's paper. It's not something I expected, and not something I expect. And she will be aware, since coming into this office, I've instigated 3 public inquiries in regards to where I see the challenge and the accountability that does need. But I will also highlight to her the fact that in my opening statement in regards to the assurances of work that has started or has been done, this bill also covers that the department will continue anything being done by or to the board, and that includes legal proceedings following the board being closed. So all that responsibility will transfer from the Health and Social Care Board to my department, and that will be where I think the right place for it is, and it should sit. And again, Carol raised the legislative provision for local input on setting priorities. Why there is no legislative provision for setting priorities or local input, the closure of the Health and Social Care Board does result in the end, as we've said, the requirement for the local commissioning groups, and that actually requires my department to produce a commissioning plan direction and the need for the development of a subsequent commissioning plan, so all that then becomes public. This does not, however, detract from the need to ensure local input into the planning process and the need for the setting of strategic priorities and indeed the outcomes the system will be required to deliver. And this will continue, however, this does not provide the opportunity to improve on the current process, and this has now been taken forward as part of the programme of work, which is looking at how we can plan our services differently, because it is imperative that we allow time for that new way of planning services to be developed and tested before placing anything in statute. And the need for legislation will be explored as work of these developments will continue to form part of the future consultation. In regards to Paula Bradshaw's comments as well, in regards to the lack and I suppose the vacancies that are still there within BSO, that is a challenge that we continually face to fill those positions. Our recruitment and processes have actually improved, and the lack of, or the number of vacant positions have actually decreased significantly over the last number of years, and that work continues to be progressed through, as I said, the recruitment of new nurses and other staff as well. There's now regular advertisements put out in regards to a number of positions that are available through BSO, through all our trusts and through our health and social care boards as well. And as I think I covered, the PHA is not included or touched in any part of this bill, and I thank her for the acknowledgement for the work that the PHA does. In regards to the specifics, I think she raised in regards to how the commissioning or this work is not cross-cutting or controversial. It's not, because none of the services are mentioned in this bill or covered currently by the Health and Social Care Board are controversial or cross-cutting. I think the debate that she refers to yesterday does refer to the potential commissioning of a service that is cross-cutting and controversial, has been legally advised to myself as Health Minister that it is, and that is why it is a decision for the entirety of the Executive to take, not just myself, no matter what was said by some in this House yesterday. Mr. Speaker, I think in summing up for members' contributions, if there are questions which I haven't answered, I appreciate that a number of questions have been raised which I maybe haven't had time to address or the detail to address, and I'll undertake to review answered and write to members on these issues. This debate has been invaluable. It's an invaluable opportunity for me to hear first-hand the views of members on this piece of legislation and on a number of other issues as well, and I would like to wish the committee well as it begins its crucial scrutiny of this bill. And Mr. Speaker, I support this bill moving to second stage.
Thank you, Minister. And the question is, the motion standing on the order paper be agreed. All those in favour say aye. Contrary, no. The ayes have it. The ayes have it. That concludes the second stage of the Health and Social Care Bill. The bill stands referred to the committee. Thank you all. Can members please take a ease for a moment or two?
Thank you, members. The next item on the order paper is a motion on welfare support. Can I ask the clerk to please read the motion?
That this Assembly highlights the need for a fair and sustainable welfare system in Northern Ireland, notes with concern the deep economic impact of the pandemic and resulting restrictions, stresses the need to meet any related increase in eligibility for or uptake of benefits and other forms of financial support for those made redundant or suffering ill health as part of the recovery from COVID-19, expresses grave concern that the review of welfare mitigation measures provided for in New Decade New Approach has not been taken forward as a priority by the Department for Communities, and calls on the Minister for Communities to accelerate that review and to ensure that appropriate and ongoing welfare support is made available to households hardest hit by the effects of the pandemic as the Executive charts a course to recovery.
Thank you. I call Mr Alex Easton to move the motion.
Thank you, Mr Principal Deputy Speaker. I move.
Thank you. Business Committee has agreed to allow up to 1 hour and 30 minutes for this debate. The proposer of the motion will have 10 minutes to propose and 10 minutes to wind. One amendment has been selected and is published on the Marshall list. I call Mr Alex Easton to open the debate on the motion. Mr Easton.
Thank you, Mr Principal Deputy Speaker. In the short time I have, I would like to cover a range of points, including the number of new benefit claimants we are witnessing, the continuation of welfare mitigation measures for the next financial year, and where we are with the review. We all know that the financial impact of the pandemic has been severe and that ongoing restrictions are deeply damaging to our economy. These points are well known and do not need to be repeated at length. However, there are several points that I wish to make regarding the depth of the economic crisis we are now witnessing. I will state at the outset that I understand the constrained financial situation that the Department faces. Nevertheless, I am especially concerned about staffing numbers involved in processing claims. The Department failed in its bid for more staff, and current numbers are below what would be required under normal circumstances. The longer that these restrictions last, the more people that will be out of work and needing to access social security. I have seen estimates of around 60,000 more new claimants expected. This is the result of a Sinn Féin Finance Minister failing to provide the funding for more staff. It is obvious that the increased demand and lack of staffing will lead to a longer processing time for claimants. 5 weeks is already a long time to wait, especially given the current circumstances, and so the prospect of individuals, particularly young people who we know are more likely to face unemployment, being made to wait 7 or 8 weeks for their first payment is unacceptable. I would also like to touch on the amount of people waiting on PIP appeals, amounting to thousands. This is totally unacceptable. There is going to have to be a concentrated effort to resolve these backlogs, and staffing levels are contributing to this. This is also the result of a Sinn Féin Finance Minister failing to provide the funding for staff. Thinking particularly of those in the private rented sector also, this delay could push people into debt and further exacerbate the mental health problems brought on by lockdown. There are an increasing number of families struggling to get by, and I am deeply concerned that this budget not only does not meet the needs of the present economic situation, but also will, moreover, see more missed support that are accustomed to in normal times. I find that the expected cuts to Advice NI particularly troubling. I also note that the Northern Ireland Affairs Committee in Westminster recommended the continuation of these advice services. The 1.5 million of planned cuts will see some of the most vulnerable families hit the hardest. The independent support services that Advice NI provide are incredibly valuable in making social security accessible to everyone. They have been doing great work assisting with the COVID-19 community helpline over the past year, and so if they are to lose over 40 staff, as has been reported, then a vital public service will be lost. This is the result of Sinn Féin's Finance Minister failing to provide the funding for the Department, which is why we are minded to support Mr Carroll's amendment, subject to what the Minister says later on. Following on from these points, Mr Speaker, I just want to put on record my fear that the Department is not providing funding for the Job Start Scheme and other back-to-work programmes. Without these programmes, less people will be helped back into the workplace, and therefore the demand for benefits will remain high. On the mainland, over 120,000 young people have benefited from the Job Start Scheme, and I find it completely unfair that young people in Northern Ireland are not going to receive the same opportunities. This is again the result of a Sinn Féin Finance Minister failing to provide the funding. We already have a well-known brain drain problem with many young people from Northern Ireland moving over to the rest of the United Kingdom, and I worry that this lack of funding will only exacerbate this problem when everything should be done to prevent it. It is also particularly alarming to hear the Department's own assessment of this budget, Mr Deputy Principal Speaker. Even it has acknowledged that it will struggle to maintain the same level of services that is provided before. And this is occurring when demand will be higher than ever before. Not only that, but the Department has admitted that it will struggle to assist the economy in its recovery from COVID-19 and to fulfil its obligations under the new decade new approach. The equality impact assessment of this budget moving forward is very negative. Note that the youth employment is already over 11% and only going to rise, without the benefit of the schemes I mentioned previously. I would also like to highlight that people with disabilities will be deeply impacted by the inability to provide this economic intervention and will likely find themselves further from work than they did prior to the pandemic. I would now like to turn to the impact on those already receiving welfare support. I think that those in receipt of, for example, the bedroom tax and 2-child cap medications require certainty. There are almost 4,000 families here negatively impacted by the 2-child cap. Just under 40,000 households are affected by the bedroom tax. This is through no fault of their own, but the lack of appropriate social housing being available to them, and they should not be punished for that. We are now coming to the end of the financial year, and I appreciate that the Minister has committed to continuing payments beyond the end of March. However, more certainty for people is required, and the sooner that legislation and regulations are brought to this place, the better. I'm also aware that regulations are to be brought forward to close loopholes that sees families missing welfare mitigations. I would press the Minister to bring these forward as soon as possible. The review of welfare medications committed to in the new decade new approach will give those impacted more certainty, and it is worrying to see how little it has progressed. It is my belief that this should be an absolute priority for the Minister, and that she should engage both with those families affected and also with relevant groups. I'm thinking particularly of the Cliff Edge Coalition, for example. The review needs to take into account of those who are being most seriously impacted by the economic changes we are seeing, including people with disabilities, young people and women. The Minister has also not yet been able to tell the committee what specific issues are going to be addressed in the review. This lack of clarity is only adding to the stress that families are facing at this time. Just before I finish, I would like to touch upon a few of my concerns. I've spoken on terminal illness before in this Assembly, and I'm therefore deeply disappointed that funding has not been found to take forward the ending of the unacceptable 6-month criteria for individuals seeking to access welfare support. I'm also disappointed that there will be no increase in funding to the Support of People's programme for the Housing Executive. This is the result of a Sinn Féin Finance Minister failing to provide the funding to the Department. This scheme helps almost 20,000 people across this country, does extremely valuable work in helping them to live independent lives, and deserves more funding than it's going to receive. I think that the lack of attention to this scheme in this budget will be felt particularly by homelessness services, which have been vital during the pandemic in providing emergency accommodation. To conclude, Mr Deputy Principal Speaker, the vaccine rollout is giving people hope that the end of the pandemic is within sight. However, with that in mind, we have to keep in mind the incredible damaging impact of ongoing restrictions to many in society. Many people are going to be laid off and in need of benefits before and after the pandemic through no fault of their own. It's only their right that our welfare system is there to support them in a timely manner. Not only that, but to assist them in getting back to work, which is widely recognised as the most significant factor in alleviating poverty. The extension of the welfare medications has been widely recommended, has been committed to and must be taken forward. The review is much needed and has been committed to and must be accelerated. It is clear that the budget will not stretch as far as is required. I would therefore call on the Minister to do all that she can to lobby for increased funding, ensure that ongoing support can be provided to the most vulnerable in our society. Not only that, but I would press her to take forward the review into the welfare medications as fast as possible, as the lack of progress is frankly unacceptable. Thank you, Mr Deputy Principal Speaker.
Thank you. I now call on Jerry Carroll to move the amendment that stands in his name.
Moved.
Thank you. Mr Carroll, you will have 10 minutes to propose and 5 minutes to wind. All other speakers will have 5 minutes. Please open the debate on your amendment.
Thank you very much, Mr Deputy Speaker. I'm glad to have the opportunity to discuss and put a spotlight on the state of welfare support in the Assembly today. We have been inundated with messages of support from people and organisations from all backgrounds and communities right across the North for our amendment to today's motion that seeks to restore threatened funding for advice support workers. It's often said, Mr Deputy Speaker, the measure of any society should be judged on how it treats its most vulnerable members. We believe the Stormont Government has refused to protect the most vulnerable in society. Instead of championing the needs of the vast majority here from all communities, the Stormont Government, present and previous, has put the interests of the Tories, the politically connected and big corporations first. Instead of standing up to the Tories, the Stormont Government has rolled over and sought to justify its own pathetic decisions. Instead, isn't it rather today the hypocrisy of all hypocrisies that we're discussing a DUP motion criticising the Sinn Féin Minister for Communities with the responsibility for the state of our welfare support system? The motion calls for a fair and sustainable welfare system in order to protect households hardest hit by the effects of the pandemic. And I would say that the DUP's concern today for those trapped in our dysfunctional and punitive welfare system appears to be devout and pious, you may say, but the reality is it was the DUP and Sinn Féin, along with Alliance, who voted to implement destructive Tory welfare reforms that have done so much damage to our communities. In fact, over the last 20 years, all the Stormont Government parties, nationalists, unionists, have played a crucial role in making our welfare support system more punitive and harder to access. The facts are that the introduction of Tory welfare reform led to a direct increase in poverty across all our communities. It led directly to increased child poverty. It has led to increased family poverty directly as well. This is utterly, utterly shameful. And this all happened, Mr Deputy Speaker, before the pandemic. And the mitigation measures didn't protect the vulnerable and low-paid enough. Otherwise, poverty and deprivation levels would have decreased, and the opposite happened. And the growing number of people dependent on food banks in the Falls, Shankill, across Belfast and the Fountain and the Craig, and across Derry, Ballymena, Coleraine, Portadown, Craigavon, Newry, and the list goes on, is the evidence of that. And the effects of the pandemic recession has meant many more people need access to welfare support and food banks. And the pandemic has worsened all the deprivation and social inequality trends that the DUP and Sinn Féin will probably tell us they're concerned about today. It is utter nonsense. The Stormont Government is responsible for the fact that we don't have a fair welfare system. We need to completely reverse welfare reforms that are causing so much damage to people. So today, Mr Deputy Speaker, it's crucial the Assembly votes to stop plans for the Department for Communities Minister to slash funding for advice service workers and centres, and that's what my amendment seeks to do, and I hope people support it. It makes no sense for the Executive to withdraw funding for advice service workers at a time when tens of thousands more people need help with their benefits, which is obviously hard to navigate. Our advice centres are already completely overwhelmed. Advice workers are exhausted, and news of this threatened cut has left them further demoralised, and they've told me so in the last day. What message does it send, Mr Deputy Speaker, to the people in all our communities who need help that the Executive is going to slash funding for the workers who will help them access benefits so they can feed their children and keep the heat on? The work of organisations such as the Belfast City Way Tribunal Service that my own constituency office uses, Advice North West, South Tyrone Empowerment Project and many, many others has been absolutely crucial in protecting people and helping people through the pandemic. We need to fully resource our advice providers to make sure everyone who needs help is able to access it, but we need to go much, much further. We need to close the bedroom tax loophole. We need to close the benefit cap loophole. We need to end the 5-week wait for universal credit and get rid of the 2-child tax credit limit. We need a full review of the present mitigations, and if we are serious about protecting people during the pandemic, we need to create a properly funded support scheme that gives people the ability to self-isolate and that force them to choose whether to do so or not. And the present discretionary support scheme simply does not work. Ultimately, Mr Deputy Speaker, we need to radically change the priorities of the Stormont Government and Stormont Executive and begin to put people first as promised in the new Decade New Approach Agreement. I look forward to today's debate and I ask members to support my amendment. Thank you.
Thank you. I call Ms Karen Mullen.
I welcome this motion on welfare support brought here today. Since the introduction of the draconian so-called welfare reform measures by the Tory government as part of their misguided austerity agenda, Sinn Féin has been firmly opposed to cuts aimed at punishing rather than protecting those in receipt of welfare benefits. The Fresh Start Agreement in 2015 established an unprecedented welfare package of $585 million that Sinn Féin argued and fought hard to have established. I am very proud of the role of my party, and particularly the late Martin McGuinness, played in achieving it. The measures need to be maintained and built on. There was a time when the party that now proposes this motion was utterly opposed to any form of mitigation that would set us distinct from the cuts agenda being played out in Britain. Nevertheless, we are in a different time, and I very much welcome the cross-party support that clearly now exists for the mitigations, and hope that that support extends to prioritising the funding at the Executive without delay. In January 2020, we all signed up to New Decade New Approach. Again, my party ensured that welfare mitigations was included. Unfortunately, we have yet to see the British Government live up to the commitments they made in the New Decade New Approach, not only on welfare, but on other areas. Pre-last Caoimhe, weeks into the re-establishment of this Assembly, we were hit by COVID. The Communities Minister was quick to act to support the most vulnerable, both practically and financially. As MLA for Foyle, I am grateful for the $1.5 million given to Derry City and Strabane District Council for the COVID Community Support Scheme, alongside the central support of access to food packages and support for fuel, along with interventions on well-being. I want to acknowledge the work and support of the community and advice sector in delivering these vital supports. The Communities Minister also introduced a number of changes to the social security system to make it easier for those affected by COVID to access financial support during the crisis. In particular, enhancing the discretionary support fund to provide a grant payment for short-term living expenses for those affected by COVID and experiencing crisis or financial hardship. She later increased that level of award available, raised the income threshold and included students. Mitigations and easing the benefit system, while welcome, cannot eradicate poverty. If we are serious about tackling poverty, we must identify the root causes of poverty, and I welcome the work of the Minister and her department, along with the members of the expert panel and the co-design working group who are developing a long-term anti-poverty strategy. There are clear priorities that must be explored as part of any review, and I want to commend organisations such as the Human Rights Commission, Cliff Edge Coalition, Advice NI, Marie Curie and so many others who have invested time and effort raising awareness of these and highlighting their impact. Over the last number of weeks, I have met with some of those organisations, and they are rightly concerned about further cliff edges, timeframes and lack of budget for extending the welfare mitigation package. I welcome the Minister's commitment to closing the loopholes within the bedroom tax and the benefit cap mitigations. I am heartened by the support from the parties here today for the mitigation, and I hope this will be consistent and evidenced when it comes before the Executive when the budget is being decided upon. In conclusion, pre-last Caoimhe, the Minister has clearly said in this chamber that she fully supports the independent advice sector and that she will find the money in the budget to cover the $1.5 million. For that reason, we will not be supporting Mr Carroll's amendment, which is an attempt to grab a cheap headline. We will be supporting the motion and look forward to the proposers of the motion prioritising these issues in the budget negotiations at the Executive and supporting the Finance Minister also.
Thank you. I call Mr Mark Durkin.
Thank you, Mr Principal Deputy Speaker. A fair and sustainable welfare system here is crucial, now more than ever, as society prepares to address the emerging challenges brought about by the COVID pandemic. Of course, in the past, the SDLP made attempts to amend the Welfare Reform Bill to remove its most draconian elements, while others within this chamber voted against those amendments, and we got the Welfare Reform Bill in its full and devastating glory. We do welcome that a mitigations package was agreed to the tune of £500 million, and I welcome the fact that it has shielded so many from the worst impact of welfare reform. But we can't pretend that there has been none. From the disastrous rollout of universal credit and its intolerable 5-week wait, which has led to increased hardship and debt for many families, to the bedroom tax that we were promised would never grace our doorsteps, currently squeezing over 225 households. Not only did the DUP, Sinn Féin and Alliance rubber stamp the Tory Welfare Reform Bill, but they also left people here vulnerable to further attack, against which the mitigations provided no cover, including the benefit cap and the 2-child rule, which have had a devastating impact on many low-income families. For these reasons, I welcome and support this motion and would implore the Minister to bring forward not only an extension of the existing mitigation package, but an improvement on it, closing the existing loopholes. I know this is something that the Minister is seeking to address urgently, because ministers have told us consistently for the past 15 months that they are dealing with this hugely important issue urgently. In the interim, people have been pushed to another cliff edge, while others have fallen off the precipice completely. The review of welfare mitigations must be progressed as a priority, but the need for scrutiny by ourselves and, importantly, by experts from within the sector must be afforded in line with the principles of co-design. Sadly, more and more people are falling into the benefit system, and these numbers are set to rise dramatically as the economic impact of COVID becomes clear. It's vitally important that there is a safety net for these people, yet the safety net is only as good or as useful as the people holding it. The DFC workforce has witnessed a 127% increase in universal credit claims. 1,400 new staff were needed to address this growing demand, yet none have been recruited, putting further pressure on overstretched workers and resulting in increased hardship for those waiting to have their claims processed. It is crucial that individuals and families facing financial hardship can access the vital support to which they are entitled and that they so desperately need. The independent advice sector plays a hugely important role in helping people do this, as trained professionals and sympathetic people who go above and beyond to help those in need. The kite flown in the draft budget that this already under-resourced sector would suffer a £1.5 million cut was grossly misjudged. It was a slap in the face to advice workers, causing them massive anxiety at a time when they are under unprecedented pressure. So certainly I support the sentiment of the amendment, although I'm not entirely sure of its accuracy, given that I never thought that the cuts inclusion in the draft budget was anything more than a cynical political exercise. The motion makes reference to financial support for those suffering financially due to COVID. We had submitted an amendment that noted with concern the very limited financial support provided to those on a low income who have to self-isolate, which is having a detrimental impact on reducing community transition of COVID-19. My amendment wasn't accepted, but I will reiterate our call for a sufficient self-isolation grant, rather than the discretionary support grant hybrid we have here that doesn't help people enough and it doesn't help enough people. This is borne out by the shameful fact at a time when we have never had more people in need that the Minister handed back an underspend of £2 million that was meant to protect people against poverty and its effects. We have to make a decision. Can we afford a system that protects people from poverty? Mr. Principal Deputy Speaker, we can't afford poverty and the problems that arise as a result of it.
Thank you. I call Ms Kelly Armstrong.
Thank you, Principal Deputy Speaker, and thank you very much to those who have brought forward this motion today. I'm not going to start getting into party political politics over this. The simple fact is that after today we have 2 plenary days before the Easter recess, before the end of March, and people are still not clear out there what welfare mitigations are going to look like beyond the 1st of April. We have all talked and worked with the Cliff Edge Coalition, academics who have written to us. They've written to the Department and to the Minister too. We all know exactly what the problem is. COVID has been devastating for so many people who have had to enter the benefit system for the first time. And I hope as a society that we recognise that being on benefits is not simply sitting at home and scratching yourself. It's actually about having to fill out forms, having to account for where you are, having to live in poverty. And it has been extraordinarily difficult. I recognise the amendment that has been made today about the advice sector, and what I would like to say about the advice sector is they are part of those heroes that have helped our society throughout COVID. When I came to be a politician, I looked forward to helping people, but I didn't realise just how many people would come through my doors looking for advice support. And I too turned to those partners who have the expertise, who work with people on a daily basis about the details, the complexities of our welfare system, and help them to get through that. So today, as has been mentioned by Mr Durgan, I do have a difficulty with the amendment, but I will be supporting it because I believe that when the Minister and the Department comes forward with welfare mitigation updates, that there will be payment there for the advice service. I expect there to be payment there for the advice service because of the increasing number of calls and cases that they are working on. As I said, it's two plenary days left before the Easter recess. I find it quite difficult, and I feel quite guilty that we haven't been able to clarify for the general public out there exactly what's happening with their welfare mitigations. I know that legislation has been taken to the committee about the social sector size criteria, also known as the bedroom tax, that there would be an extension to that. But as Cliff Edge Coalition and many others have highlighted, we still don't know about the benefit cap loophole. And just quickly to read that. Benefit cap, for those who don't know, affects those individuals who were not in receipt of the relevant benefits in 2016 when the welfare reform mitigation package was first introduced. They're unable to access mitigation from the benefit cap. In addition, those who have had change of circumstance have lost access to the benefit cap mitigation. The number of households capped has risen to over 1,000. A significant reason for this impact is, of course, COVID-19. The end of the 9-month grace period for the first time universal credit claimants at the end of 2020 and the ensuing economic crisis and anticipated end of the furlough scheme is expected to see this figure increase. That cap costs families £200 per month. The bedroom tax loophole is another one. It's £50 per month. Universal credit 5-week wait, as has been mentioned by others, is causing debt that people did not expect to have at a time when they're in crisis. The universal credit 2-child limit, to be honest, just doesn't make sense for Northern Ireland. It means then that for a third or additional child, a family will lose out on £2,780 per child per year. The local housing allowance cuts in the private rental sector is also having difficulties for low-income households living in the private rented sector. We all know this. The Minister knows this. The Department knows this. We have a society that is living with poverty, not resolving poverty. Also, it's been 5 months since this place took part in a motion about terminal illness that has been brought up by Mr Easton. We all agreed, cross-party agreement in this House, that the 6-month rule was to be removed and the Minister was to bring forward immediate legislation to remove the 6-month rule. That hasn't happened. I appreciate that DWP has not made a move on this, but this place can. It's time to be fair to people. It's time to recognise those advice sector heroes. It's time to work together, not pulling each other apart, to help people survive COVID and what's coming towards us with the economic crisis in the new financial year. As Alliance spokesperson for communities, I joined communities from infrastructure just over a year ago. And I have to say, I found it to be one of the most challenging departments and challenging issues to work on, because they're very personal. It's about people. I really don't envy departmental staff or the Minister for her work. It is extremely personal, it's extremely emotional, it's extremely difficult, but we need to end that uncertainty for people. And I would ask the Minister to please, if she could, let us know what the welfare mitigations will be.
Mr. Robin Newton.
Thank you, Mr. Principal Deputy Speaker. I'm obviously pleased to support this motion, and this motion has been brought forward out of frustration and a strong desire to see progress by the Minister for Communities, progress for all sections of our community, especially the many who are suffering real disadvantage and living in social need. The frustration is also caused, Mr. Principal Deputy Speaker, by the lack of progress in matters that are on a daily basis impact on the lives of families and individuals. And the Minister needs to help, but is currently failing those who are unemployed, those who need job training, opportunities to get them into a job, and the Minister needs to help families and individuals struggling within our benefit system, as previous speakers have said. When many millions of pounds sit with the Minister for 10 years, and when the money should be providing upgraded football stadia, plus supporting construction jobs, and when the Minister sends her plan with no budget, no targets, no objectives, no outcomes, it would be irresponsible not to raise these matters in the Chamber. The Minister has many talented, many experienced, many committed departmental staff. She has, in fact, a super team. Therefore, the lack of progress is all the more worrying. Ministers within other departments have rolled out their detailed and measured plans. The Minister for Communities needs to do the same. The Minister needs to show leadership. It is totally unsatisfactory that no progress has been made on the many important matters within the Minister's area of responsibilities. And let me quote from the NDNA document. The Executive will extend existing welfare mitigation measures beyond March 2020, when they are currently due to expire. And let me further quote. A review of welfare mitigation measures will be taken forward as a priority, with any agreed measures in place before March 2020. Now, let me refer to the Minister's progress, rather lack of progress, on the review of welfare mitigations. The Minister recently indicated, and I quote, the specific issues that will be considered as part of the review of welfare mitigations have not been finalised. And on the details of the format and planned engagement, the Minister said again, and I quote, these will be shared with the Communities Committee at the earliest opportunity. There has been no contact from the Minister asking for an item to be placed on the Committee's forward work plan. The lack of progress in the interim, the Minister has settled for the use of 4 instruments only to extend existing measures. And I have to say, Mr. Durkin is right. Everything is being addressed urgently, but urgency never comes. This is entirely unacceptable. Little or no progress has been made towards the review of welfare-supported mitigations. With this lack of action, the Minister is failing families at a time of deep uncertainty and great societal upheaval. The Minister is treading water. And what we need from the Minister is to see an ambitious timescale for introducing new mitigations. Having previously collapsed the Assembly, leaving claimants bereft of any hope of greater support, it is totally wrong that Sinn Féin should preside over another cliff edge for vulnerable households, as the effect of the pandemic on jobs and incomes bites even more severely. With no progress towards a strengthened set of welfare mitigations, the risk of adding further hardship to those in desperate need of support and protection is high. I will conclude with this, Mr. Speaker, Mr. Principal Deputy Speaker. The frequently used Sinn Féin phrases, it's all about Tory austerity. The allocation from Westminster isn't enough. We need more money. The government don't give us enough time to spend money. These are shallow and counterfeit, Mr. Principal Deputy Speaker. And in an answer to a question from me, the Minister confirmed that in each of the previous 3 years, her budget has increased on each year. Thank you, Mr. Principal Deputy Speaker.
Thank you. I call Mr. Andy Allen.
Thank you, Mr. Principal Deputy Speaker. Since I got involved in politics back in 2015, I repeatedly engaged with constituents right across the spectrum, not just in East Belfast, but right across Northern Ireland. And quite often, they understand what was attempted to be achieved by the streamlining of our social security system. If we look at our legacy system, what did we have? We had income-based income support, we had income-based employment support allowance, we had industrial injuries, it was unwieldy, there were so many different benefits, it was difficult to navigate. And it made perfect sense. Well, on the surface of it, it made perfect sense to streamline that system, the universal credit. But I believe what we have in reality is not that streamlined system. It is not that system that constituents and everyday people out there in society find it easy to navigate. On a daily basis, my team and I support constituents who find it very, very difficult to navigate the universal credit system, who are unable to work with IT, and there seems to be no measures in place, and we're repeatedly having to engage with the universal credit team, who I might add are terrific. They do repeatedly step up to the mark, and I pay credit to them. That is not them. They're implementing this system, and it's not their policy. They're implementing a system that they have to work within. The argument around the welfare reform mitigations has been well made. It's one we've heard for many, many years. We know what mitigations may be working. We know what aren't. The various groups, the Cliff Edge Coalition and others, have presented to the Communities Committee on many occasions, highlighting and demonstrating what additional mitigations they feel are required. However, little to no action has been taken on this. Minister, I too am frustrated, and I understand why the members have brought this motion forward, and I thank them for bringing it forward, because on a daily basis I am seeing the impact of welfare reform on my constituents and on Northern Ireland as a whole. And it's not fair just to blame it on Tory welfare cuts and blame it on others. What are we doing as an Assembly to address that? What are we doing, Minister, to address fuel poverty? What are we doing to address the long-term effects of the impact on people's lives? Minister, I welcome, for example, the heating payment that was brought forward in response to COVID. Whilst I did not necessarily agree with the wider policy, I understand that individuals' heating costs had risen. However, short-term solutions to a long-term problem. Minister, perhaps today you will set out what the long-term plan to address the impact on individuals will be. If we look to Job Start, Minister, and the labour market interventions, no allocation, and the draft budget does present a bleak situation for your department, and I don't envy you, Minister, but what I will say, and it's easy to sit on the sidelines and critique, I will give you my full support. I will assist you from within the committee in any way that I can to support those people who need the support in our society. But Minister, can you advise, do you have the jump leads at the ready to kickstart Job Start? Because where is it? The amount of people I spoke to, the catchy sound bites and the phrases, I can throw them out here, that's well and fine, but the reality of it is, the true reality of it is I spoke to many young people who were preparing to avail of that scheme, and their hopes were dashed when it was the rug was pulled from under them. Where do we go with that? In terms of the amendment by the member across the way, again, like others, I don't fully understand the rationale. The Minister is already on the record in stating that she's firmly committed to the independent advice sector, and I do believe that funding will be found. I pay tribute and credit to the independent advice sector also. I utilise them in my own office, and I know from being an MLA, when I sought out training myself to navigate the unwieldy and difficult social security system, it is not easy. And I have a basic understanding and knowledge of how to support and signpost constituents through the social security system. But our independent advice sector have additional layers of expertise and professionalism that is often needed. Minister, I would support the calls for an urgent review of the welfare reform mitigations and recommendations, proposals being brought forward to the committee thereafter. Perhaps also, Minister, if I note your legislative timetable, it had been indicated to the Communities Committee that you'd hope to bring legislation forward on the social sector size criteria by February 2021. Another target missed. I do recall, obviously, that a document through a written question that I tabled, your department has indicated that a document or legislation has been shared with the Executive and responses received. Perhaps you might be able to provide a definitive timeline as to when the Communities Committee and other colleagues around this chamber will see that legislation, and also when we'll see the regulations that will be brought forward to amend the loopholes. Thank you.
Thank you. And I was loath to interrupt the member because I could see the passion with which he was speaking on the issue. However, if I could remind all members that comments should be directed through the Chair. Minister shouldn't be addressed directly as Minister on the floor of the Assembly. I call Mr Pat Sheerin.
And I welcome the opportunity to speak on this important debate today. And I spoke recently about the campaign the Manchester United footballer Marcus Rashford had launched to secure free meals for disadvantaged children in England while they weren't actually in school. And the English media eulogised and lionised Marcus Rashford as a result of that, and rightly so. And he also got a gong in the Queen's Honours list, and the Tory government was embarrassed into a humiliating claim down on the issue of free school meals. So I was just wondering, why did we never think of doing something like that? And then I realised, well, we did. The Finance Minister made funding available for holiday hunger long before Marcus Rashford's campaign. You wouldn't have known it from the media coverage here, nor from some of the politicians who sit in this Assembly, but the Executive were well ahead of the curve around the issue of holiday hunger. And another issue that has made real and meaningful difference to people's lives has been the issue of welfare mitigations. No, we weren't able to withstand the full force of the Tory welfare cuts, but we certainly blunted the worst excesses of them. In fact, the £585 million welfare mitigation package was a remarkable achievement, and one that's the envy of other jurisdictions, particularly Scotland. And I'm very proud of the role Sinn Féin played in protecting the most vulnerable in society. And sometimes I think I'm living in a parallel universe when I hear some of the comments and the attacks made in here today on Sinn Féin, because it was Sinn Féin who stood out alone, out in front, refusing to accept the Tory cuts, and who were responsible for the mitigation package of £585 million that was secured. And standing up for the most vulnerable in society is part of who we are. And Deirdre Hargey emphasised that in the first few weeks of her tenure as Communities Minister, when she said her role, and I quote, is to stand up for the poorest and most disadvantaged in society, to target resources towards those most in need, and ensure that we have a rights-based approach to the provision of services. In that context, I welcome the commitment of the Minister to carry out a review of the Discretionary Support Fund, which was set up by the Executive a number of years ago to support people experiencing financial hardships. The pandemic has shown that this scheme is needed more than ever, but that it must be refined and streamlined to make it as accessible and effective as possible for people when they need it most. The review is evidence that the Minister is listening to concerns and is committed to making improvements. The Minister has also acknowledged the importance of the provision of advice support services and is committed to ensuring these services continue. And I agree wholeheartedly with the comments of Kelly Armstrong in her assessment of the role that the advice sector has played during this pandemic. We owe them a massive debt of gratitude. And on the broader issue of the need for a fair and sustainable welfare system, this pandemic has highlighted many flaws that currently exist, and there are clear priorities that must be explored as part of any review. And I want to commend the Human Rights Commission, Cliff Edge Coalition, Advice NI, Marie Curie and many others that have been mentioned by many of the speakers here today, and who have invested time and effort raising awareness of the problems that exist. And I welcome the Minister's commitment to review the issues of the bedroom tax and the benefit cap. There's much learning to be taken from the many changes brought in as a result of the pandemic, such as telephone assessment and the enhancements of the discretionary support fund that I've already mentioned. But the real priority at the moment should be to extend the reach of the mitigation package in a real and meaningful way, and that will require proper resourcing that needs to be agreed by the Executive. I welcome the support here today for the mitigations, and I hope that will be followed up through at Executive level. It's just a pity there wasn't the same level of consensus when the original mitigation package was being secured.
And now, if we can call up Mr. Justin McNulty via Starleaf. Mr. McNulty.
A society will be judged, as others have said, by how it treats those people who are most vulnerable. And this pandemic has pushed people into the benefit system more than ever before. And you cannot put a figure, you can't put a number on the amount of people who have been impacted. The Department for Communities failed in its bid for more staff from the Sinn Féin Finance Minister. Why? The welfare mitigations extension that was announced in New Decade New Approach, 15 months on, still no further, despite the fact that we're 2 weeks away from a cliff edge when the current arrangements are due to end. The legislation to close the bedroom tax loophole has not been passed. This is impacting over 227 households who are losing on an average of £50 per month, leading to significant rent arrears and increasing the risk of housing stress and homelessness. The legislation to close the benefit cap loophole has not yet been passed either. All of those impacted families with children, and 77% of those are lone parents. By October 2020, 1,000 families were impacted, but that number is likely to have risen even more steeply since. All those who began claiming universal credit at the beginning of the pandemic will have come to the end of a 9-month benefit cap grace period in December, and we have no figure from the department. Families impacted lose an average of £200 per month. One case example, one family with 4 children are losing £800 per month, leaving them with a total income after housing costs, which is 68% below the poverty line. And this is all from the party of so-called social justice. To blame the Tory party, to blame the Tory austerity party, and DUP pointing fingers over the aisle when you two guys are in it together. You are the parties of the executive for the last 10 years. You have been the party leading the executive for the last 10 years. From universal credit to children cap to PIP, this is the legacy of DUP, Sinn Féin and Alliance handing of welfare reform back to the Tories. You cannot blame the Tories when you give them the power. You cannot blame the Brits when you give them the power. Let's not forget who tripped through the lobbies in this House to hand powers of welfare over to the Tories in London. No more blaming the Brits. You give the Brits the power. Mr. Speaker, in relation to the advice support sector, and it really beggars belief to me how you could countenance at this moment cutting that sector. These people are helping the families and individuals who are on their hands and knees, and how do you possibly at this moment countenance taking money away from them? I'm so thankful to the advice sector and so thankful for community advice. The work they do on the ground, helping people, guiding people who find themselves in the advice sector, in the benefit sector, when they never countenance that possibility. But because this pandemic has happened, and our communities minister is even countenancing taking money off them at this time. How could that be? The party of social justice? Not likely. Mr. Speaker, in relation to the advice sector in Mr. Carroll's amendment, I share the sentiments of his concerns, and I share the cynicism from Mr. Durkan of the proposal to cut the support to the sector in the first place. Maybe it's just me, but would any minister backed up by their finance minister propose such a cut to those whose help, who need the help the most in our society. We know the worst of this health pandemic has passed, but we know the economic impact and the jobs impact will be long into the future. And it's only getting worse. And again, I'll be cynical, even more cynical again, but can you imagine a minister in Dublin who proposed such a cut? The minister and her party colleagues will be marching on the Dáil lawn. If it was a London minister, the MP for South Down would be standing outside Westminster, twiddling his thumbs and shouting about it. But here, don't blame us, just blame the Brits, blame the Tory austerity. Mr. Corley, I'm appalled at the fact we are now weeks away from a cliff edge, and yet there has been no proposal by this minister. We have the finance minister struggling to spend money. He says he may have to hand money back to London. I'm saying here's the place to spend it, on the most vulnerable, on the people who need it the most. Support them now, put food on their table, put a roof on their head, over their head. What are the obstacles to the implementation of these mitigations? Is the money not there? As I said, yesterday the finance minister was handing out money hand over fist. Tell us what the obstacles are so we can all work together and find solutions to help the people who need help the most.
I call Mrs. Martina Anderson.
Caoimhe Archibald, freelance Caoimhe, and I must admit to having a wry smile on my face when I seen the DUP motion, because traditionally the DUP has consistently positioned itself against Sinn Féin on many social and economic issues, including on welfare mitigation. So I hope that the concern expressed by the DUP is a real change of heart. Whatever triggered it, opinion polls, who knows, it's welcome that the DUP now realise that poverty affects people across the north, and that Sinn Féin's efforts to mitigate the very worst impact of Tory austerity was the right thing to do. During the past year, Minister Hargey put in place a range of measures to mitigate the adverse social impact of the pandemic. The Minister has worked tirelessly to ensure that welfare support is made available to households hit hardest. The Minister has already confirmed that she not only intends to continue mitigations, but wants to strengthen them by legislating to close loopholes in the bedroom tax and benefit cap provisions so that more people will benefit. It was Sinn Féin who put up a fight for the vulnerable people and vulnerable families all across the north against fierce opposition by the British government and indeed by the DUP, and you know that. And it was Sinn Féin that negotiated and secured £585 million for welfare mitigation against Tory austerity. The British government was adamant that unmitigated welfare cuts would be imposed without top-up payments and with full-blown sanctions. Sinn Féin refused to let that happen. To date, almost 85,000 people in the north have benefited from the mitigation package Sinn Féin demanded, including 47,000 homes who have been protected from the bedroom tax. The Auditor-General painted a stark picture of what the alternative would have been without the protections secured by Sinn Féin. Minister Hargey also wants to end the British government's scandalous two-child policy, and she also wants the current £20 uplift in universal credit maintained. Minister Hargey is acutely aware that in places like Derry, the amount of people claiming universal credit has increased by 50% since December 2019, which is an increase of over 2,100 people. Other tangible supports made by Minister Hargey were removal of 7-day wait for new claims for employment support allowance, changes to the rule for sickness pay and maternity pay, the much-needed funeral expenses scheme. 200,000 food boxes were delivered to 200,000 homes in need, and 220,000 people recently received an additional £200 fuel support grant. But poverty has not just materialised from COVID-19 pandemic. It existed as a result of deep-set regional inequalities and a lack of jobs and opportunities being targeted to where they were needed most, especially in places like Derry. And all of that was layered over by a decade of cold, calculated Tory austerity from London that has stifled economic growth and wages. So if the DUP are genuinely concerned about poverty mitigation measures, then I hope that they will support the Minister's request for further funding. I also hope that when the anti-poverty strategy comes forward, that the DUP will not only support a ring-fence budget for its delivery, but will ensure that their ministers allocate resources within their departments towards addressing poverty. So thankfully, it is a Sinn Féin minister of the calibre of Deirdre Hargey who is at the helm of the Department for Communities and who works every day to protect the most vulnerable in our society and who is determined to deliver the welfare mitigation review as stated in New Decade New Approach. Sinn Féin Minister Deirdre Hargey will go down in history as a minister who has played a vital role in tackling poverty and working to create a fair and just society. And the Sinn Féin members here in the Assembly and thousands more in society are very, very proud of Minister Deirdre Hargey. Go Romina Meageth Galer. Thank you all.
Thank you. I have time for one more speaker, and I'm mindful of the fact that thus far in this debate, 9 members have spoken who represent parties of government, and 1 has spoken who is not part of the government. Therefore, I'm going to use my discretion and call Ms Rachel Boots.
Thank you, Mr Deputy Speaker. I fully appreciate that. COVID-19 has plunged so many into hardship here, and the reality of the pandemic's impact is that it has fallen disproportionately on the most vulnerable individuals along racial, ethnic, occupational, gender and socio-economic lines. The inequalities in people's protection show the urgency of the changes needed to protect and put people at the forefront of our population's health and well-being in the future. In the most recent social policy update from Community Advice Arts in North Down, who give incredible help to people in my constituency, found that the most significant concerns raised during the period of Q3 2020 were employers having to contribute more to the coronavirus job retention scheme in late October, and ongoing difficulties with the 5-week wait, including welfare payments being insufficient to live on, often requiring charitable support, and the difficulty in accessing discretionary support. The £20 uplift in universal credit at the start of the pandemic was a clear recognition that the basic payments were not enough. To go back to what it was is unthinkable. The Trussell Trust research shows that the uplift has provided vital breathing space to hard-pressed budgets, with 7 in 10 on universal credit since early 2020 saying the increase has made it easier to afford essentials. That anyone would even countenance taking away the uplift from the poorest and most vulnerable in our society is shocking. We know that there is no going back to the way things were before the pandemic. We politicians I won't, sorry, I have no time. We politicians talk about building back better, so I would ask the Minister, and indeed the very proposers of this motion, should any attempts be made to scrap the UC uplift in Westminster, what will she and they do to ensure claimants here are protected and keep the rate that they are on? The question for the Executive as a whole is whether they will dig deep, organise their budgets to effectively safeguard our most vulnerable people from the cruelty of imposed austerity. We urgently need better self-isolation support for those affected by COVID, as current discretionary payments are too difficult to access and are costly to administer and often only cover short-term expenses. And this is not just because of the pandemic. In 2019-2020, the Trussell Trust Food Banks gave out alone over 45,000 three-day emergency food parcels in Northern Ireland. 1 in 5 children here are already in absolute poverty. 42% of people in Northern Ireland were already in fuel poverty. Navigating the complex web of social security was already a challenge, especially if you were vulnerable or have complex needs. And for those that listened to some of our young people present to the Executive Office Committee on the 17th of February, it was no surprise that of those surveyed by the Youth Forum, 74% did not have faith and confidence in leadership from government. But the most shocking statistic of all was that 1 in 10 young people selected in the survey, the problems that we're facing them at the moment: food, feeling unsafe at home, housing rights and homelessness. Legislation must be introduced and passed to extend the welfare reform mitigations, and the Minister is committed to closing the loopholes in bedroom tax and benefit cap mitigations, but it's yet to be delivered. The 5-week wait for universal credit must be amended. The disgusting and shameful 2-child cap needs to go, and the 6-month rule for terminal illness too. But we know that there is a link between independent advice and welfare mitigations, especially with universal credit managed migration to come down the line, which will have a huge impact on many people. It's stopping people's core benefits and then moving them on to universal credit, so there is scope for things to go badly wrong, especially with vulnerable people on income-based ESA, and we must protect funding for our independent advice sector. Appeals shouldn't be rushed through as we reopen from the pandemic, as representation is so important for people and their appeal result. As the Executive charts a course for recovery and looks to longer-term economic planning, are they going to prioritise health and well-being, or continue on an obsessive quest for growth and GDP that will only exacerbate and entrench inequalities? We must rethink what we value as a society and as an economy in light of what the pandemic has laid bare. And we need a radical overhaul of how we do business that will reduce inequalities in wealth and income based on a just transition where no one is left behind. To build an economy where markets are designed and public money is used to conserve and regenerate resources rather than squander them. It is not rocket science, Mr. Principal Speaker. It is strategic investment in public services, it's green jobs, it's a just transition that will address poverty, redirect wealth back into the local economy and improve health and well-being. And it is needed now more than ever. Thank you.
Thank you. I now call the Minister for Communities, Ms Deirdre Hargey, to respond to the debate. And the Minister will have 15 minutes, although I am mindful of the fact Business Committee is due to meet at 1. So if we want to have this item of business dispatched before 1, it may be useful if members don't use up their full-time allocation. Otherwise, the division may have to wait until 2:45 after question time. Minister.
Thanks very much, and thanks to all the contributors in this important debate, and obviously I welcome the opportunity to speak. I suppose I want to lay out first, because a couple of people have made this claim about a cliff edge at the end of this month, and I want to give assurance to people out there who are listening to this important debate that the existing mitigations money will continue to flow beyond the end of this month as they did last year. There will be no cliff edge and no stopping of those payments. Those payments will continue to be made, and I think it's important that I say that from the outset. Obviously, in terms of response to the COVID pandemic, my department's Work and Health Group delivers benefits and employment services to around 350,000 people here in the North, including the department's financial support service. The very nature of these services mean that we're supporting the most vulnerable citizens across the North. This is particularly important as we continue to experience some of the worst social and economic downturns in recent years, caused by the COVID pandemic, but also the financial crash which happened over 10 years ago. And obviously, when I came into this role over a year ago, the pandemic wasn't there at the start, and obviously one of my first visits that I made was with the Human Rights Commission. It was also with Eileen Evison, who had taken forward the first set of mitigations, and that was about looking at an urgent review of new mitigations that we could bring forward, as was what was committed to a New Decade New Approach. But indeed at that point, and indeed within that political agreement, nobody could have foreseen that we were going to be impacted by the biggest global health pandemic that we have seen in our lifetime. And I do think that people need to recognise that as well. Since March 2020, my department has responded swiftly and effectively to support individuals, communities and sectors who have been affected. This has involved revising complex legislation and making easements to benefit application processes, redirecting resources on delivery of essential services, and introducing new ways of working, all at a pace to ensure that benefits were paid and getting money to the people who needed it. This was also in the context, and members will remember, when staff were feeling uncomfortable, when there was the stay-at-home message, when there was the lockdown. The staff within the department reduced to under 30% of those who could go into work, We didn't have the technology at the outset of the pandemic because nobody could have foreseen it, and obviously a lot of work had to go into place. And I think then everybody in this chamber recognised the challenges that our staff faced at that time, but really did step up to the plate in ensuring that payments flowed. I did put in place a range of measures to mitigate the social and economic and wellbeing effects of the pandemic upon our communities, helping to protect the most vulnerable and safeguard the organisations that they depend on. This included standing up the dedicated COVID-19 community helpline, and that was working with Advice NI, who I do recognise are a commendable group amongst the other community providers around advice support as well. And obviously that helpline was to ensure access to food and medicines, establishing new measures to support the homeless and protect tenants, as well as establishing access to the advice for those facing financial hardship. Given the acute financial pressures many households were experiencing as a result of the pandemic, I focused on measures that could be implemented quickly and introduced packages of additional assistance and funding to support people through this difficult time. Some of the changes made included removing the 7-day wait for the new claims of employment support allowance, making changes to the rules under statutory sick pay and maternity pay, the funeral expenses scheme, and a range of other measures to ensure that the social security system is more flexible to relieve hardship and to ensure that people most in need get the help and the support that they require. The number of people claiming universal credit increased from 57,890 in March last year up to, as of November past, there were 118,510 households claiming universal credit. In response to this unprecedented demand, the UC, as was said, standard allowance increased by £20 a week, this resulting in an additional $86.67 a month. At a time of increased financial hardship and uncertainty, it was acknowledged that many people will need to rely on universal credit. And while I welcome the extension of the standard allowance uplift, people need to know that they can continue to rely on this beyond the next 6-month extension. Carol Nicola, when she was in as Minister, obviously worked with other devolved administrations in meeting and pressing Therese Coffey MP, the Secretary of State for Work and Pensions, urging that that uplift be made permanent. I introduced discretionary support self-isolation grant rather than a loan back in March 2020 to help with short-term living expenses where the claimant or a member of their immediate family was diagnosed with COVID-19 or advised to self-isolate. There's no restrictions on the number of COVID-related grants that a claimant can receive. And since the introduction in March last year, my department has processed over 21,000 applications, with over 78% of cases resulting in awards and over £2.3 million being paid out. As the pandemic continued and in recognition of additional support people may need in the winter months, I introduced the COVID heating payment at over £40 million. And as was said, this impacted on over 200,000 households across the north. I also allocated £3 million funding to bolster existing programmes and to work at new interventions aimed at supporting people over the winter. And to date, as part of the Warm, Well and Connected, there has been 40,000 people who have engaged in that programme, with over 4,000 people being helped directly through the warm element of £330,000 being made for direct fuel support in that time. I continue to push for the support for people in our communities, and last week I met with Justin Tomlinson, MP and Minister for Disabled People in Health and Work, to request consideration be given to increasing the rate of statutory sick pay, and that business and advocacy groups here in the North will have the opportunity to engage and input into the reform of statutory sick pay. I also requested an urgent consideration and said that they should be restoring the local housing allowance rates to the 30th percentile to ensure that individuals and families continue to be supported during this time. I know that labour market interventions have been spoken of here today, and obviously I recognise that as we move to the stage of the pandemic around recovery, that labour market interventions will be an essential part of that social return. These schemes are Jobs Start Work Experience Programme, expansion to the Advisor Discretion Support and Work Ready Employability Service. All of the interventions are aimed at helping people who have lost their job to find employment. However, the launch of schemes was paused pending the outcome of the budget allocation. I have already given a commitment that I will continue to fight to protect the interests of all those affected by the pandemic. In terms of the welfare mitigations, throughout the pandemic, my department has continued to deliver the welfare mitigation scheme. The payments provide support for those who lose benefit as a result of changes to the social security system. This is a unique package of financial support, and I am determined to not only have the current mitigations extended, but also to look at where we can strengthen and provide other mitigations. And in the 4 years of welfare mitigation schemes to March 2020, my department has paid out £168.4 million to almost 85,000 households. This includes £68 million paid to over 47,000 affected by the bedroom tax. And the importance of the mitigation schemes is recognised across this House. I am pleased that the initial budget allocation for my department in the next year includes £42.8 million to allow these schemes to continue, and those schemes will continue. I want to be clear on this issue that my department will continue to deliver existing mitigations. However, I recognise that we can do more. This is why I will soon bring forward legislation to strengthen the mitigation schemes for people affected by the bedroom tax and also by the benefit cap. These measures will ensure that increasing the number of people denied mitigation payments under the current legislation will be protected and those loopholes will be closed. I am aware that there is considerable interest in the review of mitigation measures, and I can assure the House that I am personally committed to progressing this matter. However, I trust members will understand that the challenges in responding to the pandemic has been exceptionally challenging and has impacted on the ability to move some issues as quickly as I would have liked. I can confirm that proposals for plant mitigations review are being finalised, and I will make an announcement on this soon. I can also provide assurance that my department will be adopting a co-production, co-design approach to the welfare mitigation measures, and in practice this means stakeholders will be central to the completion of that review. However, I firmly believe that the priority for my department at the moment is to secure the approval of the legislation required to extend the mitigation schemes and also to close the existing loopholes. In terms of advice service funding, and again, I would agree with some. This amendment was unnecessary, but it was also inaccurate. There is no funding cut, and there will be no funding cut to the advice services, as I have stated in this chamber on numerous occasions. I stated it last week, and I asked members, even including those who made the amendment, that they can come to me at any time and speak to me, yet I have never had such a request, and therefore they've never asked to meet me on this issue. I have previously stated that I consider the provision of advice support services as crucial to helping those people most impacted and of vital importance, and I will ensure that these critical services continue next year as an essential element of my department's budget. Obviously, the draft budget at the Executive was out for consultation until the end of February, as well as my department's EQIA. And I did put out a full EQIA, and I thought that it was important that I had done that to ensure that decisions that I make and go forward reflect those groups that could be impacted by this budget. And I make no apologies for doing that. Obviously, all of the responses to that will be taken into account when I finalise the budget going forward. In terms of just quickly trying to respond to some of the issues that have been raised, I covered the issue around staff and numbers. There is a concern. There has been more than a doubling on universal credit numbers. That wasn't accounted for, but I am confident going forward that we will be looking at that funding being secured in the time ahead, and that we can start the recruitment in terms of the staff that we need in the department to really step up the service delivery for social security. The advice sector, I know it was mentioned, there will be no cut to the advice sector funding. I've said that publicly numerous times in this chamber. I've said it on social media, and I have communicated that more widely. The Job Start scheme is a priority for me. It hadn't been included in the initial calculations of the budget, but it is a priority for me, and I'm confident in terms of looking at a social and economic recovery from the pandemic that this will be taken as a priority area for the Executive, and that there should be an announcement coming on that soon. We will be ready pretty quickly. I mean, a lot of the work around Job Start has been done, and we will be ready, I'm hopeful, as soon as a budget can be agreed, that we can start on that right away. The terminal illness stuff, the Executive have given approval. They're in support of changing the rules around terminal illness. The delay is just bottoming out the figures with Department of Work and Pensions. That work is ongoing, and as soon as we can get that, I will then move with making that proposal to change the rules around terminal illness. I also addressed the issue with Justin Tomlinson when I met him last week as well, to say that we will be pushing on even if their review isn't completed. But of course I did stress that they should be changing the rules around this as well. In terms of the mitigation impact on women, this is an important area, and obviously closing the benefit cap mitigation loophole and reviewing the feasibility around the two-child policy are two critical areas that will impact on women in the time ahead. I know some have talked about the Finance Minister and the budgets, and I hope that when they're looking at their own ministers and their own departments that they'll be saying, because they have cuts as well, they have impacts as well, and will they be saying that that's down to the Minister? The reality is we get a block grant from Westminster. That block grant was a flat budget, which means a cut. So the cut is not made by the Finance Minister, and all the parties, and particularly those on the Executive, will know that, because all the parties around that Executive table and all of their ministerial portfolios have been impacted by the block grant that we have been given at Westminster, and that is the reality. We also don't do multi-annual funding, and that's another critical area that we need to change. And again, that is resting with Westminster that those changes need to be made as well. Some talk about now addressing the root causes of poverty and inequality, and I agree with that wholeheartedly. But for me, you can't do that without talking about the impact of partition, the impact of how our budgets are set, the impact that we don't have our own financial levers and full fiscal powers. So we can't run like a democracy in other countries that you look to, because we have one and sometimes often two arms tied behind our back, where Westminster are making these decisions and those parties in power in Westminster are not representative and indeed not elected by the people here in the North. So if you're serious about addressing those issues, fundamentally, then you have to look at the issue of partition and how our budgets are impacted. And I think Brexit has shown that. With all of the governments that are based in Westminster, I think even parties facing, I mean, you've seen the impact of that and how the Tories have behaved around Brexit, and yet for some reason you don't want to deal with the underlying issues.
I'm sorry, Minister, your time is up. Sorry. I thought that was a good point to stop. You made your point, and it's definitely on the record. I call Mr. Jerry Carroll to wind on his amendment. Mr. Carroll.
5 minutes, Mr. Speaker, yeah. 5? Yep, thank you. Thanks, members, and thanks. I'll try to respond to many of the comments, but I'll miss some, so apologies on that. Just to kind of respond to the Minister, she described the amendment as inaccurate, and I'd ask her how. I would like to quote from the Department's own Equality Impact Assessment, paragraph 619, in reference to the budget allocation. This equates to a 1.5 million reduction in funding to the advice sector, which provides help and support to some of the most vulnerable in our society. They are from the Advice NI, Mr. Deputy Speaker, response to the Equality Impact Consultation. This consultation response wishes to express in the strongest possible terms opposition to the proposed Department for Communities budget allocation, which includes no allocation for the independent advice sector to support welfare change, and it goes on to reference the £1.5 million reduction as well. So don't take my word for it, members, take the words of the Department and the Advice NI as well. Just on the Minister's point as well, Mr. Deputy Speaker, about partition, I would agree with her on it, but we can't adopt a position of poverty, eradicating poverty must wait. You know, 100 years ago, some people adopted the position that Labour must wait, and we can't, in the centenary of partition, adopt a strategy which just says solely partition. Partition is problematic and should be opposed, but also Stormont's role in enabling and increasing poverty has to be addressed and is the elephant in the room, seemingly, for the Minister and her party. Karen Mullen, Mr Deputy Speaker, said her party won't be supporting the amendment, and the Minister has committed already to this funding, which she has last Monday, I believe. But I think I would ask the member to forgive me and many others to simply just believe the Minister, nothing personal in that, or any Minister just because they say it. I mean, we were told that the North was next in regards to abortion rights 2 years ago, and then we seen opposition to abortion in this House by the very party. And I would ask the member from Foyle to tell that to advice workers who are contacting me, and I'm sure many others in this room who are concerned about their jobs and their future, that leave it to the Minister that she will sort it. I was told to have a healthy scepticism to whatever a Minister says, and I will maintain that today. And at the end of the day, if the Minister is going to bring it, then she'll have no problem backing this amendment whatsoever. But what would be shocking is if members in Sinn Féin go behind me to oppose this amendment, which calls for support for advice centres and workers. Shameful stuff indeed. And I think many other members supported the amendment. Mr Durkin, Ms Armstrong, I think Mr Allen, Ms Woods, and possibly Mr Easton and his party. Andy Allen, Mr Deputy Speaker, also referred to difficulty of his constituents to navigate the system in terms of computer access, but also the system generally, and that's something that I and my constituents have experienced as well, unfortunately. Members thanked advice workers. And indeed they should be thanked, but it reminds me a bit of from some quarters, the approach towards the NHS workers. Thank them and clap for them, but when it comes to pay, when it comes to financial support, it's sorry we don't have it, or sorry it'll come at a later stage. Pat Sheehan also mentioned Marcus Rashford and talked about being unable to blunt his party were able to blunt the impacts, some of the worst impacts of welfare reform, and I would absolutely dispute that. The most vulnerable in society in our constituency, both in West Belfast and beyond, have been impacted directly by welfare reform that he and his party supported. I will go away, sure.
I certainly agree. I mean, we represent the same constituents, and many of them have been affected by Tory austerity. But would he not agree that the 585 million went some way to blunting the worst excesses of that Tory austerity and cut the welfare? I think
the member for his intervention, I'm not going to tell somebody on benefits to not take extra money, but the point is people that are vulnerable are being impacted already by it, and the mitigation package it doesn't go far enough. The other point, Mr Deputy Speaker, in terms of the debate, we heard discussion about low-paid workers from the DUP, about supporting low-paid workers, and I would say that would be, in effect, crocodile tears from a party who supported strongly the Tories in government when they went into hyperdrive when it came to implementing welfare reform. And Sinn Féin asked us to trust them to stop Tory welfare reform, and then rolled over and implemented it as well. And I would say that we simply can't trust that party when it comes to taking their word for it when it comes to issues of welfare reform.
I'm afraid the member's time is up.
Ask people to support the amendment. Thank you.
Thank you. And now to wind on the motion, I call Mrs Paula Bradley.
Thank you, Mr Principal Deputy Speaker, and I will certainly be finished before the 2 o'clock cut-off. Can I thank everybody that has taken part in the debate today? Or sorry, 1 o'clock cut-off?
The member's going to 2. The member's going to 2. We're in trouble.
Can I thank everybody for taking part in the debate today? And just before, and Mr Carroll thankfully has actually done a summary of what lots of people had to say, so it saves me having to go into all of that detail. There's just a few issues I just want to clear up before I start to do the wind. And they're in some relation to some of the comments that have been made here in this chamber today, calling me pious, asking, calling into question why me, as an elected representative, should have anything to say on welfare reform. After all, it was all my fault that we have welfare reform. Can I just put on the record, I'm an MLA who represents a constituency where there are people who live in great pain and great deprivation, and I deal with their pain every day. I deal with their queries. I deal with them in an effective way, and I stand by them. So I'm also
one of the only members in this very chamber here today that sat on the Welfare Reform Committee whenever it came through the DSD committee way back when. And I remember that landing on our desks, and I was with total despair at looking at just what those cuts were going to be. Some people in this chamber think that we were able to rip that up and throw it out and say, well, sure, we'll do our own thing. I don't know where they think we were getting the money from to do our own thing. We had what we had, and yes, there were negotiations took place, and yes, mitigations did happen. But I can say, with hand on heart, that I was one of those members in that committee that banged on at a rate about the Welfare Reform Bill and what mitigations we should be in place. I'm one of those members that lobbied my minister constantly to bring about changes within welfare reform. So I think I am more than able to stand up here today to support those many people that are living on benefits and just about living actually on benefits. And I just thought Rachel had brought up the point there about the uplift, the £20 uplift. I can tell you now, through you, Mr. Speaker, that I will be going to my party and lobbying my party to support that whenever that comes to its end in Westminster. Where are you? Yes, go ahead.
I thank the member for giving way. And when the members tonight, could she also ask her colleagues at Westminster and the Executive to lobby for an extension of that uplift to those on legacy benefits who haven't yet migrated to universal credit?
Thank the member for his intervention, and yes, I will. I will certainly make that point. I also just want to make one more point, and that was the venomous and hatred from Justin McNulty when he talks about the Brits. Because for a vast number of people who live here in Northern Ireland, they see themselves as British. So I wouldn't like to think, and I'm sad he can't come back, that his hatred and venom that he showed through this debate when he talked about the Brits was not in relation to those many British citizens that live in Northern Ireland. I just want to put that on record also. There are no marks over there shaking his head. Can I just then go on and just talk about this? I think it was said by several people here in the chamber. I am not here to hit on the minister. I am absolutely not. I know the work that has been done by you and through you, Chair, and the department when it comes to the COVID pandemic. I know the amount of money that rolled out that door, whether it was for food, whether it was for heat, whether it was for discretionary support, all of those things. And I say well done in getting that out there. I don't estimate the job that went on there. I know that various members within your party listed many of the many things, and absolutely, and I have to say, Pat Sheehan had mentioned the free school meal issue and the holiday hunger. We certainly praise that from this side because our minister, the Education Minister, Minister Weir, was part of that joint decision in that being rolled out. Absolutely.
Point that the executive got no credit for that particular measure. Thanks.
Thank you for that point, and you're right, they didn't get, and yet, as you said, in other parts of the UK, that Marcus Rashford was being hailed for this wonderful thing that he did. So I just want to say, it's not about the past year and the work that has been done, and it's not to call the minister to account for what she hasn't done, but I think it was said by Andy and it was said by others about the sheer frustration that there is out there when it comes to the welfare reform mitigations. We know from New Decade New Approaches that have been said that a review was to take place by to start in March 2020, and we're yet to see that review. We're yet to see that co-design and that working along with the very many partners involved in welfare reform. And I just want to mention one of those partners, and it was something that many of us in this chamber very early on last year got to meet with the You See Us campaign group, which was predominantly women, who told us about the effects that welfare reform was having on their life, about the 5-week wait, about the advanced payment, all of those issues, which I know you as Minister, through you, Chair, have tried to address those issues, but not enough has been done to address those issues. And I think it was quite evident from the information we got around the budget about the amount of money from the contingency fund that was being handed back because it wasn't used. So there's better things that need to be done. Work needs to be done to ensure that people get what they need when they need it. So just wanted to make that point. Minister, you had mentioned then, just to go on about the money for the advice sector and Mr Carroll's amendment, you had said there that that there has not been a cut in the advice sector funding. And we know there hasn't been a cut when we look at the budget in advice sector funding. But we know that this 1.5 million has not been included within the mitigation measures for advice centre funding. I would have been much happier if Mr Carroll had put down an amendment a little bit stronger than that, because what we heard in committee from various stakeholders was that the extra money for the advice sector cannot come from the existing communities budget, because then that takes money out of other voluntary and community services, and that's the last thing we want to see. What I want to see is the Minister to continue to lobby her colleague, the Finance Minister, to get the additional money from the Department of Finance for the advice sector. And as I said, I wish just that Mr Carroll he could have strengthened his amendment by saying something along those lines as well. I know that I'm being looked at here, and I know I'm nearly at my time. Look, I want to thank everybody who took part. I think it has been a constructive debate, albeit there has been a lot of mudslinging during this, and I think it was Kelly had said it, that we should be working together, not pulling apart when it comes to welfare reform, because every one of our constituents are facing the same thing. Every one of our constituents are coming to our offices with the same issues, and it's up to us in Assembly not to wait on Westminster Government. It's up to us as an Assembly to bring about change, and part of that change needs to start right away with the review of welfare mitigations, because maybe there are things that we need to increase, that we need to add, but we don't know that because the review hasn't taken place yet. Thank you, Mr Speaker.
Thank you. During the course of your remarks, Mrs Bradley, you raised an issue about the conduct of the business in the House. It would be my interpretation of those comments that they represented a satirisation of another party's position rather than an attempt to offend any group in the Assembly. In defence of Mr McNulty, I don't believe that it was his intent to cause hurt or offence to anyone. Of course, the opportunity will come for him to speak if he so wishes, but that would be my interpretation of his remarks. And I just think it's important that, you know, when I'm here, I have to speak in defence of all members and their rights and privileges, and I certainly will. Members, as there's not likely to be agreement on this question, and as the Business Committee is due to meet at 1 p.m, I propose to suspend the sitting. I'll then put this question again after question time, and if necessary, there'll be a division then. So the sitting is suspended. Thank you.
Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary, Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed.
Okay, members, thank you. The sitting is resumed and it is now time for questions to the Minister of Health. And I call Patsy McGlone. Here Patsy McGlone.
Ceist over again. I can call you question number 1.
I thank the member for his question, and I acknowledge the dedication of all independent care home providers and staff who continue to work tirelessly to provide care to residents under the challenging circumstances that have been presented by the pandemic. Unfortunately, there remains a number of families who have not as yet been able to successfully set up care partner arrangements for their loved ones. The Department and PHA are supporting care homes to implement the full visiting and care partner arrangements. The most recent figures indicate that almost 80% of care homes are facilitating indoor visiting when they can and can be done safely, and just over half of all care homes now also report that they have care partner arrangements in place where this is appropriate for a resident. Trusts are working with individual care homes to provide the support they might require to move forward with the facilitation of safely managed and meaningful visiting arrangements and the implementation of the care partner concept. As well as trusts, the Health and Social Care Board and PHA are working with those homes who are finding implementation more challenging, identifying and sharing good practice. The RQIA will also assess the approach being used, including when undertaking inspections of care homes, and compliance with the visiting policy and practice will actually be material consideration in the inspection and regulation of each care home. Funding has been made available to help homes implement the approach set out in their regional guidance, and for the period of the 4th of March, 373 nursing and residential care homes have been paid £6.52 million in funding for staff support in respect of care partners and visiting.
Supplementary, Patsy McGlone.
Thank you, but the Minister has in fact covered both the questions that I was going to ask, so well done. Thank you.
Moihui Foster. Question number 3 has been withdrawn, and I call Colm Gillerny.
And thank you for answer, Minister. And I suppose I would be concerned that you have identified there the fact that only just over half of the homes have put in place the care partner scheme. But do you understand the comments of the Commissioner for Older People, Eddie Lynch, when he says that he's not convinced that the Department understand the full extent and impact of the lack of visiting access at present?
I've had conversations with the the Commissioner for Older People in regards, and he didn't use that language to me. In fact, he understands the support that we've been given to care homes, also to those families who want to make those visits, especially when we are seeing challenges in specific care homes. I've asked the Commissioner for Older People, he has put out a call that he shares any concerns he has with either specific care homes or sections or care home providers as a whole, so that we can engage fully, and so the Health and Social Care Board can provide that support and guidance, so the Public Health Authority can supply the additional support and guidance, and also so that the RQIA can also be involved as well, so that we can get as many care partnership arrangements set up in place. We have put available for those who enter into the formal care partnership arrangement availability for early availability to vaccines through the care section at that point in time, and also in regard to access to testing.
I call Alan Chambers.
Speaker, Minister, I thank you for your answers and for bringing forward the Care Partner Scheme. This is an extremely emotive issue, and all parties involved, and you yourself, Minister, only want what is best for care home residents. Can the Minister tell the House some possible reasons why some residents haven't been able to set up care partner arrangements with their families?
I think there is an ongoing challenge in regards to possibly some care homes in regards to the support or the understanding of what their responsibilities are to ensure that there is safe and effective visiting, now that it is possible under the Surge Level 4 conditions that we're at. So it is, we're fully intended into supporting those care home providers, but also where need be, giving them that bit of extra encouragement, shall we say, should they be failing to do that as well, because we do value and we do recognise the importance that a visit from a loved one actually does have, and the benefit that it brings to someone who is in a care home and isn't resident in that setting.
I call Palm Cameron.
Thank you, Mr. Speaker. I thank the Minister for his answers so far. Given where we are within this pandemic, and given the huge success of the vaccination rollout to date, and also the corresponding data that we have in terms of serious illness of our older population, is it time to look at moving on from the care partners, given that it has worked for some very well, but it has also been underutilised by very many people? Will the Minister also consider what help can be provided to the care sector in terms of indemnity, given the issues that have arisen for care homes in particular in providing COVID insurance going forward?
And I think the point that she makes for the additional insurance costs, and that's why my department have made that additional funding available for care homes, so they can pick up other costs associated to COVID, in regards why we still supply, if necessary, that free supply of PPE, and also in regards to the supports that we've given through trust staff supporting those homes where there is challenges as well. But I will say, in regards to the care partner process, when we first identified and utilised it here, it was taken up by other jurisdictions as a way of actually opening up care homes so loved ones could have those visits. We still, I suppose, remain the challenge, in fact, why it still is a vital tool. We still, as a region, are at level 4 in regards to the pandemic. So we just recently moved, the 1st of this month, moved from level 5 to level 4, which we use and all other jurisdictions use as an indicator as to what visiting we can facilitate, both in care homes but also in hospitals as well, so that it does follow that very set criteria. So care partners are still a vital tool to allow that visiting and facilitate it, but also support those family members so they understand that there are additional supports there for them, as I've said, early access to the vaccine that we supplied, but also regular testing as well, to give that assurance, not just to themselves, but to the care home and to the loved one that they are visiting.
I call Melissa McHugh. Melissa McHugh.
Gormaga, Concorla. Question to Minister.
And I thank the member for his question. As Minister of Health, I understand fully the importance of day centres in the provision of services to meet the wide and varied needs of people with a physical or sensory disability. The strategic location of day centres for adults with physical or sensory disabilities across Northern Ireland is a matter for the Health and Social Care Trusts to determine, in partnership with the Health and Social Care Board as the Commissioner of the Services. There are currently no plans to augment the existing service provision with an additional centre located specifically in the West Tyrone area, and neither are my officials nor their Western Trust colleagues are aware of any specific demand from the local community or individuals requesting that such an additional facility should be provided. There are currently 2 day centres for adults with a physical or sensory disability in the Western Health and Social Care Trust area, Glen Oaks in Londonderry and Drumcoo in Enniskillen. In addition, service users can avail of day care provided by the independent sector across the region. The Trust's Adult Physical Disability Service have contracts with a number of independent sector providers in the West Tyrone area, which include the Strabane and District Caring Agency, the Leonard Cheshire and the Cedar Foundation. Within West Tyrone, whilst these services are working at capacity, there is no existing waiting list for access to the day centres. Increasingly across the sector, we are seeing that demand from younger people with disabilities is for day opportunities, actually through self-directed support. This is based on an assessed need and means that individuals can make use of a direct payment in lieu of traditional day care. This model of care allows for bespoke arrangements to be put in place to meet their individual needs and enables people to avail of the activities at weekends and in evenings.
Melissa McHugh, supplementary.
Thank you, Minister, for your answer. And you know too that I have also requested one to look at that type of provision that exists. I think it's in Middletown and Armagh, and then in Carryduff as well too, in terms of that sensory care type facility for young people and adults who have those types of difficulties and problems. And I'm amazed that there hasn't been any point made to the trust in our area, because I've had parents in tears talking about that type of provision where they find it so difficult to cope with those that are suffering from it and would avail of it very, very much so. And I'd ask you, Minister, if you would actually consider locating such a service in the Strabane area that would service that part of West Tyrone and Fermanagh.
And I thank the member, and I think if I recall right, I think he has written to me in regards to the autism provision and services as well, and I know it's something that he has raised before, and as I said, and he has said, I think acknowledged in my answer that we have received no requests either at the Department of Health or actually through the Western Trusts. I'm sure if the member wants to make direct contact with the Western Trust and raise those issues, it's something that they will look into and something that we can progress then, should there be a need in the facilitation for access to those services. But I think, as I said earlier, the specific in regards to young people, I would encourage the member also to direct them, and if necessary we can provide additional information as to how they can actually look for day opportunities through self-directed support as well, so they can get a more tailored personal approach to the support that they do need as well. But if the member wants to engage with the Western Trust, and then ourselves will follow up on it.
Nicole Rosemary Barton.
Thank the Minister for his answers so far. These day centres have proven to be excellent for treating Alzheimer's and dementia and many other afflictions that society have. Will the Minister commit to bringing up the issue of creating physical and sensory disability day centres across Northern Ireland with the Finance Minister, who controls the funds that would allow this to happen?
And I think the member, and I suppose she does indicate the pressures that we're under, where we get many requests to increase facilities or provision on support to individuals, is dependent and is based on the financial support that I get through and from the Finance Minister. But in regards to looking at what we can do and should do, as we're well aware that there has been an under-provision, especially in mental health provision over the last number of years, and it's something that we do want to do. In regards to the provision of daycare services, specifically I suppose in the Western Trust area, the primary challenge, whether it's actually for provision of daycare or day opportunities, often comes back to, as well, and the member will be aware of this, is transport, especially in the rurality. And furthermore, the Western Trust has a number of individual service users who have complex needs and also who require skilled staff to accompany them to meet their nursing needs and administer medications. So there's all those additional ancillary costs and challenges as well that do have to be funded as well. But it's always something that I want to look to improve and the support that we do provide to those who need it most.
Mark Durgan. Call Mark Durgan.
Caoimhe Archibald, and to thank the Minister for his answers thus far. The Minister has spoken of the challenges facing his department, and we don't doubt those, but we can't underestimate the challenges facing people out there living with disability, and particularly those today living with autism. Does the Minister envisage an expansion of physical and sensory disability services as being part of the fully developed autism strategy later this year?
And I thank the member for that question, because I'm glad he acknowledges the autism strategy that we did actually just launch last week. It is important that we get as much feed into that as is possible. And in regards to the delivery of future services, I think it's important that the Western Trust engages as well to scope demand for any additional facilities that they need, should it be daycare, day opportunity in their locality. And again, I know that work has been started and is supported. It's been commenced actually through the personal public involvement events, which I think were actually held in Strabane as well. So the service user engagement and informal care engagements events will again commence soon in regards to how we take forward that strategy as well.
Call Paula Bradley.
Mr. Speaker, and I thank the Minister for his answers so far. Question 4.
And I thank the member, and as the member knows, COVID-19 has reinforced the need to rebuild our health and social care system in new and better ways. Firm foundations for change have already been laid, with key initiatives such as the multidisciplinary teams in primary care and new day case elective care centres put in place. Upskilling of the social care workforce rolled out, a new rapid response mental health hospital liaison service put in place, and a commitment to put in place 900 additional nursing and midwifery training places by 2022. As we emerge from the latest COVID-19 surge, I am determined to rebuild as quickly as possible. This will include both the stepping up of elective care services, but also the reshaping of existing services, and that will be informed both by the work that we have progressed to date and the learning we have gained as a result of the pandemic. A key priority for rebuild is the need to return critical care to its usual position to facilitate an increase in elective care. I have agreed the de-escalation of the ICU and rebuild of elective care will follow a number of key principles. These will underpin the Trust's rebuild plans for April to June 2021. These principles include the de-escalation of the Nightingale facility at Belfast City Hospital. Another critical step in rebuilding the system is the introduction of the Health and Social Care Bill, which has been introduced to the House this morning, and that bill will facilitate the closure of the Health and Social Care Board and transfer responsibility for strategic decision back to my department. It will streamline our structures, reduce bureaucracy and enable our resources to be better coordinated. As ever, our ability to rebuild will be heavily predicated on the resources available to do all that we need to do, and a multi-year budget is critical to the planning to achieve sustainable long-term change within our health service.
Mark Bradley, supplementary.
Thank you very much, Mr. Speaker, and the Minister has answered in part what my supplementary was. But as we come out of the current restrictions, Minister, do you envisage the decentralisation of acute services, in particular elective surgery, to other hospitals across Northern Ireland, particularly as we are facing a massive backlog in treatments like cancer and other deferred acute and surgical procedures?
And I think that the member will be aware of the approach that I have taken recently in regards to looking at our service rather than a centralised process as a regionalised process, so that we can make best utilisation of the facilities that we have around Northern Ireland, to make sure that we can get best use of our staff, best use of our operating theatres and best use of the footprint that we actually have. So it is about looking where we can establish what is now known as green pathways for care in those locations where we are seeing a small number of COVID patients being supported, so we can actually critically upscale the rest of those service provisions. The member will be aware of the elective care unit that we've established in Lagan Valley and the other sites across Northern Ireland that we're trying to utilise at a regional basis rather than just solely within the trust setting.
Whatever the ultimate reshape of the health service, there's still going to be a critical need for adequate surgery or surgical departments. Could I draw the Minister's attention to the quite unsatisfactory situation at Antrim Hospital, where, because of underinvestment, the surgical department was unable to provide a safe green pathway for cancer patients during the recent pandemic? And what is his response to the Northern Trust's request for a new theatre, for a new critical care block and for a new ward block? It's quite clear that Antrim cannot continue to serve needs without those.
And I think the member, I know, is an issue that he has raised, and I know it was a specific in regards to, I think, one patient or one constituent that had approached him, who, because of our regional approach, was able to get the operation elsewhere, although not in Antrim. Also in regards to the concerns that the surgeon based in Antrim raised with the member itself, he is right. Long-term underfunding of that hospital did not allow it to be in the shape that it needed to be, especially when we saw, particularly in the Northern Trust region, the large number of COVID patients that came forward, so that when we had to move our IC ward out onto one of the other main wards so that we could support a high number of COVID patients who needed that support from ICU. It will take time for us to come back down from that provision, but it is also that important time that when we look to the revenue budget that I have in regards to updating what is a relatively new hospital, if we'd have been looking at the continuing funding and support of the Northern Trust on a regional and revenue basis along the entire pathway over the last 10 years, we wouldn't have been in the situation we are now. Whereas we know we've already looked at the Northern Trust and Antrim Area Hospital specifically in regards to how it was able to reshape and re-image its emergency department, because even with the relatively new hospital and new design, that was necessary in the past number of years. So when the Northern Trust puts forward those business cases and business proposals, we will consider them within the round of the funding that we have available.
Carol Nicola.
Gormailga Concollia, and thank the Minister for his responses thus far. Does the Minister accept that safe, compassionate, accessible abortion services in line with legislation must be brought forward by his department immediately?
And again, the member, I think, follows on from a debate that is had in this place yesterday. And I will be clear to the member. I have said from the beginning that the establishment of a commissioned abortion service in Northern Ireland is cross-cutting and controversial. That is the legal advice that I have received. It's the legal advice that I will follow. And the member knows, having received that, I would be in breach of my ministerial duty if I did not bring it to the executive. And should I not, and should I decide, or should I even want to take that as a direction, under my ministerial role, under my department role, it would be one that would be called in and challenged. So the member knows, I think, well, and I was disappointed, Mr. Speaker, that my position was misrepresented in this House yesterday by a number of members who were in full knowledge that this matter is cross-cutting, controversial, and must be one that is decided by the full executive, and it would not be for me alone to move.
Paula Bradshaw.
I welcome during the week there the announcement of the additional funding for community and voluntary sector groups that deliver on healthcare. I'm just wondering what your department is going to do going forward to make the community and voluntary sector more sustainable, and I'm talking specifically the charitable sector, like our hospices, who are providing vital services, not just add-on services, going forward, because we should not be getting them to rely on cake sales and other fundraising events to provide these vital services. Thank you.
And I thank the member, and I do acknowledge the work that our hospices have done, not just over the past 12 months, but also over the past number of years. Their funding is also mentioned in the New Decade, New Approach. There has been an ongoing issue in regards to how they are funded centrally and what funding they receive from central resource. in regards that conversation continues with the Health and Social Care Board and with representatives of my department to get to a satisfactory resolution from both sides. The hospices in Northern Ireland have received additional funding from my department, but also directly from the Department of Finance during this pandemic as well, because we have acknowledged that, particularly in regards to the services they supply, they do rely on a considerable amount of voluntary contributions and people supporting them in that way. So it was right that the Executive centrally supplied that additional funding during this time.
Linda Dillon. Call Linda Dillon.
Question number 5.
And again, I thank the member for bringing this topic to the House. In terms of records held by Muller and Baby and Magdalen Laundry institutions or by other organisations on their behalf, in December 2020 I wrote to the holders of those records and the Health and Social Care Board to request they ensure that all reasonable steps are taken to preserve the records in their possession and that they are maintained in keeping with the best archival practice. I also requested that they immediately suspend any routine or procedure for deleting or destroying any such records and ensure the suspension remains in place for the duration of any further investigation. My correspondence also made it clear that all staff and former staff, where appropriate, should be notified of the ongoing need to preserve the records and that reasonable steps should be taken to ensure that any agents or third parties do not delete or destroy potential relevant records.
Supplementary, Linda Dillon, Castella.
Thank the Minister for his answer. And Minister, I appreciate that you have written to the organisations, but I think we really are at a point now where we need to move a step further, because you're relying on them to do the right thing. If there is a need for legislation or if there is a need for further moves in relation to this, what are the Minister's plans? I wrote to you back at the beginning of February, which was over 6 weeks ago now, and I appreciate that your department is under severe pressure, but I would have expected a response of some description, even an acknowledgement at this stage. We have people who are finding themselves in a postcode lottery just in relation to tracing services, and that's without even the difficulties they challenge around accessing their own records and their own information. So can the Minister give some assurances on what moves he plans to make, and if there is legislation going to be required in terms of ensuring delivery for victims?
I thank the member, and also, I thank her for acknowledging the large number of correspondence cases and AQs that we are currently dealing with at the minute. I will say to her the remit for the independent investigation into Muller and Baby and Magdalen Laundry institutions will be shaped by victims and survivors, as she referred to, with the support of the Truth Recovery Design Panel, which I'm sure the member as well has been appointed. I'm confident that the issues around access to and the protection of records relating to Muller and Baby and Magdalen Laundry institutions will be fully considered by the co-design process and the independent investigation into these institutions, so the individuals that she directly refers to, and I know I've been in touch with her, have actually input and feed into that process as well, because this is about co-production and co-design, and that is something that the Executive has been very clear about in regards to how we take forward this independent investigation.
Call Jonathan Buckley.
Indeed, I thank the Minister for his response. The report from the Interdepartmental Working Group quite evidently highlighted a shameful and dark period in our recent history. Could I ask the Minister what conversations he has had with his Republic of Ireland counterpart into the relation and nature of the independent investigation, as to what powers it will have to call witnesses from other jurisdictions?
I thank the member for his question. I did have an initial discussion with my counterpart in the Republic of Ireland. I think the Minister for, Minister for Children, I can't remember his name, apologies, a number of months ago, but I do know since this has been taken forward now by an interdepartmental piece of work and approach that the First and Deputy First Minister also had meetings with him, along with Judith Gillespie, who has been in regular contact as well, as to what aspects and what direction any and the independent inquiry will actually take, and the need and necessity for sharing information in both jurisdictions, because as of the nature of what will be necessary as we get to the bottom of this piece of work.
I call Christopher Stalford.
Number 6, Mr. Speaker.
And I think the member, the member will be aware that I deeply regret that anyone has had their surgery or medical procedure postponed or delayed. But these critical decisions are very distressing and they're never taken lightly, because the downturn in elective care has been a consequence of unprecedented pressures that the COVID-19 pandemic has placed on our hospitals over the past year. From the 17th of March 2020 to the 5th of March 2021, a total of 16,938 procedures, operations and diagnostic tests have been postponed. However, it's important to note that that includes cancellations for all reasons, not just COVID-related. Procedures are often cancelled for a myriad of other reasons, such as clinical circumstances, patient cancellations or staff pressures. Nevertheless, I am assured that every attempt is made to protect the most urgent appointments where this is achievable, and the postponed tests, procedures and operations will all be rescheduled as quickly as possible. To that end, my department has commissioned trust rebuilding plans for the 3-month period from April to June, and I will publish detailed activity projections, and these will be published alongside these. While the number of COVID patients in hospital and in ICU have reduced in recent weeks, the emergency from the latest wave is slow and the situation remains extremely challenging. Trusts are keeping the position under daily review in order that they may reinstate and resume surgery fully as soon as capacity is safely available.
Mr. Stafford, supplementary.
At the commencement of this crisis, the phrase biblical proportions was used by the Minister to describe the scale of the challenge that we're facing. Given the answer that he has just provided, what assessment has been made by the Department of the biblical proportions of cancelled surgeries and the impact that that will have going forward?
I think the member is well placed in the position that he takes. It was one of, and it still is, one of the biggest challenges that faces my health service and all those who work in it. A health service that has been underfunded, under-resourced and undervalued for the past 10 years. And unfortunately, when we saw the complete escalation and pressure that this global pandemic placed on our health service, the drastic decisions that were needed to be taken were not taken lightly either by my department or by trusts or by clinicians who made these decisions in regards to what services had to be scaled back so that we could support those patients coming forward with COVID-19. But I am assured and I'm reassured when I see the rebuilding plans, when I engage with our trade unions, when I engage with the Royal Colleges about their desire to get back up and running as fully and as quickly as they can, but also as safely as they can as well. So that ongoing rebuilding framework that we continue to do, as I said, we'll be republishing that next 3-month, April to June, rebuilding schedule towards the end of this month, because we have made it clear we're going to take it in that 3-month blocks so that we can escalate proportionally and with as much speed and dedication as we can. But as I said in an earlier response as well, we do have to look at a regional approach so that patients are willing to travel outside their own trusts and their own areas where they would usually have been seen, because what we're now seeing is our health professionals, surgeons, willing to travel from Belfast to utilise operating theatres in the SWA and other areas as well, so that we can get full capacity of the health footprint that we have, but also full capacity that we can to get as many patients as is possibly re-seen as quickly as we can.
That ends the period for a list of questions and move to topical questions. I call Claire Bailey.
Speaker, I'd like to ask the Minister, in response to a question from Mr Alistair yesterday during on the floor, in response to finding out that the Republic of Ireland had issues with the AstraZeneca vaccination, you had let the House know that you had asked your Chief Medical Officer to review the terms of the Memorandum of Understanding. I'm wondering if you can let us know what is being reviewed under the MOU and how you will be moving forward with it.
I think the our current Memorandum of Understanding with the Republic of Ireland is about the sharing of information, data, quickly, efficiently, so that we both know in either jurisdiction what is happening or decisions that the other one will be taking. So I was disappointed to receive the notification that the Irish Republic were actually taken in regards to through AstraZeneca, that I found out through the media. So I've asked the Chief Medical Officer to engage with his counterpart, who is the co-signatory, to make sure that we realise the full operational value of that Memorandum of Understanding and to prevent such reoccurrences happening again, because it doesn't help either of us when either of us are actually blindsided by a decision that has been taken in either jurisdiction.
Claire Bailey, supplementary.
Thank you, Speaker. And I see there's a report out from an EU committee today to say that there is no evidence of negative impacts from the AstraZeneca vaccine. Have you sought any assurances, or have you been given, more importantly, any assurances from your counterpart in the South that that they can go ahead and use the vaccine again?
In regards, and I think, in the urgent oral that was brought yesterday, and I think allowed us to update, we'll take our guidance from the MHRA, that guidance of the safety and efficacy of the Oxford AstraZeneca has been repeated by the World Health Organization, by the European Medicines Agency. So I struggle to see why the authorities in the Republic took the decision that they did, but it is their right to do that. I'm just concerned that it has an overall impact on their vaccine process and also discourages people in the Republic of Ireland in regards to the efficacy of the Oxford AstraZeneca, something thankfully that we have not seen here in Northern Ireland. And in fact, in the answer that I gave yesterday, when we opened up our vaccine portal to over 50s, with 30,000 people in 3 hours were willing to come forward for the vaccine. And I know the member was one who got her, or well, haven't got her, but got the booking as well. So, and again, I thank her for her support and her endorsement of not just the vaccine, but also those involved in the vaccine process, because it is an amazing achievement, I think, for our National Health Service to see it in full operation, also from those who work in it, but also the volunteers who are taking part, supporting them as well.
Christopher Stalford.
Thank you, Mr. Speaker. Does the Minister believe that the data informing government decisions around lockdowns is too complex to be shared with the public?
No, I don't. And I was thankful that the newsletter actually printed an apology. That headline that they put out when it said that was actually in quotation marks and was not a direct reflection of anything that I had said.
Christopher Stalford.
Thank you, sir. That being the case, I presume the Minister will therefore be publishing the data that's guiding decision-making processes?
That being so, that data and information is already available on my departmental website. It is already available on the COVID-19 dashboard. It's already available on the Public Health Agency's dashboard as well, where we look in regards to where the trajectory of the virus is taking. Also the R papers that we produce, which supplies more than just the R number, that we use to inform the executive discussions, is actually published weekly as well on my department's website as well. So I have heard many calls about making data available. It's there for those who wish to see it.
Remember Pat Sheehan, I call Pat Sheehan.
The Minister has previously acknowledged the benefits of cross-border health services. Could he explain what services will be impacted by his department's decision to require health professionals to be registered both north and south? Thanks.
I thank the member for that. I don't envisage it being largely negative. I don't see it having a big impact because it is a small number of health staff who will have to register on either side of the border. Unfortunately, it's an outworking of part of the protocol that we've seen. So we are supporting those officials and those employees that have to do that. We are supporting them to do that. It was a particular concern that was raised, especially by our NICAS, the team who transfers those critical patients between Northern Ireland and the Republic of Ireland, and the accreditation and certification that they require to do that.
Supplementary, Pat Sheehan.
And I wonder, could the Minister outline why there is such urgency in making professionals who deliver cross-border services to be professionally registered before the end of this month?
I think the urgency is to make sure that we have all bases covered, so that there is no challenge or no opportunity for someone to have missed that registration process, which allows them to deliver their professional skills and supports on either side of the border should that cross nature be affected as well. So it is something that we would encourage all staff members who do have to register in either jurisdiction to do it as quickly as possible to make sure that they're not caught out personally or professionally.
Recall Jonathan Buckley.
When we look back over the period of COVID-19, there will be many points of difference between the Minister, myself and indeed many other parties as to the response. But one thing that we can all jointly take pride in is the vaccination programme, and I thank the NHS for the diligent way in which they have carried out that service. In relation to the withdrawal of AstraZeneca on many European countries, can the Minister indicate, has he received any pressure whatsoever to withdraw AstraZeneca from use?
No, and I was thankful for the cross-party support that I received in this House yesterday for the stance that we have taken, because that stance is science-led. It has been led by the guidance and the updated guidance that we received from the MHRA on Sunday in regards to that additional information that we sought, or that reassurance that we sought after the Irish Republic made the decision that they did on Sunday morning.
Jonathan Buckley, supplementary.
Thank you. Minister, sadly, what will result in this delay in the vaccine AstraZeneca to the Republic of Ireland and other European countries will be a slowing down of getting their populations vaccinated, which should be the priority of every nation across the world. Minister, could I ask, if and when we get to a point where we do have an adequate proportion of our society vaccinated and society back to normal, if there is access vaccine, can the Minister indicate, has he had any conversations by means in which we can share vaccine with our friends and neighbours in the Republic of Ireland?
I will say to the members a conversation I had with the Secretary of State, and it's also an issue that was raised with the Prime Minister when he was here on Friday, because we are concerned about the different rates of vaccination in both jurisdictions. We would like to see the whole island be at the same level, but I will not slow down the vaccination process and procedure here in Northern Ireland. It would have been unfortunate that should we have actually shared Oxford AstraZeneca with the Republic of Ireland prior to their announcement on Sunday, that vaccine may have been actually sitting unused. So while I am open to the sharing of vaccines to make sure that we can get the entirety of this island to a level, my focus, and not as Health Minister of Northern Ireland, is for the people of Northern Ireland in the first instance.
Patrick McGlone. Call Patrick McGlone.
Thanks very much, Mr. Speaker. Could I ask the Minister what measures have been taken at departmental level with trusts to ensure that domiciliary care packages in those areas where there are voids and have been voids for quite a considerable amount of time, and where elderly people and disabled people are being left isolated due to the absence of domiciliary care packages?
And I thank the member, and I know this is something that the member is very passionate about, because it's something he has raised with me personally, specifically in regards to Mid-Ulster. The Northern Trust has received additional money so that they could support and encourage additional domiciliary care workers for that specific area. I'm unsure, I don't have a recent update as to the success that they've had, but there is those additional supports have been referred and have been talked about.
Patrick McGlone, supplementary.
And thank the Minister for his answer. Yes, additional resources appear to be there, okay, but resources in this instance doesn't match people on the ground to fulfil those care packages, and to make sure that, again, those disabled, isolated, often elderly people in poor health are getting the support that they require. So I wonder, is there any mechanism by which the Minister can ascertain the delivery on the ground in terms of extra personnel to support people living on their own in isolation?
And again, it's about that meeting, the care home packages that currently are, and the member knows this as well as I do as a constituent representative. It's okay funding care packages. It's a different matter getting people actually to deliver those care packages as well. And anybody that represents a rural constituency, but I don't think it's solely now a challenge for rural constituencies as well. And I think that was one of the things that I was very clear during the pandemic, that we really saw the valuable service that our domiciliary care workers actually provide. They were a service, I referred to them as the Cinderella service, they were often forgot about, never mentioned until we saw the real value that they bring as well. So there is as I say, that support mechanism has been given to the Northern Trust, and I'm sure they are engaged in making sure that as many care packages are not just fulfilled financially, but also have the personnel to fill them as well. And I think, if I recall recently, I think the Northern Trust actually has an advertisement out looking for recruitment for domiciliary care workers in that area, but I can follow up with the member as well.
Call Matthew O'Toole.
Mr Speaker, to go back to an answer the Minister gave earlier on in relation to cross-border health workers having to register with professional bodies, he mentioned that it was an outworking of the protocol, but with respect, Minister, that's not true. This is something that isn't in the protocol. This is an area where EU legislation was applied in Northern Ireland and isn't now. So because it's not covered by the protocol, these people are having to register. Can the Minister guarantee us that this anomaly will not have any impact on cross-border healthcare, including the transportation of sick children to hospital in Dublin?
And I thank the member for pointing out that correction. But I think it's also, in regards to the question that Mr Sheerin raised, that's why we want to push as many people to get that dual registration as quickly as possible, so that those sort of opportunities and those missed opportunities don't happen, so we actually see somebody being on the other side of the border in another jurisdiction where their certification and registration actually doesn't cover them from a liability point of view.
Matthew O'Toole, supplementary.
Thank you, Mr Speaker. Further to that, can I ask that the Minister raises with his counterpart in the Republic, and there just is absolutely no doubt that healthcare on either side of the border is going to be disrupted by that. I appreciate what he said, that he's confident people can be registered quickly, but it's just really important that we have absolute clarity on that. Thank you, Minister.
Look, in regards, my officials in my department are in regular contact with their counterparts in the Republic of Ireland, and I know this is an issue that has been covered and has been talked about.
Members take your ease for a moment or two. Thank you. Members, just before we do return to today's business, I wish to inform you that I have received a request from the First and Deputy First Minister that they wish to make a statement setting out the decisions taken today by the Executive as part of the Executive's pathway out of COVID-19 restrictions. This statement will be taken after the supporting motion on students and prior to the adjournment debate.
Members, the question is that the amendment standing in the name of Jerry Carroll be made. All those in favour say aye. Aye. Contrary, no. Contrary, no. It's very quiet, no. So at this stage, I presume that the ayes have it, and therefore the amendment is made. So the question is that the motion, as amended, be agreed. All those in favour say aye. Aye. Contrary, no. The ayes have it, and the question is that the motion standing on the order paper has now been agreed. So, thank you. Okay, members, the next item on the order paper is a motion on supporting students. I will ask the clerk to read the motion, please.
That this Assembly welcomes the recent announcement of a £500 COVID disruption payment for students studying full-time higher education courses, believes that the exclusion of full-time students studying further education courses and students studying higher education courses in the Republic of Ireland or in Britain is unfair, acknowledges the difficulty of part-time students facing financial hardship also needs to be addressed, and calls on the Minister for the Economy to address these inequalities and ensure that all students who are currently excluded from the COVID disruption payment receive the £500 payment.
Thank you. I call Dr. Caoimhe Archibald to move the motion. Thank you very much indeed. The Business Committee has agreed to allow up to 1 hour and 30 minutes for this debate. The proposer of the motion will have 10 minutes to propose and 10 minutes to wind. One amendment has been selected and it is published on the marshalled list. Please open the debate on the motion.
And Mr. Speaker, this has been a really tough year for very many people. The pandemic has had a devastating impact on the lives of so many, thousands of people have lost loved ones, others have been seriously ill, and others have lost jobs. To try and save lives and reduce the pressure on our health service, we've had to stay at home, our workplaces have closed, and all of our movements been restricted. Businesses have received hundreds of millions of pounds of support to help them survive and try to protect jobs and livelihoods into the future. Workers should have been receiving support where they are unable to work through the furlough scheme, and self-employed people, again, for the most part, have been supported, albeit with all of these things there are some exceptions. Students, on the other hand, have signed up for courses, some told they'd get some classroom time, others told it would be remote learning for at least the first semester. But last summer, no one was able to tell them, don't sign on for those rental leases because there's a good chance you won't be living in those houses. Since last March, there have been very little opportunities for students to get the part-time jobs that are unfortunately necessary for most students to supplement their student loans and help them scrape by. Students have been left in a situation where, despite the best efforts of lecturers, teaching assistants and other staff, the university or college experience is not what many had expected or signed up for. They've had to keep paying bills despite not living in houses, and they've had to try to support themselves with no work opportunities. Of course, it's important to point out that students aren't a homogeneous group. The majority of students, and particularly undergraduates, might be young people, but they include young parents, young people with care and responsibilities, young people with disabilities. They include mature students with families and other responsibilities. They include part-time students paying for their own courses while working to pay bills. Students come from all walks of life and have a variety of financial and other responsibilities. It's also important to recognise the nature of our higher education system, increasingly marketised where students are seen as customers, with fees here second only to England and Wales as the highest in Europe, meaning students struggle financially while studying and after they begin work. Understandably, in the current circumstances, our students feel exploited and shortchanged. Mr. Speaker, coming out of the pandemic, as we look at rebuilding our economy and society, we also need to look at how we support and fund education and training. I will.
The Chair of the Committee for giving way. She obviously knows I represent South Belfast, and we have a significant student population, but also a significant number of houses of multiple occupancy, and private landlordism has, in many parts of my constituency, destroyed the character of local communities. Does she agree with me that it is, while it may be legally right to hold people to contracts for properties, it's actually morally outrageous to do that to people?
I do agree with the member, and it's actually something I'm going to address later in my contribution, but I think that a lot of landlords need to look at the role that they've had in the course of this pandemic and how they have or haven't supported students, and if they really have been all in it together with their student tenants. Since last year, John O'Dowd and I have been raising the need for students to be supported with the Economy Minister. Sinn Féin ministers in the Executive have supported our calls for support. And last June, I think it was, additional money was allocated to the student hardship funds in the recognition of the fact that many more students were facing financial difficulty, and that was very much welcomed. But the feedback from students over the months following that was the application processes and barriers to those funds meant students weren't getting the support when they needed it. Bureaucracy designed for non-COVID times was making it difficult, and frankly that's something in the longer term that I think needs looked at also, but that's for another day. After a lot of work by student representatives highlighting the issues impacting students, the financial difficulties, the difference in the education experience from what they had expected, the loneliness and isolation, and the mental health impact. And Mr. Speaker, I've engaged with student representatives a lot over the last number of months and with individual students, and the impact on mental health of the financial pressure, but also the isolation and the worry and impact of COVID generally has consistently been raised. My party colleagues will be speaking to that further. But I'm sure that we must not underestimate the need for further support for students struggling with poor mental health. Student organisations and representatives should be proud of the role that they have played in ensuring student issues have become a priority for MLAs and ministers. The COVID disruption payment being put in place is testimony to the impact that campaigning loudly and consistently has. We all very much welcome that payment, recognising that it doesn't pay all bills, but it is in itself a recognition that this year has been a difficult one and students haven't got what they signed up for. However, it unfortunately only went to some students, and not all those who are studying here or all those students from here. The Economy Minister has set out her reasoning that the payment is in recognition of the impact of COVID and of the restrictions put in place by the Executive on students here. If that's the case, why have part-time and international students been excluded? The Minister has said there are legal barriers to making payments to students in other jurisdictions. What are those barriers and what alternatives have been explored? Has a legal mechanism been explored that would allow the payments to be made? The Minister has also set out that further education students don't pay fees and that's why they haven't got support. But further education students have been impacted in the same way, and many FE students are in the same situation as higher education students in terms of having to continue to pay rent and bills with little income opportunities. Mr Speaker, every time we discuss education and skills in this chamber or in our committees, we talk about the need for parity and the emphasis and importance placed on academic and vocational education. What does it say to students in further education that they aren't getting the same payment as those in higher education? Does it say that they are viewed as less than by this department? I want to reflect on some of the things that students have sent to me over the past few days. And as Mr Stalford pointed out, I could reflect a lot more when it comes to students having contacted me about landlords and accommodation providers, and I have addressed that, I suppose, already. But over the course of the past couple of days, I've received dozens of emails from students, as I'm sure other MLAs have. I've had students tell me about their personal experiences. I've had part-time and further education students who don't understand why they aren't getting the payment. Postgraduate students studying in the south who don't even get a loan to support their fees. Those in England have pointed out that they already get less in terms of student loan support compared to their English friends studying the same courses, despite them having to travel to study. They're away from their families and they feel left behind in not receiving this support. One student in England says, "In a time where student isolation and unemployment is rife, I would like the Minister to acknowledge the fact that Irish students, whether in Britain or in the south of Ireland, are facing the same financial struggles as those back home in the north." What message does the exclusion from those payments send out to students from here who are studying in England, Scotland or the south? How does it make them want to come home and contribute to our economy if they feel disregarded by the Economy Department? Minister, I recognise that funding has been made available to universities and colleges to help support students. I recognise that money has been made available for additional hardship fund support and for digital support. Extending the COVID disruption payment is about recognising that every student studying here in the north in some way has been adversely impacted by this pandemic, and recognising that those students from the north studying in the south or in Britain have been impacted in the same way, that they have not had similar support where they are studying and have the additional burden of travel costs and being away from their family at this difficult time. I know the Minister will have been inundated with calls from students and MLAs to extend the payment. My party colleague John O'Dowd recently presented a petition signed by over 3,000 students asking the Minister to extend the payments, but as yet the Minister doesn't seem to have listened. However, there is still time for you, Minister, to say to students, "I hear you. I want to recognise in a small way that this has been a really difficult and disappointing year, and it's not the experience you hoped for when you signed up for university or college." Minister, you have the opportunity. Sorry, I have not very much time left. You have the opportunity as the Minister with responsibility for students to stand up for students. I hope that you will heed the calls in this motion and finally do this. And Mr Speaker, I suppose in closing, I would like to thank the student organisations, representatives and all students who have been in touch. And I'd like to ask members to support the motion and to reject the amendment which waters down what the motion is calling for.
I call Gary Middleton to move the amendment. And the member.
Move, Mr Deputy Speaker.
Thank you. You will have 10 minutes to propose and 5 minutes to wind. All other speakers in the meantime will have 5 minutes to please open the debate on the amendment.
Thank you, Mr Deputy Speaker. I firstly wish to say that it is welcome that we have the opportunity today to speak on issues around student support. I think that's very much welcome. It's something that I very much take pleasure in when I come to the Chamber, is speaking on student issues, and I know that a lot of the representative bodies of students have been in touch with MLAs right across the course of the pandemic. And I want to pay tribute to those organisations in the way that they have campaigned so proactively, but also respectfully. And I think it's very important that I put that on record on behalf of the Democratic Unionist Party. Students of all ages right across the province have faced very challenging circumstances throughout the COVID pandemic, of course along with many other citizens within our communities. Particularly for students, the impact on their studies, financial hardship, mental health impacts, which I'll speak about in a bit more detail shortly, the challenges around accommodation, and of course it was mentioned around contracts with landlords and the difficulties that students have found themselves in. We have all, on all of these benches, heard firsthand from students who found themselves in real difficult circumstances on a wide range of those challenges which I have outlined. Of course, students come in all shapes and sizes, ages, backgrounds, and very much, as I say, students have raised their issues over the past while very proactively, and I think it is important that we hear those concerns. In terms of the proposers of this motion, like them, I very much welcome the announcement made by the Economy Minister Diane Dodds in relation to the £500 COVID disruption payment for our students. This, of course, was part of a wider package, a £37 million package, which addressed a number of areas right across the higher and further education sector. That package was announced back in February, and the package was very much welcomed right across the sector. The package included a one-off £500 payment for students from the UK and EU who are here in Northern Ireland in full-time higher education, whether that is within the university setting. £8.5 million was provided to address student financial hardship, digital poverty, and to support student unions with mental health provision as well. £4.1 million for the provision of a safe working, learning and research environment. And finally, a £3.1 million package to compensate universities for lost income arising from rental pauses and releasing students from accommodation contracts. So the level of support for students here in Northern Ireland provided by the Department for the Economy during COVID-19 has been unrivalled by administrations right across the UK or indeed the Irish Republic. As we understand it, yes, I will indeed.
The members on the Further and Higher all-party group with myself, would the member agree that the Health Minister should immediately clarify and make sure that all students, including those in clinical placements, should receive the COVID disruption student support and be included in that scheme?
Thank you, Mr Deputy Speaker, and I think my colleague from Foyle, I do agree with that. I think that the all-party group on further higher education is an example of one of the proactive all-party working groups which raise various issues, and that being one of them, and I think it is important that the Health Minister very much takes that on board. The all-party group obviously met last week and raised quite a few issues that obviously need to be taken on board, none less than the Student Mental Health Action Plan, which I think when we talk about student issues, we need to be mindful that student mental health is very much at the forefront, and that itself needs funded. So when we talk about the £500 payment, we need to look, as important as that is, that is not going to solve all of the problems. There's much more wider issues which will need to be addressed within the student setting. So I thank the member, of course, for that intervention. In terms of students in Northern Ireland studying in England, Scotland and Wales, they do have access to support from the institutions that they are enrolled in. My understanding that in the region of £175 million has been provided to institutions and students in GB and ROI, and the key, of course, to that will be ensuring that such investment translates into practical and timely support for those most in need. I do welcome the fact that Minister Diane Dodds has previously indicated in response to numerous questions that she will continue to raise the issue of support for students with their counterparts in the other jurisdictions. I think that's very important, and if anything comes out of the debate today, I think that we continue to go in that direction. And obviously the amendment deals more with that aspect in terms of sending a message from this chamber that the Minister has the mandate to go and speak with those jurisdictions and ensure that they, of course, step up and deliver for the students within their remits as well. So I very much welcome that. The COVID disruption payment is one such area where our counterparts can assist students from Northern Ireland. The amendment tabled, I would dispute that it's a watering down. I think that really what it does is it more reflects the reality of the parameters that the Minister is dealing with. I think that the Minister will be the first to say, and no doubt she will speak later on, in terms of how passionately she does feel about students here in Northern Ireland. Hence, I will indeed.
I'm really grateful to the member for giving way, and I think that's actually the key point that he has just made. I think it's important that we are honest with people and straight talking with people, and I think that our amendment reflects the reality of the situation, both legally and politically, and it's important that people are making statements and taking positions that are grounded in reality.
I thank you, Mr Deputy Speaker. I thank the member for that intervention, and it's a key point that I do want to get across today in the short time that I have, is that this is not about sending a message out that nobody wants to do anything more for students. It's quite the opposite. I think that we need to do what we can, hence the reason the £37 million package has been brought forward, unrivalled in terms of the other jurisdictions. And I know that many students were very, very much appreciative. Certainly the ones that I have been in touch with have appreciated that. And notwithstanding there are challenges and there are difficulties, and there will be people who feel that it doesn't go far enough. But again, I think that the message is that the Department are trying their best to reach all of those right across our society and all of those that are in need in a timely fashion. But in terms of the COVID disruption payments in Northern Ireland, they, of course, are being made via the higher education institutions themselves, not directly through the Department. And the Minister has made clear in response to previous questions that the Department does not have the legal power. That's the key point. It does not have the legal power to make allocations to universities outside of Northern Ireland, whether that be a university in England or indeed the Irish Republic, or indeed, for that matter, the Students' Loan Company. So it's simply not possible for the Minister to deliver funding through universities and further education settings either south of the border or across the rest of the United Kingdom. There are no... yes, very briefly.
Brief, and I appreciate the member taking the intervention, but would the member agree that this problem isn't going to kind of go away? Students are going to continue to face financial difficulties, and that the Department should look at how it could potentially put in place support and pay it out?
I thank the member for that intervention, and again, as I said earlier in the speech, the Minister has made very clear to me personally, but also to members across this chamber, that she will continue to raise the issues of students. Of course, there's a huge remit within the Department, but we're here today, as I said, thankfully talking about students. And we need to try and do whatever we can to support them within the legal possibilities that we have. And no doubt the Department has explored all avenues potentially open to them. But again, no doubt we will hear from the Minister very shortly in that regard. But the priority must be, as always, to ensure that we get support to our students in a timely and effective manner. The most appropriate way to deliver those payments, of course, in a timely and effective manner, was to do so through the existing mechanisms by the way of the institutions themselves. But that said, Mr Deputy Speaker, we do fully appreciate the hardship experienced by Northern Ireland students based in other parts of the United Kingdom, indeed the Irish Republic. And I would urge all of us who have MP positions to continue to lobby at Westminster as well, in terms of those other institutions, to ensure that they provide support for our students. But just finally, Mr Deputy Speaker, for my part and for our party's part, we will continue to raise the issues on behalf of students, whether it be through the all-party groups or in this chamber. I think that it is important that we address those. And just finally, quoting from the Student Mental Health Action Plan launched by the Ulster University Students' Union, like them, we all want to see a greater and happier society, and we believe that investing in our young people now will create a better Northern Ireland in the future. Thank you, Mr Deputy Speaker.
Okay, thank you. Agus nish, Iram Sir Sinead McLaughlin, Hon Canchai called Sinead McLaughlin.
Thank you, Mr Deputy Speaker, and I welcome the opportunity today to speak on the motion. The pandemic is a crisis not just for physical health but also for mental health, and this is particularly true for our students who expected to have the best of days of their lives But unfortunately, it has transpired that they're dealing with the worst days of their lives. Instead of making new friends, many are studying in their parents' homes, others in halls of residence, yet isolated from other students and from their families. They are paying extortionate tuition fees for Zoom calls, and many are living in areas with poor broadband access. This terrible situation is hitting students badly. Some are abandoning their university or college course this year and hoping that they will feel psychologically strong enough to start again in September. At its worst, and this is just terrible, students have taken their own lives, hit by depression, not able to see a longer-term future, and they've given up. The SDLP's survey to students, which had more than 500 respondees, illustrated clearly the impact. 3/4 of the students reported a decline in their mental well-being because of the lockdowns. How can students perform at their best when they are starved of human contact and are short of access to people to ask advice from? Zoom is definitely no substitute for human contact. Money shortages make this worse. Students have had to pay a fortune for accommodation that many of them have just been unable to use, and very few have been able to earn money doing part-time work that they expected to depend upon. This financial crisis is very closely associated with a mental health crisis. But can I say a word here about the hardship funds that members have spoken about? Time and time again, in correspondence to the Minister, she has responded that students should apply for support through hardship funds. But the criteria for hardship funds is a real problem. One student who contacted me was rejected from hardship funds because he once, and I stress once, made a £5 bet. That one £5 bet from months ago has actually disqualified him from support. Another student contacted me because hardship criteria insists that he must first apply for an overdraft facility, but he believes that he won't get an overdraft, and he also said that it could damage his credit rating by being rejected for an overdraft before he can even apply for a hardship fund. So when we hear that students in difficulty should apply for hardship support, can I ask you to remember two things? Firstly, the size of the hardship funds is too small to meet the demand that students are experiencing and the difficulties that they are experiencing. And secondly, the criteria create a barrier that is impossible to overcome for even some of those students in the greatest financial difficulty. The criteria is at best ridiculous, but at worst is deliberately exclusionary and can cause financial difficulties for our young people. Okay, thank you.
You'll get an extra minute, so don't worry. The member mentioned the problems arising with mental health. A recent answer to a question that I submitted to the Minister for Health demonstrated the scale of the problem. Northern Ireland has now set a brand new record for the level of antidepressant prescriptions being issued to people over the course of the last 12 months. Surely we can all see the devastating impact that lockdown is having on people's mental health.
The member has an extra minute.
Thank you, Mr. Salford. And I totally agree. This is a mental crisis for our mental health here in Northern Ireland. I think every member in the House will agree with you. This is also impacting on families with parents and guardians trying to support their children despite maybe being on furlough or unemployed themselves. The SDLP made an amendment seeking to draw attention to the weakness of the hardship fund structure and the crisis in mental health, but the amendment wasn't chosen. But a word before I finish just on the DUP amendment. We're glad to see that the Economy Minister heeded our call and brought forward the COVID-19 disruption payment of £500 that we suggested, and it has provided huge comfort for eligible students. However, as this motion says, the scheme excludes students from GB and from the South from accessing support, and that is fundamentally wrong. These students are living away from home and they're under more financial pressure than those actually studying locally due to the high fees in GB. These are students from the North here, Minister, and we don't want to ignore them, and I don't think it's right. Minister Dodds has said in a written answer that her department's regulations have prevented her from making £500 payments to her students in GB. But can I ask, has she considered ministerial direction in this? Has she consulted her executive colleagues to agree a joint approach on this to change the department's regulation? Is there a single party in this assembly that is against making payments to GB and ROI students? Has the minister actually tried hard enough to provide support for those students that so desperately need
Would ask the
assistance
member
at
to
this
draw
time?
remarks to a close, please.
We don't believe that she has, Mr Deputy Speaker. The pandemic has shown us that we can find solutions to red tape, and we think if there is a will, Minister, there will be a way. I will be supporting the motion. I will be voting against the amendment.
I call John Stewart.
Here. I know before I've said a word. Thank you very much, Mr Deputy Speaker, and I rise on behalf of the Ulster Unionist Party today to support the motion. I want to acknowledge from the outset the £500 COVID disruption payment announced by the Minister on the 4th of February. That payment was extended to every student from the UK or EU enrolled in a full-time higher education course in Northern Ireland. And that one-off discretionary payment was rightly acknowledging the disruption that students had suffered as a result of the pandemic. But sadly, the limited scope of the eligibility criteria has meant that almost 75% of students in Northern Ireland were not able to avail of this vital support, and despite that matter being raised with the Minister on numerous occasions, requests have so far fallen on deaf ears. Since that announcement, I've been contacted, like many of us in the House, by dozens of students in further education colleges, students in GB, students studying in the Republic of Ireland, students enrolled in theological colleges, and students studying part-time at higher education institutions here in Northern Ireland. The level of disruption, uncertainty and financial difficulty suffered by these students as a result of the pandemic is no different to those students who have met the original criteria. In fact, it is often worse. So how is it fair or equal not to give similar access on a similar level? We've already heard from a number of speakers the deep pressure and stress and anxiety that students here are facing as a result of the pandemic. And I want to pay tribute to the SDLP on this, who have done great work in terms of surveying and working with students to try and get a real feel for the pressures that they're under, and all the members in the House who have engaged with these students. The numbers are startling, especially when we look at the mental health aspects of that. But not one to cover all grounds, just to cover a few points, Mr Speaker. Full-time students, higher education students in Northern Ireland, GB and ROI are facing mounting problems and difficulties as a result of the pandemic. They are paying full fees for courses that are primarily taking place in their bedroom. They are paying extortionate rent to private landlords for accommodation they cannot use. And our colleague from South Belfast highlighted the, while legal, yes, enforcing that, morally repugnant, that are charging full rent. Some people haven't even set foot in these buildings. It is disgraceful, and hopefully collectively we can work to try and push that issue. They are not able to avail of the part-time jobs that all of us who are students use as a safety net financially to get through university. Many are struggling to access broadband in rural areas. There's a lack of access to the right studying equipment and to libraries and to other facilities. And let's face it, much of being what a student is about the social environment and everything that goes with it. They're not getting anywhere near that experience. Mr Deputy Speaker, I can remember being a student. It was difficult to get by in normal circumstances, but I've been contacted in recent days and weeks by so many constituents studying both here and in GB, whether they be full or part-time, who are finding the stress and strains almost unbearable. To many in this House, a £500 payment might not seem very much, but for people who have just paid rent and the money towards a landlord for a property they can't use with less than £1 left in their bank accounts, it means everything to them. It's a lifeline. This payment being extended would recognise those students who are the original excluded and would actually acknowledge their hardships, even though they're ineligible at this stage. Mr Speaker, there simply has to be a way to provide a level of equality and fairness to all students, no matter their situation. I know the Minister has replied to me directly to my written questions on the topic, and she has outlined why the Department cannot go further, but where there is a will, there needs to be a way. What this pandemic has told us is that we need to find creative solutions no matter what the problems are. And if that means engaging with student finance organisations or creating a direct application process, then so be it. We have overcome bigger diversities in this so far in the pandemic, and I think there can be a way of solving it. Mr Deputy Speaker, to finish, your days as a student are meant to be the best days of your life, but for students in Northern Ireland studying here or in GB or in the Republic of Ireland, that couldn't be further from the truth. They are isolated, financially strained and getting nowhere near the student experience they expected. We have an obligation to do all we can for them, and starting by extending this £500 grant support, that would be one way of doing that. Thank you, Mr Deputy Speaker.
I call Stuart Dixon.
Thank you, Deputy Speaker. And indeed, Deputy Speaker, if you hear essentially the same speech repeated in this chamber again, perhaps the Minister will maybe start to get the message. Mr Speaker, this has been an incredibly challenging year for students. Regrettable that many students have felt let down by a lack of support coming not only from this Minister but also their institutions. Students are now, as many have said, mostly learning online. And while that has been, of course, necessary to tackle the COVID-19 infections, it is clearly not a replacement for in-person teaching and the interaction that student life gives and is expected to give. Library services are almost challenging to access, meaning students may see greater costs associated with printing and even have to buy textbooks, which they might normally get by way of a loan. In addition, this has also meant that they are stuck with accommodation, and reference has been made to that, which either they don't need or they've never really been able to use. And I appreciate that there's a contractual issue, and others have spoken about it. But I would appeal today to another minister, that's the Communities Minister, to do what she can to provide help and advice to those in that position. It's therefore extremely welcome that the Minister has introduced the £500 COVID disruption payment. And this is an issue which we've been seeking to resolve for quite some time. However, Deputy Speaker, it is regrettable that Northern Ireland students, as others have said, studying elsewhere have been excluded, as indeed have most further education students, non-UK and non-EU students. Indeed, there are other groups, those attending non-publicly funded institutions, such as Belfast Bible College, part-time students and those studying with the Open University. The Minister says that she doesn't have the legal varies to make some of these payments, but just because she can't doesn't mean she shouldn't be making the effort to try and do it. That needs, and we need, a clear explanation as to the steps that can be taken to deliver funds to everybody that I believe, to all those students that I believe everybody in this House believes should receive the money. Students have been negatively impacted by the loss of part-time work, which supplements income due to the pandemic. So I don't see how or why support should not be provided here, and that seems to be an excuse that has been coming forward. I do accept the Department does not have the power, as it says, to pay students in circumstances studying GB and in the Republic of Ireland. But this is a legislative assembly. We need to find ways around these issues and problems. Problems are there to be resolved, not to be resisted or used as excuses. I will.
Given way, I've listened to him and colleagues in this House. His colleague, the Justice Minister, is currently refusing to fund the additional police officers because she doesn't have the money. Where does the member think that his colleague will find the 40 million to be able to do that on top of the amount of money that will be needed to address this issue? And could he just tell me, where is the money tree?
Members, an extra minute.
Yes.
I think the member across Mr Story would find the answer if the Minister would make a bid to the Finance Minister for some more COVID funding payment that the Finance Minister has encouraged the Economy Minister to do, but thus far she has refused to do so.
The member has an extra minute.
Thank you very much, Deputy Speaker. And Deputy Speaker, just for the assurance of the House, I'm more than capable of answering my own questions. And indeed, the person who kindly helped me out has rightly indicated that that's exactly the statement that the Finance Minister made in this House yesterday, that he had to make a statement here yesterday because other ministers simply failed to make the bid for money which could have been forthcoming to solve this problem. The £500 payment is not only an intervention which we should have to support students, and I know the Minister makes reference to hardship funds at universities. which should play a big part in providing support. But I am concerned that it's not adequate or wide enough to provide the help where and how it is needed. We've heard quite often how university hardship funds have been difficult to access and perhaps not adequately advertised, and that there are indeed barriers with regards to providing hardship funds. I think it's an issue which we need to look at in general, because hardship is not only a feature of this year, but it's a feature that students face in all circumstances and around how student finances should be progressed. So in addition, although financial support is vital, there are other things which universities can do to reassure and support their students. I've written, for example, the Deputy Speaker, to the Vice-Chancellors of our two main universities to ask that they support both a student safety net to ensure that students do not see their educational outcomes impacted by COVID-19. And this should include uncapped and free resets. And I hope the Minister can also support this and encourage it with both Vice-Chancellors. But, Deputy Speaker, let us be clear. Students have felt let down and have forgotten for most of this year what it is to have an enjoyable student life, challenged by academia, meeting their friends and the ability to socialise and live.
Please.
Deputy Speaker, in conclusion, I would encourage the Minister to listen to this debate and to work to provide creative solutions to delivering £500 to more than those students that she's already provided the funds for. Thank you.
I guess Éireann Sir Liz Kimmins on Cancha. I call Liz Kimmins.
Deputy Speaker, I'm exasperated that 1 year on from the start of this pandemic, we are still fighting to ensure that those who have been severely impacted by COVID-19 receive much-needed support to help them survive the unforeseen challenges this pandemic has presented us with. Over the last number of months, I, like many other members, have been engaging with hundreds of students from across my constituency and indeed across the North who feel excluded and undervalued by the failure of the Economy Minister to support them during this challenging time. Week after week, via Zoom meetings, emails, social media and through our offices, we have listened to the hardships that students are facing and the impact this is having on them, causing unnecessary stress and anxiety and subsequently affecting their mental health. Students have been expected, as many others have said, to continue to pay full tuition fees for courses that have been moved online, high rents for accommodation they cannot live in due to the current restrictions across these islands, as well as increased living costs that they need to provide additional resources to enable them to complete their studies outside of their university campuses. And whilst we all fully appreciate the unprecedented challenges this year has presented us with, I feel that the responsibility of the Economy Minister to ensure all sectors within her department receive adequate support to help them through these challenging times has not been met. Other executive ministers have stepped up to the plate and shown initiative and flexibility to get support to those who need it, and she must too do the same. I have written to the Minister, as she will know, on countless occasions to highlight the significant issues students are facing and to all but beg for this payment to be extended to those students from the North who are currently excluded, unfortunately to no avail. I have also asked her to engage with her counterparts in other jurisdictions, and in the absence of this, I too have written to ministers across the water asking them to see what support they can put in place. The message from excluded students is that they feel they are being discriminated against and are undervalued, even more so if they are part-time students, are studying a further education course, or are studying in the south of Ireland, in Britain or abroad.
Thank the member for giving way. Would the member agree with me that the Minister should also consider supporting those students who have already graduated either in June of last year or up until Christmas, who would have been taking exams and completing coursework and still paying rent in accommodation that they weren't able to stay in because of the restrictions?
Members, next minute.
And yes, I thank the member for intervention. I think that's a very important point because one thing we've all learned is that there's so many unique situations here. And I appreciate that it's not always easy to reach everyone, but when we have the information and the knowledge, we must endeavour to do so. So I certainly agree with the member's point. Over the last year, I've heard many different experiences from students and wanted to share some of them with the members today to emphasise exactly what our students, who we continuously claim we want to ensure they will return home to live and work here in the North when they qualify in the relevant career paths, and what they're facing. Aoibhinn is a third-year nursing student from Newry, studying at DKIT in the South, and who has been on placement throughout the course of this pandemic. Aoibhinn described to me the impact on the hospital environment of the COVID pandemic. the increased responsibilities and workload for all staff and students, and as she described to me, one of the most challenging experiences she has had during her time on placement when caring for a newborn baby that sadly would not survive, and how the context of COVID has made this even more difficult, making her role to care for him and to support his family during this very sad time even more important. Aoibhinn hopes to return to work here in the North when she completes her studies. However, she expressed her deep disappointment when she learned the Minister has excluded her and many others from the COVID disruption payment, despite her only studying a few miles up the road. Chris is another student from Newry. He's studying in London as his chosen course was not available here. Chris's course has been moved online and he's currently paying in the region of £3,000 a month in rent for a flat in London that he has not been able to live in due to the current restrictions. He's not eligible for support from student finance in normal circumstances and was heavily reliant on his part-time job to help him cover his living costs while studying at university. Chris, like many others, has lost his job due to COVID and is now facing significant rent arrears which neither he nor his family have the ability to pay. These students feel badly let down and have described how they just need a helping hand to survive these turbulent times. I feel this is an opportunity for the Minister to show all of our students that she and her department value them and are intent on treating them all equally. The reasons given by the Minister to date demonstrate an unwillingness to explore all options to provide this essential support, especially in light, as others have mentioned, of the fact that the Finance Minister, Conor Murphy, has encouraged her and others to make further bids to support excluded students, as he is willing to provide that money, which hasn't been forthcoming. Deputy Speaker, in conclusion, this has been a year that none of us will ever forget, least by those who have been forgotten and excluded from the support that has been provided to date. These students are our future and have an important part to play in the economic recovery from COVID. And if we are truly committed to showing them that we value their contribution and potential, we must treat all of our students fairly and equally. I ask the members here today to support our motion and reject the amendment by the DUP and get support to our students urgently. Caoimhe Archibald.
Meshiadam Sir Early Flynn on Cancha. Call Early Flynn.
I'll ask Caoimhe and I apologise, but I don't apologise. Some of my remarks are going to be repetitive from what other members have touched on, but I think that it's important that they can't be overstated nonetheless. So I rise to support this motion wholeheartedly and would encourage all members to do so. I want to send a clear message going out to all our students that their hardships and struggles are real and are recognised by this Assembly. I will focus my comments to the wider challenges facing students, but particularly to those who find themselves excluded at the moment from the £500 disruption payment. But firstly, yes, I will, yeah.
And I do thank the member for giving way. I've heard this phrase used a couple of times, excluded. Will she confirm for me that the Executive agreed the criteria for the existing scheme, which was approved by the Executive? Therefore, the Finance Minister, the Justice Minister, the Communities Minister and the Health Minister. Maybe could they confirm that that was the case?
Minister's next a moment.
I thank the member for his... the Minister, thank you. I thank the member for his intervention. And not taken away from the fact that the £500 disruption payment that is already in place is absolutely welcome, and that is a big move from the Minister and from the Executive, but the Minister still has that responsibility over all the students in further and higher education. But thank you for making that point. Yes, so firstly, I'd like to just personalise today's debate. Just to remind members, the people that we're talking about today, it's our young people. It's people in their late teens and in their early 20s. It's our young people who are on their own special journey at this moment in time to becoming adults and who are at the most crucial part of their lives, where they're just starting to set out who they are and who they want to be. This is an important time in anyone's life, and I don't think we can lose sight of that. I do think it would send a powerful message to our young people if we could all welcome this motion to extend the £500 payment to all students studying full-time and in higher education courses. Since the early stages of the pandemic, I know other members have touched on this, but my office has also been contacted by many university students who faced paying rent on their halls that they were anxious to go to in the first place, and who lost part-time jobs and crucial hours that they would have usually worked just to get by. However, I was also contacted by those in further education and from students who have been studying in the South and in Britain. And the thing is, they are facing many of the same challenges and pressures. Yes, I will, yeah.
I'm grateful to the member for giving way, and she's right to say that students, and particularly those in part-time work, have been absolutely hammered during the course of the lockdown. That's why at the most recent meeting of the Economy Committee, we agreed to write to the Department to ask for a full list of all of the easements to the economy which the Minister sought. I don't think any of them have been granted by the Executive. So if the Minister is seeking to get people back to work and help people back into work, could she prevail upon her Executive colleagues to perhaps be supporting the Minister in that cause?
I thank the member for his intervention, and again, I think that's a good thing and a positive thing that the Minister for the Economy wants to see people return to work as swiftly and as soon as possible, because that will help with their mental health. But it's also not taken away from the debate that we're talking about today in relation to the extension of this £500 payment. But thank you for intervening. Yes, so the point that I was making was these students, no matter where they're coming from, they're facing the same challenges and pressures. And I know it's been spoke about from some of the previous speakers around the bids that the Minister for the Economy has made in relation to these schemes. And I would be interested to know, I know that the Minister, Conor Murphy, made that allocation of the £22 million for the current disruption payment. And if the Minister for the Economy requested any further bids, which might have included those students that have been left behind from the current scheme. And I know that many members have already mentioned and listed some of the challenges it's facing the students around job losses, the restrictions on seeing their friends and their families, remote learning, and the big one for me, the concern around their mental health and well-being. And I think that it's really important, and it's a good thing that members have been given this chance today to recognise and articulate all of those challenges, because the students will be listening. But more importantly, because a person's mental health and well-being is so closely related to their surrounding environment and to any additional pressures that are placed on them. And students and our young people are no different, and especially those who have been excluded may be feeling those additional pressures at the moment. We know that the financial concerns contribute massively to people's poor mental health, distress and anxiety, as do concerns with housing and where they're going to live, as does loss of hope and purpose, either about their future or the quality of their education. So some of those students will be feeling all of that at the moment. And I'll just finish and bring remarks to a close by quoting a recent prevalence report into the mental health of our children and young people. This report was one that was published back in October 2020, and it noted that 16 to 19-year-olds, essentially the makeup of our student population, are 5 times more likely to have a mood or anxiety disorder than younger children. 5 times more likely. So I know the time's up, and I'll leave it there.
Okay, agus Nish Iram Sir Cara Hunter Hun Cancha, I called Cara Hunter.
Thank you, Mr Deputy Speaker, and I welcome the opportunity to speak on this motion before us today, which the SDLP will be definitely supporting. Mr Deputy Speaker, this last year has truly been an awful one, and no age group or section of society has gone unaffected by this pandemic and its restrictions and lockdowns. Our students and our young people, however, have been particularly affected by it. And at a time for many when they should be starting out on a new adventure, away from home and enjoying what should be a relatively carefree few years, they have been so badly impacted. The first few weeks of entering university are undoubtedly some of the finest and funniest days of your life. You make new friends, you form your own identity and independence out of home for the first time and away from your family. And unfortunately, students have been robbed of this, and I really feel for them, because the student years are so crucial to socialising and building your character, so I really do feel for them. In addition to restrictions, the financial pressures on our students has been immense, and I reiterate Leah's point that this has been mentioned throughout the chamber today, but nonetheless needs to be reiterated. You know, they've been continuing to pay landlords for accommodation which they're no longer living in, paying significant fees for courses which have largely, if not all, moved online, and are being faced with the loss of part-time jobs and furlough as a result of business closures. Students really, they can't win. And they feel undervalued and overlooked as well. Of course, the £500 COVID disruption payment is to be welcomed, and I'm sure it is both a relief and support to many, but it must be expanded. I would like to pay tribute to all those students and student bodies who campaigned for this payment, lobbying MLAs and the Executive very effectively and sharing their experiences and stories, often very personal and difficult ones, of financial problems and circumstances which they have experienced over the last year. May I also take the opportunity to mention my party colleague Sinead McLaughlin, who has led a really effective campaign on this matter, unapologetically campaigning to ensure that students are financially supported and that their voices are heard. I concur with the motion that the exclusion of full-time students studying elsewhere from the payment is wholeheartedly unfair. Their financial burdens and pressures are no less, and I believe we must support students who are studying away from here in the south and further afield, and they should be supported in the same way. Likewise for part-time students, many of whom have additional financial pressures and worries. And students really do feel like they can't win, and I know that many have spoke online about their experience and have been told to stop whining and stop complaining. They're young, but I think we really have to note the detrimental impact that this pandemic has had and not to brush them off. Often I think we forget students as well. They're not just teenagers, they're parents and they're of all ages, and it's important we remain mindful of this as we discuss students today. Financial supports for students post-pandemic also is a wider issue I think we need to be mindful of. But childcare has been a massive issue that's been noted, and it's a huge issue that's been highlighted by this pandemic. I'm particularly concerned that more needs to be done across the Executive to ensure that parents are supported in their studies, both during the next few months and post-pandemic. Trying to juggle childcare and further their own studies at any time is difficult indeed, but I imagine that during not at this time, because I'm going to try and fit this in, sorry. But I imagine that it has been particularly difficult during this pandemic. The impact on mental health has been a universal experience over these past 12 months. Restrictions on travel, the stay-at-home message, not being able to visit family and friends, and social distancing has left us feeling isolated and cut off from our loved ones. Our students or young people will have felt this exact feeling, and perhaps in some cases definitely more. In conversations recently with the Student Union and its representatives in Coleraine, they have voiced that one of the main issues is counselling during the pandemic is taking place online via Zoom, Skype, and these are people at home with their parents, and they feel like they can't open up and be vulnerable due to thin walls, and there's a lack of discretion within the home. So we also need to explore student wellbeing and what more can be done from an Executive perspective to support our students. But to conclude, Mr. Speaker, I hope that this payment has gone some way to support our students financially at this extremely difficult time. As the motion acknowledges, there is more work to be done, and I would urge the Minister and her department to continue working on it to expand to our students in the south and further afield. There is a much bigger debate needed on aspects around student support beyond the pandemic and the lessons that we have hopefully learnt from it, and this is something I am keen to play my part in, and we will be wholeheartedly supporting this motion. Thank you.
I call Mike Nesbitt.
Deputy Speaker, thank you very much indeed. I rise to speak in support of the motion, but not the amendment. And so perhaps I should begin by explaining why I feel unable to support the amendment which Mr Middleton spoke to. It is because he quoted legal and contractual barriers and constraints, which I understand his party feels is fair comment. However, it seems to me that when processes trump the people we are here to serve, then we have a problem. And as politicians, it's our duty to overcome that problem. Processes should enable, not constrain.
I thank the member for taking the intervention, and I wanted to make the point that I was sitting on the Health Committee for nearly a year, and almost on a weekly basis regulations were coming through to change legislation to deal with the emergency that we face at the minute. Surely it's not outside the bounds of possibility for the Economy Minister to construct some sort of process like that also.
Minister, the member has an extra minute.
Thank you, Deputy Speaker. I welcome the intervention from the member. It's the very point that I'm trying to make. May I also congratulate the NUS-USI for a very vigorous campaign on social media in support of today's debate, and I will return to an ask of that student union body in a moment. Several members have made the point that this debate has an inbuilt capacity for repetition. I will try and avoid that, Deputy Speaker, by introducing some novel thoughts, not novel in the pure sense, just novel to this debate. And having said that, actually, I am going to repeat. I'm going to repeat a quote from a Northern Ireland Member of Parliament speaking in the House of Commons in September of last year. Some members will recognise the Speaker immediately, others, I think, may guess. The quote begins as follows. "The climate of fear deliberately created by ministers and their advisers has done untold damage to individuals and to the economy as a whole, and has now hit students and universities, with lock-ups of students and students being denied face-to-face education and unable to engage in the activities we normally associate with student life. Yet, they are expected to pay the full price of this substandard opportunity in higher education. Does the Secretary of State think it is fair universities still hold on to the money paid by students when they are not offering the student experience that they promised?" Now, if anybody needs a clue, the name is within the minutes of the recently leaked DUP South Antrim Constituency Association meeting. I think Mr Story has guessed that it is indeed the member for East Antrim, Mr Sammy Wilson, apparently promoting a policy not supported by his colleague, the Minister for the Economy, in the Northern Ireland Executive. But it is to be welcomed that Mr Wilson recognises it as an issue, and it's to be welcomed that Mrs Dodds recognises the issue to the extent to which she has given grants to some, but not all. I have to say my objection to this, Deputy Speaker, is this. To distinguish between higher education and further education is a very bad look. There's an inequality there. And I think it says something about a lack of understanding about intelligences. And I'm very much a fan of the late Professor Ken Robinson. And for those who haven't Googled him, I really recommend having a look at some of his online videos, which explain in very clear terms what we need in terms of developing our children, inside of whom he believed there was an element. I used to call it a spark. It's a spark of intelligence. It might be academic. The child might find it in the classroom, but they're equally likely to find it in a science lab, a sports pitch, in the school choir, or maybe in the drama theatre. And if we're saying to higher education university students, we respect and value your intelligence with a financial reward, but we're saying to students at further education colleges, not you, then I think we have a problem that we really, really need to acknowledge. I said I'd come back to the NUS-USI. They've also asked for grants to be extended to international students, including non-EU students. And I think there's a very good reason why, and it is called the Draft Framework Programme for Government, currently out for consultation. Because one of the 9 high-end outcomes is this, that people will want to live, work and visit here. The outcome is about promoting Northern Ireland as a place where people want to live, work and visit. We want to build on international relations and enhance our reputation. Well, if we deny international students a grant we're giving to our own, we are hardly building good international relations or enhancing our reputation. So, Deputy Speaker, I support the motion today.
Okay. At this point in time, we'll call upon the Minister for the Economy to respond, and the Minister will have up to 15 minutes. Thank you.
Thank you, Mr Deputy Speaker. And can I thank all of the members for their contributions today. Firstly, let me begin by saying that I am acutely aware that all our students have experienced terrible disruption since the onset of the pandemic, and that this continues to have a major impact on their studies, their student experience and their mental health and well-being. I and my officials meet regularly with and listen to the concerns raised by students, their representative bodies, family members, educators and institutions. It is clear that remote learning, whilst useful, has had a detrimental impact not only on the overall student experience, but also on the mental health of students as well, as many in this House have outlined. That is why it is my firm view that we should be resuming face-to-face learning for as many students as possible, as quickly as possible. Already in parts of the United Kingdom, students have returned to face-to-face learning in practical subjects. And in England, for example, we'll all be back at face-to-face learning at the beginning of the third term. I look forward to having support from my executive colleagues as I introduce this conversation to the executive.
The Minister give way?
I will, yes.
I'm grateful to the Minister for giving way. Would the Minister confirm that at present her department is running 48 economic intervention schemes and that that is more than every other government minister in the Assembly combined?
It is perfectly true that my department has run over the past year over 48 different schemes and different interventions in higher and further education in different parts of the economy. We have administered over £500 million in funding support to the economy and individuals and businesses in Northern Ireland. And I think this House should acknowledge the extent of the work that has been done by my officials who have operated in a time of great stress in order to deliver this very, very vital funding and support at a difficult and dark time for people here in Northern Ireland. But it is because of this disruption that I have delivered a wide-ranging and comprehensive package of targeted support to our student population. This includes the recently announced £37.7 million in support of our higher education sector, which included a one-off discretionary payment of £500 to all students from the United Kingdom and the EU who are in full-time higher education in Northern Ireland. And I will come back to this later. However, whilst the focus of this motion and of members' contributions has been on the COVID disruption payment, I want to outline the wide range of support I have provided and introduced to support our students as a direct response to the concerns of and issues affecting our whole further and higher education student population. The Department delivers financial support to eligible Northern Ireland higher education students through the Student Finance NI and has provided £126 million in maintenance loans and a further £56 million in maintenance grants as a contribution towards students' living costs during this financial year. For further education, in addition to the COVID disruption scheme, I also recently announced £8.5 million to address student financial hardship, including digital poverty, and a payment to student unions to help to support students with mental health provision. £4.1 million for the provision of safe working, learning and research environment in our higher education institutes, and £3.1 million to universities for income lost as a result of releasing students from accommodation contracts and rental pauses. This is in addition to the £1.4 million I secured from the Executive at the start of the pandemic and added a further £1.4 million from my department's own budget, together which made up the original £5.6 million that was available for hardship students. And in response to Ms McLaughlin, I would confirm that I have time and again asked the universities as the administrators of these funds to make sure that the criteria is wide enough and that they are reaching all students who are in financial need. It is also worth noting that it is not just financial support that our students need in this difficult time. And that is why, as a result of concerns around provision, and indeed reflecting some of the issues raised by Mr Stewart, Ms Kimmins, and indeed my colleague Sammy Wilson, that I wrote to Northern Ireland's universities and university colleges on behalf of students, asking them to be clear with new and returning students about how teaching and assessment will be delivered and the circumstances in which changes might be necessary. The higher education institutions have been asked to confirm that they have been and will continue to be sufficiently clear with new and returning students about how teaching and assessment is delivered, the circumstances that changes might be made, and what those changes might entail. They have been asked to confirm that their assessments students received during the autumn term, the teaching and assessment they were promised and might reasonably have expected, is based on the information that has been provided for them. And they have also been asked to confirm whether their current plans for spring and summer term will ensure that students receive the teaching and assessment they were promised and might reasonably expect. If new or returning students were not provided with sufficiently clear information about that teaching and assessment and how it was delivered and promised, I expect the institutions to actively consider their obligations under consumer law for tuition fee refunds or other forms of redress. Many members have highlighted the difficult time our further education students have had this year, and I agree entirely. Students in further education courses at local colleges are being supported through a range of mechanisms. I have secured an additional £7.7 million, of which £4.8 million is being used to provide additional IT equipment to allow continued access from home for both college staff and students, and to help address digital poverty, including providing 1,200 SIM cards and the remaining £2.9 million for an additional 500 devices and a one-off payments of £60 to eligible full-time and part-time further education students to help with data costs. The Department has provided a range of interventions to support further education students throughout the COVID-19 pandemic, including adaptations to existing financial support programmes to encourage continued participation in further education programmes. This included further education grants, further education hardship fund, Care to Learn childcare scheme, home to college transport, free school meals, clothing allowance, an additional support fund for those with a disability. The combined value of these support arrangements total £13 million per annum. Furthermore, the Department has worked with the colleges to increase the flexibility of these policies in relation to student support to make them more accessible. This has included paying childcare retainer fees during the initial lockdown. Further education grants and hardship funds have been updated to facilitate claimants participating in distance learning, with an extension to the closing date for grant applications. Free school meals and holiday payments for all eligible school-age further education students have been made directly into households. Specifically, within the Hardship Fund, increases to the dependent student rate, which provides eligible further education students with an additional £15 per week, and making part-time and repeat students eligible to apply to all elements of the hardship funds. Members have also highlighted issues of part-time students. Part-time students are more likely to be in employment than full-time students, and this cohort includes many on masters, higher level apprenticeships and other schemes supported through my department. Part-time students are less likely to have different term time addresses and the associated living costs. Any uniform payment would be enabled to be targeted at those who are genuinely in need, or to consider the nuances of the range of part-time provision available. However, I do recognise that many have been deeply affected by the pandemic and the disruption that it has caused, and these students will continue to be eligible for other support packages that have been put in place, and I implore any student facing difficulties to contact their institution to discuss what support is available. It has been highlighted that the COVID disruption scheme doesn't include students who study in Great Britain or the Republic of Ireland. I and my officials had discussions with the student loan company to explore the possibility of making a payment through the student loan company to all Northern Ireland domiciled students. Requests such as these must be agreed by the 4 UK administrations before they can be taken forward by the SLC. Accordingly, a request was formally submitted to shareholders for agreement. However, subsequent legal advice received by my department indicates that the Financial Assistance Act, the vehicle used to make this and other COVID financial assistance payments, would not give us the power to make payments to public bodies outside of Northern Ireland. All areas of the United Kingdom and the Republic of Ireland have substantially increased funding available for student support. And it is important to remember that while students studying outside of Northern Ireland will not have access to the COVID disruption payment, they will have full access to the payments and the supports that are available within their institution. In England, still a lot to get through. In England, an additional £50 million has recently been announced, and that is in addition to the £20 million which was announced in December 2020. Scotland has announced £20 million of government funding for student hardship, with a further £10 million having been allocated to universities and colleges for income lost in providing rent rebates. In Wales, there's a £40 million package of support for students facing financial hardship. The Republic of Ireland announced in November a €50 million one-off COVID-19 payment scheme whereby all eligible students and all EU full-time undergraduate and postgraduate students attending publicly funded higher education institutions in the state would receive €250. I have made representations that students should, like in Northern Ireland, be supported by those administrations who have imposed restrictions on student activities. And I am more than happy to commit to further representations. And again, I ask that students facing genuine difficulties contact the institutions to seek and access the support that is available. Members, the package that I have put together for students is generous, and I am delighted to provide this payment to almost 40,000 students and hope that it goes a small way to alleviating the tremendous stress and pressure they have faced. These payments will be made shortly to undergraduate and postgraduate full-time students enrolled at any point during February 2021 at publicly funded Northern Ireland higher education institutions and full-time higher education students at further education colleges. I once again welcome the opportunity to appear before you to provide clarification on the support available to students. Many members have written to me in relation to this, but I believe it is vital that information on this wide range of support is not just readily available, but also is communicated. I am sure I have the support of all members when I say that I will continue to do all that I can to support our young people through this difficult time and to help them regain the learning experience they deserve. And that, of course, must start with the return to college and the return to university, which I do hope we will be able to do in the not-too-distant future in a safe and sustainable way.
I now call Christopher Stalford to wind on the amendment, and the member has up to 5 minutes.
Thank you, Mr Deputy Speaker. Sir, I think that this has actually been a very good-natured, by and large, good-natured debate and discussion around the issues facing our students and young people. There is no doubt, sir, that the last 12 months has been something of an annus horribilis for all of us, but particularly for our students and young people. The impacts that it has had, the lockdown, continued lockdown, has had, are evident for all to see. I mentioned during the course of the debate that in a recent answer, the Health Minister confirmed to me that Northern Ireland has now broken its own record for the issuing of antidepressant prescriptions. And that's reflective of the mental health impact that these continued lockdowns are having. The economy needs to be opened up, because whilst we all recognise the need for interventions like this, ultimately we need economic activity going on to generate the resource that government will use to pay for the delivery of first-class education for our young people. And I think it's important that we establish that as a first principle. I assume it is the first principle held by everyone here, at least I hope it is, that the economy needs to be opened up as quickly as possible in order to allow, I've only got 5 minutes, in order to allow for economic activity to resume, in order to allow for educational activity to resume, in order to allow students to enjoy the benefit of the student experience. May I declare an interest here? I'm the uncle of a student who's first-year law student at Queen's. The entire year gone, that entire experience lost because of the provisions, the lockdown provisions that we are facing. In relation to the scheme before us, or the motion and the amendment, I actually think both are reflective of the fact we both want similar outcomes here, but there's just a disagreement on how to achieve them. But no one should be in any doubt that both sides of this argument want similar outcomes. They want the maximum amount of funding that can go to students to be delivered to students. In relation to the scheme that's being criticised, I would point out that the executive, of which several members who were speaking at which several members are represented, the executive agreed to the criteria that we're discussing. I also want to point out, and I know this to be the case because I've asked repeatedly, I also want to point out that in terms of the economic interventions, it is my understanding that the Minister has received less than 40% of the funding that she has bid to the Centre for. So it's well and good for members to come along and say the Minister must do this, the Minister must do that, but the Minister needs to be given support in the executive, and the Minister needs to be given support in order to deliver, in order to deliver the schemes that members want to see delivered. But despite the fact that she has been persistently and consistently shortchanged by the Department for Finance, the Minister has been able to deliver £500 million worth of economic intervention through her department, and I'm glad that she was able to confirm to me over 48 initiatives have gone through the Department for the Economy, more than any other government department in this place, and the Minister has presided over those interventions more than any other Minister has made. The point does need repeated. We have introduced here in Northern Ireland £37.7 million of financial support for our students and the higher education sector. And this has taken different forms, but all of these interventions are designed to achieve the one goal, to help our students and young people through this time. And I hope that those who are saying that we need to help our young people through this time, one of the best ways in which we can help our young people is to set them free from continuous lockdowns. And I hope that when the time comes, and we can do it in as safe a way as possible, I hope that all members will not be slow in supporting the easing up of those restrictions. Thank you.
I call Pat Sheehan to wind on the motion.
And I think everybody will support the easing of lockdowns when it's safe to do so, and that's a straight answer to that. Students are among those who have been most negatively affected by the pandemic and the lockdown, and what are supposedly the best days of their lives have turned into nightmares for many. a large number are facing mental health issues and many more financial hardship. And I'm standing in here today for my colleague John O'Dowd, who can't be here today, but I must commend him for his tireless and diligent work on behalf of our third-level students, both higher and further education students. I know he's lobbied both the Health Minister and the Economy Minister on providing better health care for students, but despite warm words from both, there's been no real action taken by either department. And on February the 22nd, John O'Dowd presented the Extend the COVID Payment petition with 3,000 signatures to the Economy Minister. What has the Minister done in response to that? Absolutely nothing. So in what way have students been affected? First of all, many have lost the part-time jobs they depended on in sectors like hospitality and retail. Their student status means they can't access the same financial supports as wider society. Other students have lost family support due to parents and household incomes being negatively impacted by the pandemic. And the sad fact is that 3/4 of students from here are not eligible for the £500 payment. That's 3/4 of students from here. I'll give way quickly, yes.
Very quick. I'd hoped to bring this in before. Would the member also agree with me that those students now have lost trust in us and they're not coming back because at a time of crisis we weren't able to help them?
I absolutely agree with that. I'm going to go on to mention that later on. Sorry, can I clarify with the Speaker how long I have?
Jay moment, yeah.
Many of those who are locked in tenancy contracts, even though they may not be able to live in their rented accommodation, and legally this may be enforceable, but it's morally wrong that students are forced to continue to pay rent for accommodation they can't use. And of course, the learning experience of students has been well below what would normally have been expected due to the remote nature of the teaching, but students still have to pay their tuition fees. So I want to speak briefly about further education inequality, and this was an issue that Mike Nesbitt raised. And there is no justification and there is no legal barrier to giving financial support to further education students. And not giving the payment reinforces the view that students at further education colleges and vocational colleges are viewed as less important by this department than students at universities. And offers of £60 to further education students through the Digital Hardship Fund is an insult, given that full-time higher education students will receive an automatic £500 payment. And 41,000 further education students in the North are studying courses which are level 3 or above. Each of those students have experienced disruption to their education, and some will face costs for rent and so on. And further education students generally come from more disadvantaged socio-economic backgrounds, and refusal to give the £500 payment further entrenches inequalities in our society. It would cost only £20.8 million to give the payment to further education students. And students studying in Britain, there's 17,500 students from here who study across the water. 2/3 never return. And refusal again to give the £500 payment reinforces the mindset of exclusion. The Minister says she can't give money to a university in Britain. Fair enough, but she must find innovative ways of getting money into the hands of hard-pressed students. Surely that's not beyond her capacity. £8.7 million would cover the cost of making the payments to students in Britain. There are 1,200 students from here studying in the south, fairly low numbers, and those students will be paying higher rents, particularly around Dublin, where rents are extortionate, for properties they don't need due to the remote learning. And the Minister should engage with her counterpart in the south and seek to extend the £500 payment to them as well. That would cost under £1 million. I made the point earlier that the Finance Minister has been encouraging the Economy Minister to make further bids for COVID funds that could be used to support our student population. Unfortunately, thus far, the Economy Minister has been playing hard to get. She has every excuse in the book for not making bids. She claims, for example, not to have the authority to give payments to students studying in the south or across the water. But as Stuart Dixon pointed out, this is a legislative assembly. What about legislating? I've sat on the Health Committee for nearly a year. I made the point earlier. Regulation after regulation coming through that committee week after week after week. And why can the Economy Minister not be innovative? Why can she not find a way to provide funding to those who need it? The Economy Committee will be proposing amendments to the regulations the Minister has introduced to make payments. That will be coming next week. I'll give way to Mr Story.
I know the member has no difficulty in taking money from any source that they can get their hands on it, but given the fact that the Minister has outlined that they cannot pay outside the jurisdiction of Northern Ireland, for which we have responsibility for, could he give us some innovative way that that could be overcome, given the words of wisdom that we've had to listen to from today?
Well, I don't draft legislation, so no, I can't tell you that. But what I can tell you is that there's all sorts of emergency legislation has come through this House over the past year. We have been able to do it. Where there's a will, there's a way. And the fact is, Chair, go ahead.
Just a short point, I suppose, in relation to Mr Story's point. I think other ministers have shown very clearly that there are ways of addressing these things. And I mean, one way of doing it possibly is an application process where a student can show proof of home address and proof of attendance at university. Would the member agree with me on that?
That's maybe just a wee bit too simple for the members on the opposite bench to understand.
Please,
you see,
would the member refrain from speaking from the seated position, please? Mr Sheehan has the floor.
You see, the fact is, the Finance Minister has made it clear that funding is available, and he has encouraged the Economy Minister to make bids to access that funding and develop a process to deliver it. Go ahead.
Mr Sheehan, for giving way. If I understood Mr Stalford correctly, he was making much of the fact that Mrs Dodds has brought forward more economic initiatives than any other executive minister. Would it not be odd if another minister was bringing forward more economic packages than the Minister for the Economy?
You've just sort of brought me on to my last point there, because the Minister and Mr Stalford were almost boasting about the 48 schemes that they have delivered. That's the Minister's job, and she's pretty well paid for doing it. And if she's not going to do it, who is going to do it? And the fact is, there are 3/4 of our student population from here in the north who can't access the payments that have been made to some university students. And boasting about 48 schemes that you are delivering isn't going to butter the parsnips for those students who find themselves in financial hardship. I ask members to support the motion.
Thank you, members. The question now is that the amendment standing in the names of Christopher Stalford and Gary Middleton be made. All those in favour say aye. Contrary, no. All those in favour say aye. Contrary, no. I think the noes have it. The noes have it. Thank you. The question now is that the motion standing on the order paper be agreed. All those in favour say aye. Contrary, no. The ayes obviously have it, and the motion is carried. Thank you. That concludes this item of business. The First Minister and Deputy First Minister have been given leave to make a statement on the executive pathway out of the COVID-19 restrictions at 5:50 p.m. By leave of the Assembly, we will therefore suspend until then. The sitting is suspended until 5:50. Thank you very much. Oh, sorry, it's down as it's 4:50. Sorry, it's written here as 5:50. Okay, thank you for that. Thank you.
This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound.
Okay, members, the sitting is resumed. I have received notice from the First and Deputy First Ministers that they wish to make a statement setting out the Executive's pathway out of COVID-19 restrictions. Before I call the Minister, I remind members here in the Chamber that in light of social distancing being observed by the parties, the Speaker's ruling that members must be in the Chamber to hear a statement if they wish to ask the question has been relaxed. Members participating remotely must make sure their name is on the speaking list if they wish to be called. Members present in the Chamber must do so by rising in their places as well as notifying the Business Office or Speaker table directly. I remind members to please be concise when asking their questions. This is not a debate per se. So on that basis then I call the First Minister.
Thank you very much, Mr Speaker, and thank you for the opportunity to update the Assembly today on our decisions last week on education and at this morning's Executive. Before outlining the detail, Mr Speaker, it is important to set out our decisions in context. COVID-19 is still with us in our community. Today we have 176 COVID inpatients in our hospitals. 18 people were in ICU with COVID. There were 13 active care home outbreaks being managed. 164 people tested positive with COVID-19, and unfortunately we have a further death. These are, of course, better numbers than we have seen in recent times since the latest restrictions took effect on the 26th of December. But these numbers still tell us that caution is important. We have seen how numbers can rise rapidly, and we do not want to go back there. That is why we published our pathway out of restrictions on the 2nd of March, and we outlined our rationale in our statement to the Assembly that day. To summarise our rationale in one phrase: cautious but optimistic. Small steps along the pathway, with time built in to help us take stock of the impact on the ground. Time to reflect, analyse the data and structure the next steps in the pathway in that context. Our colleagues in the Department of Health have coined the phrase social contact capital. It's a helpful way of understanding the situation we are in. We have an amount of decision-making capital which we can afford to spend, and we need to spend it wisely each time in the interest of as many people as possible. If we spend the capital on one easement of restrictions, it can't be spent on other things at the same time. That's why it's very important that we work our way through the restrictions in a careful and managed way at each 4-week review point. That is why we are not setting dates, so that we can take our decisions against the prevailing health, economic and societal circumstances. The Executive is clear on the need to think especially hard about our children and young people. Last week we decided that preschool, nursery and primary school pupils in P1 to P3 would remain in school until the start of the Easter break. Meanwhile, students in years 12 to 14 would still return to face-to-face teaching effective from next Monday. And today we have considered further the steps we should take, rightly, to provide more certainty for our children and young people, parents, teachers and the whole education family. So today, having taken into account the prevailing COVID situation and with care and caution, Primary 4 to Primary 7 should return from the 22nd of March, and all pupils, including years 8 to 11, will fully resume on the 12th of April. These decisions are aimed primarily at getting our children back to school in the safest way possible, with mitigations and preparation time. That has benefits for us all. We have been very concerned throughout about the impacts for the education of our young people, and we know that the education sector will pull together to help address that. We have been equally concerned about the well-being impacts. We all know how important it is for children to build and grow their friendship networks, to be able to socialise and grow their own interests and future potential. So that has been our clear focus today. We think every sector in our society will understand that education has to be our priority at this time. We understand those sectors and individuals also want a bit of certainty and hope. Having taken the education decisions, the Executive went on to look at the available social contact capital to see if we could do more. Our commitment has always been that we will not leave restrictions in place for a day longer than is needed. We appreciate that we are moving quickly towards the first anniversary of the first lockdown in March last year. The weather is improving, and we have been in this current lockdown for around 80 days. That is a long time and a big ask, and we have been so grateful to everyone who has made a personal contribution to the improvement in the COVID situation. Our responsibility to you is to look carefully at how we can improve the situation for you in a careful and sustainable way. We want to give you hope, and we have discussed today a number of small steps which we hope will be welcome. We have decided that from the 1st of April, 10 people from 2 households can undertake outdoor sporting activities as defined in the regulations. Up to 6 people from 2 households may meet outdoors at a private dwelling, and garden centres and plant nurseries will be included in the contactless click and collect scheme. We have also decided that, provided the situation still supports us, the following changes will be introduced on the 12th of April. Increasing the numbers who can meet outdoors in a garden from 6 to 10, including children from 2 households. The removal of the stay-at-home provision in the legislation, moving to a stay local and work from home message. Allow contactless click and collect for all non-essential retail, subject to the overall health position at that time, and the Department for Economy evaluation of the limited 8th of March reopening of non-essential click and collect. And then allow outdoor sports training to resume by sports clubs affiliated with recognised sports governing bodies in small groups of up to 15 people, but with all indoor spaces closed except essential toilet facilities. These relaxations planned for April the 12th will be subject to Executive ratification in the week after the Easter weekend. The Executive has also agreed to increase the provision for elite sports from March the 25th to allow a number of new competitions to begin. This minor adjustment to the current restrictions will allow 2 World Cup qualification matches scheduled for March 25th and 31st to take place, as well as a friendly match between Northern Ireland and the United States of America on March the 28th. No spectators will be permitted at any sporting event. It is important that we explain our rationale, as we know that some people will be disappointed that their sectors are not on this list. Our focus in our decisions today has been to take a risk-based approach, as we promised in our pathway. The common ground is that the steps are aimed at individuals and their families to support well-being and socialising in a limited and careful way. We have focused on outdoor settings, where the risk is relatively lower than indoor settings, and there are things we need you to do to continue to do, please. First and foremost, follow the public health advice, including when you're outdoors. Wash your hands and maintain social distancing. If you are meeting up with other people, plan your journey and plan what you do when you meet up. Avoid car sharing if you can. Wear a face covering and ensure good ventilation if you can't. To our colleagues in the retail sector, we realise that today's developments are modest and we have a long way to go. We thank you for your forbearance, and we recognise that large sectors of retail have been on the front line all year. We say thank you as an executive to everyone who has supplied goods, stocked shelves, served customers and looked after us all over a protracted period of time. Mr Speaker, we will now proceed to deliver these decisions into regulations and guidance changes. The next formal review period is the 15th of April, and we will be working towards that from today. There is no halt in the work that will go into that. That work starts now, and we will monitor the data closely over the coming weeks. We also want to say something about key events in the coming weeks. Tomorrow, St Patrick's Day, would normally be enjoyed by many. We need this to be different tomorrow. Please continue to stay at home. Do not socialise outside your family or your bubble. And we particularly want to say to young people that you need to follow the rules and the advice. Ahead of us, we also have Easter and Passover, important events in our faith calendars, important moments for our citizens. Myself and the Deputy First Minister met with the leaders of the 4 main churches yesterday to discuss the hope we need to give our people at Easter, and also some solace. And this year has been a hard one for people of all faiths and people of none. We have very much welcomed the opportunity to work with all faith leaders across the last 12 months, and that will continue. We need to continue to acknowledge how much people need hope and solace, and we noted in our discussion yesterday the desire of the churches to work towards a return to in-person services in time for Easter, and we acknowledge the risk involved and the mitigations required by the churches. Some places of worship will find it easier to continue with their online services, of course, and we know that this will be taken forward carefully, and we have been grateful to leaders across all faiths who have worked closely with us on a voluntary basis. We have also discussed with the church leaders the benefit of prayer and reflection and the comfort that that can bring, whether that is from the perspective of our faiths or a personal reflection on the year gone by. We think that making some time for this on Easter Sunday will be timely. It is, of course, a personal matter for everyone, but we are facing into a difficult first anniversary, and we all feel a sense of loss, whether that is loss of loved ones or loss of the things we enjoy in life. So taking a moment of prayer or reflection will be a powerful act of support for each other and a way to look forward to with hope. Mr Speaker, we have a long way to go, but the steps that we as an executive have agreed are designed to start that process in line with our pathway commitments and to give that bit of hope that everyone is seeking. Thank you.
Thank you, and I call the chairperson of the Committee for the Executive Office, Colin McGrath. Can we bring Mr McGrath on to screen, please? Can I invite Colin McGrath to contribute?
Thank you, Mr Speaker, and I thank the First Minister for her statement today. These relaxations to the lockdown announced are well overdue in people's minds and lives. It's been a long winter and the lockdown was tough, not least on people's mental health given the long, dark and depressing winter period, and especially during January. Now, the relaxations announced today include those to our schools, with primary 4s to 7s joining P1s to P3s from next Monday, and many parents will welcome this announcement, but many teachers and principals may be a bit more reticent, given that the Education Minister promised teachers 2 weeks notice and is in practice given the majority of schools just 2 days, and in fact some of them 2 hours, given that they close today and don't open until next Monday. The announcement being made today could also stand accused of being a little bit light touch, I appreciate that people are complying as they can, but the moves are modest, and in many areas they're not budging for another 2 weeks, and some further into April. Again, there isn't much information on how we get from here to the next stage, and for many in businesses or sporting fraternities, they're left again wondering when progression will be made. Could I ask the First Minister to explain the differentials between the stages that are progressing today? In some of the pathways we move to level 2 and in others we don't. In some we're moving to all of what's in the level 2 and in others only some. I predicted after the last announcement that without proper and robust messaging, these announcements will become massive confusion events. What will take place now to detail this information to people? Thank you.
Thank you to the Chairman of the Committee. Yes, we have been in lockdown for a long time. Nobody denies that that is the case. And I think it has been well signalled that the Education Minister wanted all primary school children back as quickly as possible. I welcome the fact that colleagues have agreed with that position and that children will go back to school in P4 to P7 next Monday. As I say, we've been talking about this for quite some considerable time. I do also accept from the Chairman of the Committee that these are modest lifting of restrictions. Nobody said it was going to be otherwise. We did say that we would be relying on advice from our medical advisors, and we have taken that advice, and here is what he is comfortable with given where we are in terms of the pandemic. In terms of the sporting codes, as I understand it, the Department for Communities is working with all of the sporting codes. The Minister is having ongoing discussion with the different sporting bodies. We believe that given the go-ahead for training outdoors from the 15th of April will be welcomed. The fact that people can come together in public spaces for outdoor activity from the 1st of April as well will be welcomed, albeit from 2 households before the 1st of April. And I think in terms of communication, it is incumbent upon all of us as public representatives to get the messages out in relation to what has been agreed today in terms of the relaxations, and I hope everybody will play their part in that. But no doubt there will be some who would rather seek to criticise the executive. So be it. I mean, we're big girls and boys. We can deal with that. But I think what we've brought forward today are cautious steps, but I think they are very much pointing in an optimistic direction. And as we move through now the different steps, the fact that the task force is meeting every week to look at where we are in terms of the transmission of the virus is a very helpful way forward. And we've always said we'll be as flexible as we can, and we have always said we will only keep these restrictions for as long as they are necessary, Mr. Speaker, and as long as they are proportionate. So that is what we've tried to do today, and I hope that people will take advantage of the nice weather, but in a cautious way, and recognising that COVID is very much still with us.
Thank you, and I call Robin Newton.
Thank you, Mr. Speaker, and I thank the Minister for her question. Sorry, thank the Minister for her statement. Minister, you're referring to the Primary 4 to Primary 7 pupils returning on the 22nd of March, followed then by years 8 to 11. Minister, can I just ask what clarity can now be provided to parents about the return to school?
Well, I hope that we've provided that clarity. P1 to P3 and preschool are already back in school. Years 12 to 14 are back next Monday. We're now saying that years 4 to 7 should also return next Monday. I was a bit surprised when Mr McGrath said that some schools are closing tomorrow and they're not coming back to next Monday. My goodness, I'd like to go to that school to have such holidays for St Patrick's Day. Never heard of that before, but especially when the schools have been off for such a considerable period of time. And then, of course, years 8 to 11 will return in full after the Easter holidays, which is the 12th of April. And that period of the Easter holidays allows us to actually assess the impact of those children that have gone back. So it's actually useful for us to have that break in space so that we can find out how that has impacted upon the transmission of the virus.
I may call Colm Gillerny, or more Colm Gillerny.
Caoimhe, and thank you, First Minister, for the statement and for answers to those questions. The relaxation of meeting rules will undoubtedly be welcomed by those who have felt the strain of separation over the past period of time, and indeed many who have also felt the impact of loss as well, and our condolences to all of those. I have met this afternoon with the PHA, the senior team in the PHA responsible for contact tracing, and I think it is we all wish them all the best now as that service comes back into the spotlight, in order to, as you referred to there, try to prevent us ever having to go back. And I'm sure we all wish them well in that regard and hope that that system is indeed fit for purpose. But how crucial has the vaccination programme been towards enabling this particular change? Thank you.
I thank the member for the chairman for his question and his comments as well. I think people will welcome the relaxation in being able to come together. People haven't been able to do that unless they've been bubbling or they've been in a care position, and there has been great strains and people have sacrificed a lot. And I think it's important that we acknowledge that, so that we could get COVID-19 under control and in a manageable situation. So that is important. In terms of the vaccination process, as the member knows, we're now in a position where we can take bookings for the over 50s. Yesterday was a phenomenal piece of booking online. The Health Minister tells us that at one point it was 350 people per minute that was actually taking up the vaccine slots. So that's a good indicator that people are very much wanting to avail of the vaccine. There is some work ongoing at present to look at how the vaccine is impacting hospital admissions, particularly in our older residents, and we look forward to receiving that data, because I think that will be very important data. That has been done in Scotland. I don't know that it has been peer-reviewed as yet, but certainly it points that the vaccine is having a real and tangible impact on the numbers of people going into hospital. So that, of course, is to be very much welcome. So the vaccine programme continues. I want to pay tribute to Patricia Donnelly and her team for the way in which they've rolled the vaccine programme out right across Northern Ireland, and I look forward to receiving the vaccine as soon as possible.
And I call Rosemary Barton.
Thank you. Thank you, First Minister, for your answers so far to what you've been asked. What consideration has been given to students in further education colleges? You speak about the schools returning, pupils returning to schools, and I'm wondering if you could give me an update on that, please, Minister.
Well, I don't have the details of that, and I'll certainly get the Minister for the Economy to come back to you on that, because I know that she has been looking at the return for some students. I think if there are, if there's a need for the student to be back for reasons so for example, if you're a student at Queen's or whatever and you have to be back for medicine or engineering or something like that, it may well be the case that further education colleges are in the same place. But as I say, I'll get the Minister for the Economy to come back to detail that for you.
I call Stuart Dixon.
Thank you, Mr. Speaker. Thank you, First Minister. First Minister, not all the messaging has necessarily been very clear around how we move through this pandemic and the regulations that you've placed in front of us. But now you're suggesting in this statement today that we're moving from staying at home to staying local. How will you get a very clear message out to people as to how that should be handled, particularly over the Easter holidays and the days afterwards?
I'm glad the member asked that question, because the stay-at-home message is still in place until April the 12th. So it's important to say that, because I think we are all concerned about the Easter holidays and all concerned about people coming together in the ways in which we have seen, unfortunately, sometimes in holiday destinations and country parks. So I would ask people to respect that of course, we want you to get outside and enjoy the outside, but please do it in a way that doesn't cause crowds to accumulate, and I think that is very important. After April 12th, the message will change from stay at home to stay local. and we hope that that is self-explanatory, so that people aren't moving very far away from home and are still working at home where possible. We do understand that a lot of people can't work from home and have to go into work, but that is the messaging on April 12th. But up till April 12th, the message is still stay at home.
I call Palm Cameron.
Thank you, Mr Speaker, and thank the First Minister for the statement to the House today. This is an incredibly difficult time with such a prolonged period of lockdown, and many are feeling the physical and mental negative impacts from these restrictions, and I think many will be quite disappointed today. Can the First Minister confirm that further changes or easements to the restrictions do not necessarily have to wait until the next formal review, which is due on the 15th of April?
So when we came with the pathway to this House, Mr Speaker, you will recall that the only dates in the document were the actual formal review dates that the Minister of Health has to review the regulations upon. So those were the only dates in the pathway. There is flexibility in the pathway to allow us to take decisions outside of those formal review dates. Of course, we will want to assess what social contact we have in terms of the capital that we have to spend, and so we'll have to look to see what way things are moving. But yes, we can move in and you will recall this last year when we moved in a faster speed coming out of some of the regulations because of the fact that we were moving in a very good way. So hopefully that will be the case again, but we need people to work with us so that we can achieve that. I just do want to acknowledge what she said about it being such a difficult time for so many people as well. It has been, both physically and mentally. We hope that the easements that have been granted around being able to get outside and meet with another household will allow people to get out and about and to enjoy what I hope will be good weather over the coming period. And I know it's only a modest relaxation, but I hope that it will help some of those people.
Emma Sheerin, I call Pat Sheerin.
Thank you, Mr Speaker, and thanks to the First Minister for her statement here today. The main argument being advanced for bringing children back to school is that their mental health and well-being has been adversely affected by the pandemic and the lockdown. Indeed, Professor Siobhan O'Neill, the mental health champion, agreed at the committee some weeks ago that there was a tsunami of mental health and well-being issues among children at the minute. However, the Education Minister's approach seems to be that getting the children back into school will resolve those issues, and that's not good enough. So could the First Minister tell us, will any additional resources be made available to our schools to deal with these mental health and well-being issues? Thank you.
Thanks to the member for his question. Yeah, absolutely. We needed to get our young people back to school for mental health well-being, their socialisation, but also their education and life chances. I think that's really important as well, because they've missed out on so much face-to-face teaching. I've said many times, Mr Speaker, that the kitchen table is no replacement for the classroom, and certainly those of us who have been homeschooling are no substitute for the professional teachers that are in our schools, in no way. In terms of the Education Minister, I understand that he has indicated that he is putting more resources into school. He's already done that since last year in terms of mental health supports. I know that he would want to do more on that, but again, it will be resource-led, and he will, of course, need to have the resource made available to him to do that. But as I understand it, he does have plans to put more money into schools, into the front line, so that people can deal with these mental health issues, which unfortunately we are going to have to deal with.
I'm going to call Trevor Clark.
Mr Speaker, and can I, like others, welcome the statement here today. First Minister, in relation to there's been appreciation for the public health agencies and indeed the vaccination programmes that's been unrolling. I suppose the business sector will probably be disappointed in terms of what they're hearing today. And I would like to put in record, because I'm sure many in this chamber wouldn't want to put in record, but the generosity of Her Majesty Government in terms of some of the financial packages that have been drawn up to support those businesses. However, many of those don't actually cut it for those. Many of the businesses are waiting to get that opportunity to open, to continue to trade as normal. So, following today's announcement, what would your message be to those businesses who will continually be waiting on that announcement that they can actually open and get back to some form of normality?
I do thank the member for his question, and I acknowledge absolutely the fact that Her Majesty's Government has put in place a large amount of resource to try and assist people who have found themselves, through no fault of their own, in the position that they're in, particularly on our high streets. But we also recognise, and if the Economy Minister was here, she would say very clearly that grants are no substitute for being able to open and to do business and to trade, and so we want to be able to allow our businesses to get open again as quickly as possible. I do welcome the fact that colleagues have now agreed to a suggestion that garden centres and plant nurseries will be included in the Click and Collect scheme from the 1st of April. That's before Easter, so that will allow people to avail of those facilities. It's important because, of course, we know that spring is moving into summer and a lot of gardens need to be planted out, and a lot of people take a lot of solace from their gardens, and therefore it is important that we allow that to happen. And then on the 12th of April, Click and Collect will be allowed for all non-essential retail, and it's only a modest proposal. I accept that. What we need to do is to continue to work with the retail sector, as we need to with other sectors as well, whether that's hospitality or churches or all of the sectors that we've been engaging with, so that we can move forward together and that there's no surprises in respect of how we're doing our business. So acknowledge this is a hugely difficult time for our business community, but we'll keep engaging with them as we move along.
Karen Mullen, call Karen Mullen.
And I thank the First Minister for the statement today. Minister, just following on from that question there on businesses, could you confirm that if the CRBSS support grant will be extended? And I've just been contacted today around a number of things, but one of the outstanding ones, if you could give us a bit of clarity on if golf is included in the outdoor sports, you'd make a whole lot of people happy if you say yes, and also if there's any update on driving tests resuming.
So, as I understand it, the CRBSS scheme continues for as long as it is needed in terms of those businesses. As I've said to Mr Clark, I mean, it's not ideal that those businesses are closed, but we are trying to support them as much as we can. Good news is that golf can occur now, as long as it's 2 households. We very much believe that walking along a golf course is the same as going out for a walk, but those who play golf would probably disagree with that. But in any event, golf is allowed, tennis is allowed, those sorts of sports where you have 2 households just engaged in it. So that's important as well. And your last question? Oh, the driving test. No, it is deemed to be like a close contact service, so there is no resumption of driving tests at this time, but we will come back to the House with that, and we understand that there's a lot of young people. I know some young people who are desperately waiting on their driving tests, so again, we hope that that will be able to come in due course.
Call Matthew O'Toole.
Thank you, Mr Speaker. Thank you to the First Minister for the statement today. I suppose, first of all, someone who originally hails from Downpatrick and then spent many years away from here, I always treasured and enjoyed St Patrick's Day, but I echo what the First Minister said about people enjoying it differently this year, and particularly in my constituency of South Belfast, we want to send out the message that people should please stay away from the Holy Land tomorrow and not give us, not delay our progress in easing. But First Minister, can I specifically ask about around the data and exactly what is being used to make these decisions? While I agree with the cautious approach very much, you mentioned in the statement both social contact capital and a risk-based approach. That sort of indicates a degree of quantitative analysis going on. What are the specific data points you're looking at? Are those around decrease in hospitalisations and a certain number of people or a proportion of people being vaccinated? It would really just be helpful to understand precisely what the data points are that you're looking at.
Okay, so I thank the member for his question, and absolutely, in terms of the health data, we're looking at the rates of transmission. At the moment, Northern Ireland is 66 per 100,000 in terms of our infection rate. I think Scotland is around 64. Wales is much lower, I think in the mid-40s. The Republic of Ireland is about 75. So we're looking at that data. We're looking at the numbers of people in hospital, the numbers of people in ICU, the number of positive cases, And we're also then looking at the fact that this is a new variant which is more transmissible than the original variant. So that's the sort of health data. We are, as I've indicated, waiting on the efficacy data from hospitals in terms of the vaccinations so that we know how it has impacted on the number of people going into hospitals. In terms of the economic data, we are looking at how the economy has unfortunately shrunk since the beginning of last year, the number of people who are unemployed, how unfortunately we've seen Thornton's Chocolates decide yesterday to leave the high street, how the high street is coping, and then in terms of our societal data, how people are dealing with the lockdown, how we're dealing with their well-being, not being able to socialise in sports in particular. That's one of the reasons why we have front-loaded allowing people to get out and about and enjoy the outside and meet together, albeit outside. So those are the sorts of conversations that are going on within the task force, trying to balance up all of those different metrics. It's not an exact science. We have tried to prioritise young people and children, and of course we do absolutely recognise the need to get our economy into a state where we can start to recover as well.
Robbie Butler.
Thank you, Mr. Speaker. I thank the First Minister for her address today. I want to thank her for linking hope and Easter. I think that is important that we do send out a message of hope. And I'm sure there are many parents, carers and teachers who will look forward to their pupils and students and children returning to school very soon, as do all of us. But the Minister will be well aware that there was an inflexibility this year with regard to the transfer test, and some children were left to suffer. There are many calls, professional calls, for the need for children to be able to emotionally regulate before we educate. And what we seem to be seeing now is an inagility, perhaps with GCSE and A-level exams, where returning students are faced immediately with the threat of having to sit stressful exams. And we do know that children have been hard hit through this pandemic. Can the Minister give a commitment that the Executive Office will look at this with the Education Minister to make our children a priority on the return to school? And I just want to take the opportunity to wish everybody a happy St Patrick's Day.
Well, I thank the member for his question. The Executive has tried to prioritise children's well-being and educational life chances, and I mean, we're parents as well as ministers, so we know the impact that not having schools open has had. We do pay tribute to the way in which teachers have been engaging in remote learning with our young people, but it is so important that they get back in that face-to-face environment, not just with their teachers but also with their peers, so they can have that socialisation. In terms of the exams and testing, as he will know, the Education Minister leads on all of those issues. He's very alert to the fact that we'll not be sitting GCSEs this year, but we'll have to find some way of finding academic achievement for those young people who have spent so long building up to the years 12 and 14. So it's very important that we recognise the challenges for teachers and for pupils, but at the same time allow them to do those testing processes so that they can have something to move forward with. I think that's very important for their life chances as well. And just in respect of linking hope to what we're trying to do, we did have a very good meeting with the 4 main church leaders yesterday. We talked about hope. We talked about the fact that we had been in a very dark place over this past year. Many people had lost loved ones, and that's why we do feel that having this time of reflection, and if you are Christian, prayer on Easter Sunday, is something that I hope most people will recognise as a sort of coming together, obviously apart in our own homes on Easter Sunday, but taking some time to reflect and to thank God for his mercies, actually, from my point of view, over this past year, and I think that that is very important.
Christopher Stalford.
Thank you, Mr. Speaker. The announcement has been made that preschool through to P7 pupils would be returning. I want to raise the issue of Sure Start. I'm given to understand that for 10 days or thereabouts, the Department of Health has been assessing this issue in terms of whether or not Sure Start can open. First Minister, my right honourable friend, will know the wonderful work that Sure Start does, particularly with vulnerable children. Can I encourage her and executive colleagues to quickly expedite a decision in relation to this issue in order that Sure Start can recommence their wonderful and important work?
So I thank the member for his question, and can I agree with him wholeheartedly that Sure Start does provide a great resource for vulnerable children and their families right across Northern Ireland, and it is my hope that we will be able to have that matter dealt with through the task force which is set up to look at all of these matters. And as I've said, there's a flexibility there, so we should really be looking at Sure Start and indeed other schemes that are there for our young people, because we do recognise that for some young people, home is not the safest place. School probably is a much safer place for those young people, and some of them very much need support of their youth leaders. Therefore, I do hope that we can come to this place and make an announcement in relation to Sure Start and other youth programmes in the very near future.
Remember Sinead Annis. I call Sinead Annis.
I thank the ministers for their statement today. I'm delighted to see a tentative return to sport has been announced today, and personally I'm excited to get home and get the football boots hooked out, get the gum shield hooked out and get back to kicking a football again. Does the Minister agree that facilitating a return to sport is crucial for our recovery, for our mental and physical well-being? And would the Minister agree that continuing that engagement with sporting bodies and with clubs will be critically important in the time ahead as we make our way out of lockdown, and that we keep our kids and our young people on the pitch where they belong?
So thank the member for her question, and yes, there has been ongoing discussions, I understand, between the Department for Communities and the sporting bodies. They're very keen, and you will have heard a lot of very stellar people telling us that they need to allow our young people in particular to get back to sport for their well-being. And it was one of the things that we really spoke about quite a lot at the Executive, the need to be out in the fresh air and enjoying sport. So that's why 10 people from 2 households can undertake the outdoor sporting activities from the 1st of April, so that's before Easter, and then after Easter it's the sports training which will be governed by the sporting bodies of up to 15 people outside again, not indoors but outside, and I think that the sporting codes will very much welcome that, as indeed with a lot of young people and not so young people who want to get out.
Call Kelly Armstrong.
Thank you, Speaker, and thank you, First Minister. Just following on from the comment that has just been made about mental health in the community, next Tuesday I hope to take part in the day of reflection that's been called for by Marie Curie and others. But when I think about the community and voluntary sector, that's a sector who will be looking forward, as we all are, to this phased reopening, but they're exhausted. This is a community and voluntary sector that have supported us throughout the whole of the pandemic. Many of them have not yet received letters of offer of funding to keep them going. I'm just wondering, can we now help those who have supported us the most during this pandemic and make sure that they are aware when they can get back, because they will be providing the community with mental health support that we have really missed?
Thank the member for her question, and I too hope to take part in that Marie Curie Day of Reflection. I think it also is a time we're thinking about the fact that we have been a year in dealing with this issue. I remember standing here, Mr. Speaker, and saying I hope that we would be in a much better place by Christmas, and that was at the start of all of this, and here we are in March still dealing with these terrible issues. In terms of our voluntary and community sector, they have been absolute heroes in many communities right across Northern Ireland and have gone the extra mile in terms of delivering, in terms of dealing with isolation. And as she will know, the Red Cross brought us a report very recently about the real problems of isolation that are going on. And again, we're hoping that the task force can look at those issues of isolation. In terms of the funding issues, given that we are coming towards the end of March, I would be concerned if there are bodies who haven't received their letter of offer and who have been successful in gaining that funding. So if there's any in particular that she wants to come to us about, she should do that, and we will certainly look at that.
Can we please bring Justin McNulty on screen? Can I invite Justin McNulty to put his question?
Caoimhe Archibald, Concorla, Bannock T, Lafela, Paula Gorv. Thank the Minister for her statement and for her answers thus far. Minister, in answer today, about a month ago, 15 sporting bodies were represented in terms of a correspondence to yourself and your fellow First Minister in relation to the reopening of youth sports. Now, those sporting bodies, those sporting organisations have not received a response from you. And in advance of the review today, there was anticipation, discussion and huge excitement about the potential restart of youth sports. I'm not seeing any detail in relation to that in the statement, Minister. Can you provide clarity on when a return to youth sports will actually take place?
So I thank the member for his question. We decided that we should make sport available for those of all ages, and so 10 people from 2 households can undertake outdoor sporting activities after the 1st of April. If he's talking about more organised sporting, then after the 12th of April, outdoor sports training is resumed by sports clubs affiliated with recognised sports governing bodies in small groups of up to 15 people, but again, indoor spaces are closed. So it's not just youth sport that we are listening to, it's all sports, and I think that that is important for people of all ages.
Thank you. And I call Cara Hunter.
Thank you, Mr Speaker, and thank you to the Ministers for their statement. On the relaxation of rules and the COVID pathway with respect to my constituency of East Derry, businesses in areas like Portrush, Portstewart and Portballintrae thrive and oftentimes depend heavily on tourism. Will the Executive give them appropriate prior notice to reopening so that they can get in stock supply and things that are necessary for reopening? And does the First Minister recognise the huge impact that these lockdowns have had on towns that are dependent on tourism? Thank you.
Thank the member for her question. Absolutely acknowledge that in East Londonderry and right across Northern Ireland there are towns and villages that are very dependent, including my own constituency, on tourism. We recognise that the tourism industry has taken a huge hit in relation to this matter. We had built the tourism sector up to it was at its largest ever just before the COVID-19 pandemic struck. So therefore, we hope that during the summertime, again, a lot of people will decide to stay at home for their holidays this year, and hopefully there will be an ability for people to visit all of our beautiful parts of Northern Ireland. But it is important that we continue to speak with the tourism sector. As I understand it, officials from our department had a discussion with Colin Neal of Tourism Ulster yesterday, and we will continue those conversations, because she's absolutely right to say that they need to have advance notice. They do, because they need to bring in their stock, their staff, train them up, get them into a position that they're ready to welcome guests, and that is why there needs to be a space between an announcement and the time in which they're going to open. So we'll continue that engagement with the sector. We know that they need advance notice, and we hope that we will be able to give that to them.
I call Rachel Woods.
Thank you, Mr Speaker, and I thank the First and Deputy First Ministers for coming here and the statement to the House. I too am looking forward to get back my football boots on, but I have 2 detailed constituency queries that I've received this afternoon, with your indulgence, Mr Speaker. Firstly, Mr Selford has already mentioned it on Sure Start, but when will Sure Start developmental programme for 2 to 3-year-olds begin? And also, does the outdoor sports training from the 12th of April include outdoor yoga, adhering to social distancing, and if not, could it?
So thank the member for her queries. In terms of yoga, absolutely, after the 12th of April outside. Cannot see a reason why you wouldn't be able to engage in yoga outside, as I say, in groups of no more than 15. The Sure Start developmental programme, as I've indicated to my friend Mr Salford, that request from the Department of Education has gone into the task force, so I hope that we will have a response from the task force, because it's very important that those young people have that support, and I hope that that will be dealt with sooner rather than later.
I call Jim Allister.
Thank you. I welcome the overdue return of our children to school, but this timid Tuesday will be a disappointment to many, most particularly our retailers and critical businesses. The last statement was built around a buzz phrase about being data-driven. This statement is built around a new buzz phrase, social contact capital, though it seems to be blighted by a lot of executive austerity when it comes to spending the capital. But the question I want to ask is this. If we're still data-driven, what were the targets attained today to enable the first triggering of revaccination? And what will be the next targets in respect of each of the data, transmissions, hospital admissions, etc., that enables the next phase to be targeted? I think the public should be trusted by knowing that, rather than waiting, hopefully. They should know what the standards are, surely.
I thank the member for his question. I have a lot of sympathy for his point. The social contact capital is a phrase, as I think I indicated in my speech, from the Department of Health. What we're talking about essentially, and I think what we've referred to in the past, and my goodness, hasn't this year been a year of new phrases and new acronyms that we've become familiar with? I think it's about the headroom that we have in terms of making these decisions. I wish we had been able to have all children back at school before Easter. I think I've been very clear on that. But we are in a position now where at least we have certainty for those young people. All of primary is back before Easter, and years 12 to 14, and then the rest of the children go back directly after Easter. We have, I think, set out that these are cautious steps. I know there are some in the chamber that feel they are too cautious, but we are led by advice given to us by our medical advisors, and they are saying that this is what is available to us at this point in time. In terms of more clarity in relation to data, I'll certainly pass those remarks on to the Department of Health. I don't, as I say, disagree with them. I think it is important that we are as open as possible with the community so that they can understand why these decisions are being taken.
Caoimhe Archibald.
And I thank the First Minister's further statement. First Minister, the business support schemes, and there's a whole raft of acronyms for them, have been really important to help businesses during the restrictions, but families and businesses are going to also need practical support to rebuild once we are able to reopen our economy and society, obviously as guided by the pathway. One of the support schemes that has been proposed is the High Street Voucher Scheme, and I was just wondering if you could give some update in respect to that.
So as I understand it, the High Street Voucher Scheme is still very much something that we plan to do. The money is still available to us from the Department of Finance. The Department for Economy will decide when is the best time to reinvigorate that. Obviously, our retail, non-essential retail, is not yet open, so we want to be able to really lead on that whenever retail is opening up again. In terms of the practical support as well, at the Executive last week, there was a very clear commitment given to fund the recovery of Northern Ireland. The Economy Minister has put forward quite detailed schemes as to what she needs to do, that not least around skills, as I'm sure the member would acknowledge. So we will absolutely need to do a lot more in the recovery phase. We're only stepping out of the restrictions now, but the recovery stage will need a lot of support as well.
Jerry Carroll.
Given the schools have been given short notice again, it shows continued disrespect by the Education Minister towards staff in schools. And given the move to change from stay at home, given that more and more people will be obviously working in schools with these regulation changes, what consideration has the First Minister given to increasing social isolation support payments, because currently they're not adequate enough?
Well, as I think I indicated, the stay-at-home message is in place until the 12th of April. Obviously, there are those people who can't stay at home and have to work in their places of work, so they will be, of course, expected to do that rather than stay at home, and that's always been the case. There certainly hasn't been any disrespect to school staff from the Education Minister. I do note that there's a great deal of disrespect, I have to say, from the Education Committee to the Education Minister, and I noted that many of the members were hugely disrespectful to the Education Minister when he was actually at an executive meeting. However, the Education Committee thinks that they should take priority to an executive meeting. That's not the way it works. The executive takes priority, And I think there are many members on the Education Committee who should apologise to the Education Minister.
Members, that concludes questions on the statement. Thank you for all the contributions. Just take your ease for 1 minute, please. Members, item 5 on the order paper is the adjournment. The question is that the Assembly do now adjourn, and in conjunction with the Business Committee, I have given leave to Ms Paula Bradshaw to raise a matter of post-primary education provision in South Belfast. The proposer of the topic will have 15 minutes.
Thank you, Mr Speaker, and thank you also to the Education Minister, South Belfast MLAs and others who are here in the Chamber this evening. I wish to outline some of the very pertinent issues impacting on educational provision in South Belfast this evening. I wish to argue that parental choice is essential, but it is in fact severely limited in South Belfast. Lack of adequate options for those who do not sit the transfer tests,
or do not attain a sufficient score. Options such as integrated schools and many of the selected grammars are hugely oversubscribed, and the inadequate area planning restrict choice and practice. And I would put on record, Mr Speaker, I did toy over the use of the word sufficient score, because I think that it is appalling that we still have the transfer test that we would deem a child insufficient at such a young age. One of the most pressing issues, of course, is post-primary transfer. South Belfast has particular circumstances here because of the nature of its demographics, and because so many schools in the constituency are right on its boundary, are so sought after across the city and beyond for miles. Naturally, this year, this problem has been highlighted further by the pressure on many popular schools in South Belfast to allocate places without the use of academic selection. This sees, as I speak, many pupils, parents, carers and even grandparents left on tenterhooks. Also, we have to recognise that many schools are having to manage a highly complex transfer situation and seek to do so as fairly and reasonably as possible, and I will return to that point. Popular schools should, of course, benefit the residents of South Belfast, as you would have thought that geographic proximity would be a key part of the transfer criteria. This is not necessarily true, however, and the use in particular of existing or even former family links has proven highly controversial among the many constituents who have contacted me in the last few months. Concerns have become a reality, with Rathmore Methodist College, Lagan College, Our Lady's and St Patrick's College, Knock, Wellington College, Aquinas, Victoria College, Hunter House and Inst all placing a pupil with a sibling at the school above eldest child in their criteria. In terms of area planning, what this shows, undoubtedly, Mr Speaker, is that area planning has not served South Belfast well. The pressures and popularity of local schools, which is one reason why many people choose South Belfast to live, brings its own disadvantages. Area planning is not just about numbers on a page, although it should be noted that in the case of South and East Belfast, many of the numbers are outdated anyway, and leads to what we see in many of our schools annually requesting temporary variations on pupil numbers. Mr Speaker, area planning is fundamentally about provision, the provision of buildings and other educational spaces, the provision for pupils with special educational needs, the provision of pastoral support and so on. At the moment, in my opinion, that area planning is just too narrow and reactive to serve the purpose it is supposed to serve in our constituents in South Belfast, where there is disproportionately a high turnover in population. There are also understandable concerns about the type of provision. Planning rarely focuses on secondary provision. Here, for example, Breda Academy already has an intake of which a third have recognised special educational needs, and there may be others without a statement of need. This requires appropriate educational infrastructure developed proactively, 4 to 5 year lead-in times to cover issues emerging now are no good and do not serve the pupils. Essentially, the system is unbelievably complex, with parents even considering nursery schools depending on the route they wish to take. And there's huge complexity in everything from decreasing state secondary school provision to an oversubscribed selective or integrated school in the constituency boundary. Going forward, it is also evident that many parents wish to choose integrated education, but they are seriously limited in their choice. The excellent Lagan College, right on the constituency boundary, serves many pupils in South Belfast who opt for this type of education for their children, but the catchment area is vast. For other parents, there is a recognition that although integrated may be their preference, the difficulty of getting to Lagan College from further away in the constituency, and indeed the likelihood of getting a place anyway, is off-putting. And so, just to be clear, Mr Speaker, we in the Alliance Party fully support the admissions criteria regarding attendance at an integrated primary school as a criteria, and recognise the efforts of the Education Minister and his department and the school leadership to advance plans for the expanded Forge integrated primary school on the... Yes?
I appreciate the member giving way, and I'm very grateful to her. Would she accept that one of the reasons why people want to send their children to Lagan College is not necessarily because it's an integrated school, but because it's a good school, and just as the preference the member doesn't like the preference for having a sibling at a school being used as a criteria to get you into a selective school. Should it continue that it should be used if you went to an integrated primary school? Surely that's not particularly fair, particularly if you look around where Lagan is located, the number of non-integrated primary schools that are in that area.
Thank you. I'll get on to that question, the second question, in a minute. But I think that the reason why Lagan College does so well academically is because it is so diverse, and people want to send their children there because of its very all-encompassing ethos. So I think it's almost like a self-fulfilling prophecy. But I agree with you. I think that the whole issue of criteria and admissions does cut to the heart of the issues that we face in South Belfast. But as I say, I do applaud the department trying to advance the new Forge integrated school on the site and trying to seek that progress on that during this pandemic. Has not been easy, no doubt. An integrated education survey carried out a couple of years ago in fact showed that 6 primary schools in South Belfast are consistently at or above capacity as parents choose that route to post-primary provision early. Their choice is not, as you said, always just about ethos, although that is relevant, because sometimes it's about proximity. The outcome of that is that there is a growing population, particularly in the Castlereagh South part of the constituency, and this leads to fast oversubscription for integrated education, which will most likely be exacerbated further in the next 10 years when we know that there are ongoing works or in the planning stages further 1,100 houses, many of which are family-sized. One obvious question is there room for another integrated school for our 11 to 18-year-olds, one well outside the constituency which could share that oversubscription with Lagan College and would be a significant boost to integrated provision for parents in and around South Belfast and further on. Mr Speaker, given the delay in getting to this issue, I should seek to address a lack of planning around COVID. Initially, schools were extremely concerned about the need for online learning options and the significant difference in pupil experience depending on which school they attend, access to technology, family circumstances and so on. And they've also been worried about social distancing provision, contact tracing, ventilation and other matters relating to public health. An immediate problem clearly has been how to manage the transfer for this year, but it is a symptom of a wider problem that requires improved cross-sectoral communication and collaboration, more joined-up planning, a better approach to balancing parental rights and places at all ages, broader provision, not least in the integrated sector, and shared education by locality. COVID in some ways has shone a light on the way in which we often divert responsibility onto schools. This was never more apparent than on the issue of managing transfers, when it was increasingly evident that the exams, the transfer tests, would not take place. I must emphasise that the Department is responsible for planning, management and delivery of a fit-for-purpose school estate and an adequate transfer and public examination system. Let us be clear again that transfer is a statutory function of the Department, and it is not adequate for the Department to say, well, let the schools decide. The Department has functions which include but are not limited to ensuring, for example, that Section 75 is adhered to. We are already seeing disadvantage in schools being exacerbated by time taken off due to social isolation, and it is unacceptable for this simply to be ignored and handed over solely to schools to make the best they can of the situation. It is unfair also to the many pupils across South Belfast who were beavering away on their practice papers in anticipation of the transfer tests and had and still have in their hearts set on a particular school and are having to face the reality that they probably won't be able to secure a place this September because they do not have siblings already at the school. So in conclusion, Mr Speaker, whatever our political differences, I would like to put on record my thanks to the Minister for being so responsive to issues raised with me by my constituents around education during the pandemic. I really appreciated his prompt responses. However, these immediate problems do give us a full view of the longer-term issue. We need to reconsider transfer in general, but we also need to be proactive in considering the particular circumstances of
this growing and changing school-age population in South Belfast, as well as the need for ensuring an integrated option is available to all ages to match increasing demand for it in our increasingly mixed communities. Our proactive planning and expanded provision in South Belfast can ensure that parental choice is a reality and high-quality provision is assured of for all. Thank you, Mr. Speaker.
And I call Christopher Stalford, and all members have 5 minutes.
Thank you, Mr. Speaker. Mr. Speaker, sir, South Belfast contains some of the some of the finest schools in Northern Ireland, offering some of the best educational experiences that young people can have. And I'm afraid I'm going to have to, we always end up going down this road, but I'm afraid I'm going to have to defend the principle of academic selection. I believe in academic selection. And I'm standing here speaking as someone who was born in Annandale Flats, comes from a working class background. And had we been a family living in England, for example, the access that I got to the education that was given to me at Wellington College would never have been an option. Because in England and in Wales and other places, what you have in place of academic selection is selection on the ability of your parents to pay. Well, my parents could never have been able to pay. And therefore, I will always defend the principle of academic selection because of my own lived experience and because of that of others of my family who have enjoyed access to, well, Wellington College is really much the school that our family always seemed to go to. So I will always defend that principle. But I want to agree with what Ms Bradshaw said in terms of area planning and the disservice that it has done to the constituency down through the years. We've now arrived at the situation whereby in the entirety of South Belfast we have one controlled secondary school remaining. So because of that, you have a situation presently where kids from the likes of Sandy Row and the Donegal Road are heading up the road to the boys' model in North Belfast because they can't find a school place. So it's really important, I think, that not only that it's really important that Breda Academy is obviously maintained, but it's also really important that that element, the controlled secondary school element of educational provision, is maintained. I think almost all of the schools in my constituency could be described as integrated. It may not say integrated on the sign over the door, but I'm thinking of schools like Rosetta Primary School, Knockbreda Primary School, Fane Street, where we have maybe 70 or 80 different languages spoken. I think all of those schools in my constituency could be described as integrated because they're reflective of the diversity of our constituency. It's not for nothing that there are 5 different political parties who represent South Belfast in this place, because it is a diverse constituency. I want to raise the issue of special educational need provision. The Minister wasn't in post at the time, I don't think, but I think the EA made an absolute hames, frankly, of the consultation with parents over the provision of special education at the Harberton site. And I hope that the lessons will have been learned from that going forward in order that children with special educational needs are catered for in a way that's befitting. I think on that site, I think if we're honest, you know, if we were starting blank, that site wouldn't look like that and the educational provision wouldn't look like that. It has evolved in that way. But it very much needs to be, in my view, a parent-led approach, a parent-led process in terms of securing the best SEN provision there. I agree in terms of the limited options that there are, and I think that that needs to be addressed. We cannot have a situation whereby presently, I think, for every place that Lagan has, 2 pupils are applying for it. You know, it's deeply oversubscribed, and so in the spirit of someone who, I want every school to be an integrated school in that sense, and I think it's important that that provision is there. We also need to see investment in capital investment in an awful lot of our schools, not just post-primary but certainly primary, and I would be remiss if I didn't yet again take the opportunity to bend the Minister's ear about the need for investment in Nettlefield Primary School, not just because I went there, but I think this is a positive discussion, and I thank my colleague Paula Bradshaw for bringing it to the floor of the Assembly, and hopefully actions will arise out of it. Thank you, sir.
Thank you, Nicole. Jerry Hargett.
Very much, and through the chair again, thanks to Paula for bringing this important discussion, and I'm glad that we've finally got to discuss it here. So I'm proud to say, obviously, that I attended post-primary education in South Belfast and St Monica's, which then became St Joseph's on the Ravenhill Road, along with my 6 other siblings. And I do want to take the opportunity to commend and acknowledge the leadership and commitment of all of our school leaders, our teaching and non-teaching staff across South Belfast and indeed beyond, and thank them for the tireless work that they have been involved in, particularly over this last year. These are without doubt the most difficult of times for our schools, young people and indeed the education system, and disruption to education that most of us have never seen in our lifetimes. At the start of last year, no one could have anticipated the sheer levels of disruption that our young people would have to endure, and indeed continuing to endure as a result of the pandemic. Sinn Féin offices, like many constituency offices, have been inundated with letters and emails from concerned parents in relation to this disruption and the consequences it will not only have on the education of their children, but also on their mental health and well-being. Children have faced unprecedented disruption that was added to by the handling of the exams issue, and the Education Department must ensure that this doesn't happen again. Young people, parents and schools need advanced planning, engagement and notice to the approach of tests, including the transfer test and wider issues. And there must be no delay when addressing the issue of post-primary transfer, because children in P6 and their parents need to know what's happening in relation to these unregulated tests now. We know that private companies are opening for registration in May and June, so the issue needs to be looked at quickly. How could the Minister then stand over putting children through these tests in the autumn when they've missed so much of school, not just this year but also last year as well? As we plan a social recovery from the pandemic, the Education Department must address and plan around mental health and well-being of young people and of the schools more widely, and put in place plans to address this and not just an academic focus. And indeed, I know the Mental Health Champion has spoke of this issue recently when at the Education Committee she talks about an oncoming tsunami of mental health as a result of the pandemic and the restrictions. We now know that the demand for places and provision in South Belfast has been growing, as was already said, and the demand is not being met. Schools urgently need more places and increased resources. The area planning process is slow, and we need the Minister to address this and ensure that they are prepared. We know how many children are coming through the system each year and need plans in place to respond to that. And obviously, especially around the issue of the growing demand for special educational needs, which has been touched on. We know around integrated education, and indeed through the medium of Irish, there's a huge demand there as well, with cont'd First, the only secondary school in the city around Irish language and more broadly, and it's bursting at the seams for places. So we need to look at that in the longer term as well. And again, I would ask the Minister to give assurances of detailed planning. Is that in place to ensure that there are places in September? Securing and protecting and enhancing the extended schools provision is also vitally important. Schools are indeed extensions of the community themselves and can act as a community hub beyond the school day. It can work to alleviate poverty and offer parental support. In a constituency, as was said, that's diverse like South Belfast in terms of population, but also in terms of the socio-economic population, then this provision of extended schools becomes crucial. It includes key outcomes such as closing the attainment gap and alleviating poverty, and addressing key themes of being healthy and living in safety and stability. Much of the provision has focused on the healthy element, which is important, but we also must have a clear focus on alleviating poverty. There has been further demonstrated through the holiday hunger issue, with parents raising concerns with access to resources for clothing, food and childcare. Many parents would say that the economic well-being is a key theme that they would like to see through these programmes and through support in the time ahead, and that the Extended Schools programme, in terms of seeing transformational change around alleviating poverty and closing the educational gap, we need to look at the financial pressure that parents face. Another area quickly is the issue around travelling to school safely, and again encouraging the Minister to work with infrastructure to look at issues of traffic calming, of reduced speeding limits. And again, I just want to thank the Minister and I look forward to engaging with you on these issues.
Thank you. Nicola. Matthew O'Toole.
Mr. Speaker, thanks obviously first of all to Paula Bradshaw for calling this debate today. It's a little bit like there's a Manic Street Preachers brought out a best-of album which was called Forever Delayed. Well, this it could be described this post-practice debate, this adjournment debate, but I'm glad it's finally happening and it's been really useful. And I'll happily give way. Yes.
In relation to that, of course, obviously one of Manic Street Preachers' most celebrated tracks is "If You Tolerate This, Then Your Children Will Be Next." So it is perhaps appropriate that he's making reference to Manic Street Preachers' best of in this debate.
And you've earned another minute for that.
Well, that's a good way to earn another minute. I defer to the. I have to say, I did not predict that the Education Minister would be a Manics fan, but every day is a school day, as they say. Yeah, indeed. I think to boil down thoughts around the post-primary provision in South Belfast, and it's emerged already from the debate we've had, two issues emerge for me, which I'm going to touch on in my remarks, Mr. Speaker. One is on the complexity of the system. That's already been mentioned, the complexity of the system in Northern Ireland generally, but that complexity is really exemplified in South Belfast in a really striking way, but also lack of provision, and frankly the fact that our provision is really straining at the seams in South Belfast because we have a growing population. Mr. Speaker, issues around post-primary provision clearly aren't unique to South Belfast, but as I say, they are particularly acute in our constituency. We have a growing population and a growing need for provision, but not enough of it, and specifically not enough of it in the right places. Some of that is as a result of our growing population. The population of South Belfast grew by 6% between 2009 and 2019. People want to live in South Belfast and are moving there. I suppose it's important to say in parenthesis that we are obviously in the process of completing our census forms, and that census result is going to be particularly important in planning for provision in South Belfast. Paula Bradshaw correctly mentioned issues around area planning. I share those concerns. Hopefully that we get really rich census data, and that's really important. I think that people in the constituency fill that out because of the diversity of the constituency, but also how quickly our population changes relative to perhaps other constituencies. As I said, people want to move to South Belfast, and that is in part due to the good quality of schools. I agree with Christopher Stafford when he mentioned our good schools. We don't agree on selection, I'm afraid, but I don't disagree on the quality of the schools. But a significant amount of the challenge being faced in South Belfast is as a result of the same structural forces that are present in Northern Ireland education, and that I'm afraid we have not been serious enough about confronting here. As I said, our overly complicated education system not only multiplies provision in some areas, it means we have not enough in others. In South Belfast, many of those issues are stark. Many of our high-performing grammar schools, especially but not exclusively in the voluntary sector, are oversubscribed, and our post-primary provision in South Belfast is disproportionately selective, meaning many parents are obliged to make that choice for their kids, even if they themselves see the benefit of all ability schools. We also have some of the most successful and highly controlled voluntary and voluntary grammar schools in Northern Ireland. It's been mentioned. Methody, Wellington, Victoria, Aquinas, Rathmore, all high-performing schools, and I will concede Christopher Stafford's point that in many cases some of them have organically integrated because of the nature of South Belfast and its relatively integrated population. That's something I treasure, I think is really important, but that doesn't mean in my view, as someone who very strongly supports integrated education, that we can simply rest on that happening organically. And as I said, though Northern Ireland's first integrated school, Lagan College, serves South Belfast, it's obviously technically in the member for Strangford's constituency, and I know Claire Bailey's here, and I think she was a pupil at Lagan, so she'll be able to talk about it with more authority than me. But a large volume of its intake comes from South Belfast. Clearly there are, and it's been said multiple times, there are issues around Lagan because it's such a good school, because so many parents in South Belfast want their kids to go there, and they want that. It's an amazing achievement, but there simply aren't enough places. There is a clear demand, as has been said, for more selective education. Also, it's been mentioned, to talk about another school, it's been mentioned the need for capital investment. The alma mater of Deirdre Hargey, what's now St Joseph's, there's a school which frankly does need capital investment too, and could really do with a new building, delivering a really good all-ability education to pupils in that part of South Belfast. There is, I think it's right to say, Paula Bradshaw mentioned it, but it's also important to talk about around the BT8 postcode, Castlereagh South. We're going to see that the population there is going to grow, and it's a population which hopefully will continue to be diverse, both in terms of what we slightly clumsily call the traditional communities in Northern Ireland, but hopefully just a more diverse population generally, because South Belfast's diverse. That whole corridor between Newton, Breda and Carryduff is going to grow in population, so we're going to need more post-primary provision in that part of the world. Lagan and the other schools there, whether they're controlled, voluntary, selective or non-selective, whether it's Breda, whether it's Lagan, whether it's Aquinas up the Ravenhill Road or St Joseph's, they're not going to be able to cope, I think, on current levels with the growth in population there, so we will need investment and area planning, and as I said, the census data is going to be absolutely critical. I'd also reiterate or reinforce some of what's been said around special educational needs. We do have an issue in some of our schools, particularly around special educational needs provision. So just to say, Mr Speaker, I'm very pleased this debate has happened. The 2 points about the fiendish complexity of our system, we need simplification, we need a fundamental review of how we do it, but also the fact that, put bluntly and simply, South Belfast is growing and we're oversubscribed, so we need more capacity. Thank you very much.
I call Claire Bailey.
Thank you, Speaker. And first I want to say that I'm delighted that the Minister has begun the appointment process for board members for the Education Review Panel, and I look forward to their work, for it is so very long overdue. And we know that across the school estate we have somewhere in the region of 50,000 empty seats. We spent £95 million per year on duplication of services. And recently, the Integrated Education Fund estimated £1 million has been spent over 10 years on cross-community projects bringing children together. But every year, without fail, I am inundated with pleas for help from parents of children without a post-primary place, after assurances of an offer, letters coming out at the start of June, and some may have just missed out on a place at the preferred choice, others without little prospect of a place at all. And every year we are promised that the department has a plan, that we won't be in the same position, that there will be enough places, and every year there's the same scramble for places and temporary variations. Now, some may know, as Matthew O'Toole has mentioned, I was part of the first intake of pupils at Lagan College. It now is the most oversubscribed school in Northern Ireland, and if you were to build an identical school next door, it would fill straight away. Yet when last year they applied for extra places, they were turned down by the Minister, apparently because there was no need in the area. And this is a complete contradiction to my experience as an MLA in South Belfast and my experience of a past pupil in Lagan. For the first time in their history, last year they had to turn away children from the local integrated primary school until a temporary variation was later granted, and the many parents and children across South Belfast who've been turned away for places. But my first day at Lagan back in 1981 was marked by protests. We had an armed RUC guard to help us get into school, and thankfully that situation has shifted today, and we have 65 integrated schools, I think it is, across Northern Ireland, but opposition to integration still remains. The Minister's Department has a statutory duty since 1989 to encourage and facilitate integrated education, but I've seen little in terms of policy or practice coming from the Department to promote integrated education, and it's left to schools and parents to do the heavy lifting. But I am delighted to be able to say that Lagan is marking its 40th anniversary this year. And it also stands as an example, just like Androchid in South Belfast, as a very proud and successful parent-led project that has led to very great schools at the other end. But we still reinforce divisions and segregation within our children, and that has to end. I don't want to go over other issues that have already been raised, but suffice to say in South Belfast that only 15.4% of students in the Belfast city area attend their nearest school. That's followed closely by Lisburn and Castlereagh Council area at 18%. And that's by far the lowest rates in the whole of Northern Ireland. So I don't think it's any coincidence that South Belfast straddles both those council areas, and I see how many pupils are left without places each year and the limited options available to them. But yet the most oversubscribed integrated school in the region is told that there is no need. We have a number of schools waiting desperately for new builds, as we've heard, and I've visited St Joseph's and I've seen the cramped conditions that they manage in, and also Forge round the corner from them as well. So would really be calling to the Minister that it's deeply regrettable that you could not find it within your powers to include these schools, in St Joseph's in particular, under the capital expenditure scheme announced by his department in June. And I hope that he can look favourably on their development proposals as a matter of urgency. I've also spent time last summer with Glenveigh Special School and a team of my party volunteers, helping their teachers and staff simply improve their outside space to make it safe, just safe and more usable for their students. And Glenveigh is a lifeline for many children and young people with severe learning disabilities and their parents. So I please encourage the Minister to at least visit the school, meet with the committed staff, pupils and community there, see the work they do and see what they really need. But we have a long way to go in South Belfast to ensure that every school is a good school, and I think that we still don't really understand what integrated education is about. Lagan is a good school because of its ethos, because it is all ability, it is non-selective, and it takes children from right across the spectrum, which means that children from one family can all attend the one school, therefore encouraging the sense of community. I don't think the Speaker's going to let me. Well, certainly, go ahead.
Just play an extra minute. I'll call Kelly Armstrong.
Thank you very much, Mr Speaker. I'm not an MLA from South Belfast, but I've waited to the end. Some would say the best to last, but no, I won't say that. Lagan College, of course, as we know, does fall just into the Strangford constituency. But what I'm here today, along with my colleague Paula Bradshaw, is to say, you know, in the morning time you could watch literally hundreds of my constituents' children get onto buses that are going into South Belfast constituency. Our Ladies and St Patrick's, I think there might actually be 2 full buses of pupils that travel into Our Ladies and St Pat's. Lagan College has a range of pupils because in Strangford and in North Down, Priory and Strangford College are oversubscribed, so the pupils, if they can get into Lagan, they're going there. I know South Belfast is a heavily and densely populated area, but instead of pupils travelling and going to their nearest local good school, they're choosing to go to South Belfast, and that puts pressure on the population in that area. I will agree with Mr Stalford. I would love it if every school was an integrated school, but I would like to point out we can't claim that all schools in South Belfast are integrated, because Justice Tracy stated that integration and integrated schools are a standalone concept. In fact, back at the time when he was making his decision, he criticised then at that stage, which is not our current minister's, it wasn't under his remit, he criticised the department's planning policy that had been used to determine which schools will remain open, expand, close or amalgamate to meet future demand. And that had prevented integrated education from being developed, because quite often in other types of school there were places available and the integrated schools just became more and more oversubscribed. And this has happened in South Belfast. We can see that there are parents who cannot get their children in. The Good Relations report that unfortunately wasn't reported upon by the Executive Office because of COVID in the last 12 months, but in the previous 12 months it stated very clearly that there was 20% of children being turned away from integrated schools because there just simply wasn't enough places. But unfortunately there doesn't appear to be a measurement to see where they have ended up going to. But there's a lot of work needs to be done for South Belfast, and I would really welcome the Minister to take a look at the area planning. It needs to be cross-constituency because there are so many children travelling into South Belfast. It is more than just the population of the area, and that's one of the concerns I've always had about the area planning and the way it currently works, because it doesn't do what Paula has said. It doesn't measure where everybody's coming from and take into account how many families are going to bring their children into an area because they're good schools. Pupils are travelling extraordinary distances, and I know that Minister Hargey had talked about safety at schools. I have to say, my heart is in my mouth, and I have to declare an interest that has a niece at Allspec, Our Ladies in St Patrick's. The school transport isn't there when she comes out after, from after schools activities, so she has to walk down the road, get out to the Newton Arch Road, and hopefully get a bus down to head towards Strangford. It is concerning. And it's there because it's a school that's successful. It's a school where we do have concerns that kids are coming out. There isn't a school bus available there. It limits, when you do live a further distance away from a school, it does limit your opportunity to have extra activities or after-school activities. I know I travelled a fair distance, I have to say, to go to school outside Strangford myself into South Down. But what I would just say to the Minister is South Belfast is an amazing place for schools, but it's an amazing place for pupils coming from other constituencies into the area, and that puts further pressure. And as others have said, the constituency is due to expand. There will be more pupils coming forward as the years go on, with the many more houses that are being built in the area. It's actually got to that stage now in South Belfast where there's a number of people who their children have children now and want to go to the schools that they went to, so you'll see more and more pressure coming forward. That's really all I have to say on that. I just would say that, to finish off, I'm very jealous that South Belfast does have such amazing schools. Strangford does have them too. I just wish that we could change the system so that parents could send their children and choose to send their children to their nearest local good school, as opposed to driving them in buses out of their areas and far away. Thank you.
And I'd like to invite the Minister.
Thank you. Just checking up, Mr. Speaker, how long have I got? 10 minutes. Okay, thank you. Look, it's great to have this debate. I think it's both a testament, I suppose, to the perseverance, particularly of the member. I think this is the third time lucky. We've had a few snags in the past, and also like to thank all those who've contributed to the debate. I suspect that one area probably was a little bit of divergence on across the chamber would have been on the issue of post-primary transfer in terms of selection, but I think everything has been said in a very good-natured manner today. Can I also say, I suppose, one slight level of restriction that I will have in terms of responding to some of the points, I'll try and deal with it generally, is that members will be aware, I think, even in terms of a range of the sectors, that in terms of a number of the issues we'll touch upon development proposals as we move ahead. Legally, I suppose the restriction is, first of all, that those have to come from the managing authorities of those schools, but also as the department, and I suppose me personally, has to ultimately then give a legal verdict on any development proposal. That will restrict maybe some of the remarks I'll be able to make in connection with that. The members, I think, are very right in terms of highlighting, particularly as a constituency, the level of diversity within the constituency, the level of, I suppose, a cosmopolitan feel to it. And I suppose, while I can't claim, as some of the members here, to have either gone to school in South Belfast or been raised in South Belfast, but my parents are both from South Belfast, so I'd be very well aware of the area. In terms of the growth of the area, first of all, in terms of divergence, there's a higher than average percentage number of newcomer children within the constituency. And while I think there's always there'll be a little bit of tendency for people to see new housing as always leading to a particular growth in population, whereas it sometimes can lead to a sort of lower sort of housing density. The position, I suppose, as regards young people in South Belfast as we move ahead, that in terms of projected growth of around about 2.7% in Northern Ireland as a whole, it's nearly double that for South Belfast. It would be 4.8%. It's also the case that, again, if we look at the movement in and out, I suppose South Belfast, probably more so I think than any other constituency, has that level of flow in and out of the constituency in terms of school places. I think that is to the credit of the schools within South Belfast. It does create in and of itself its own challenges and own difficulties. But it's noticeable that, for instance, if we count, and I appreciate the point that's been made by the last speaker that, well, strictly speaking, Lagan College is just inside the boundaries of Strangford because of where it draws its students. If we count Lagan Valley as part of the overall picture, or Lagan College as part of the overall picture of South Belfast, there are 11,060 post-primary places, and indeed of those that are filled, 10,938 are currently filled within South Belfast. It's noticeable that of the 11 post-primary schools that are being referred to, 5 out of the 11 are at first preference oversubscribed. And indeed, I think of the 11 mainstream schools, all have sixth form provision, which I think probably puts them in a fairly unique position compared to most other constituencies. Additionally, which again can sometimes by some be a little bit ignored, mention's been made of the special schools in South Belfast, and there are 5 special schools based within South Belfast, which, given the fact that the Northern Ireland there are 39 in total, shows again disproportionately there's a higher number of special schools in South Belfast as well. Obviously, the debate touched on a number of aspects. The mention's been made by Deirdre Hargey of the issue of mental health, and she'll be aware as part of that that recently myself, there is undoubtedly I think there is a major concern over the tsunami of mental health that will happen post-COVID. None of us can make a full judgment call of where that will be. But the member will be aware that as part of the process of COVID recovery, I've certainly put in bids next year for additional mental health, but also I think significantly it's not just the response to the COVID situation, but also as part of that there is a long-standing issue. Recently, myself and the Health Minister, along with the Mental Health Champion, was able to launch the Executive's Mental Health and Wellbeing Framework with a mainstream budget at least of £6.5 million. Now, that's in addition to what's being spent on mental health. Could we, I suppose, if I'll give way very briefly in that regard.
It's just on that point on the mental health and wellbeing framework, because that was designed and formulated pre-COVID, and we're facing a totally different situation. As you said yourself, the Mental Health Champion talked about a tsunami of mental health issues, which requires an altogether different approach to the problems with mental health and wellbeing.
Two elements to this. There is the direct mental health and wellbeing framework, and what we're also trying to do with that, and it was very important, we had a number of young ambassadors at that launch, that as much as possible the co-design as we move ahead with that will also be by young people, that we reach a situation in which that level of input that is there, that as we trial things out, there is that mainstreamed baseline budget that will be there, but in addition to that, there will be specific funding that is being sought, and I hope will be successful in being sought for direct COVID recovery as well. So there are the two parts to that, and so the member is quite correct in relation to that. I'm also, I think, mention has been made in terms of the impact, and I appreciate this goes well beyond the boundaries of South Belfast, of the issue of holiday hunger, and we know that there is work going on between education and communities. And I think in Northern Ireland we can be rightly proud of the fact that, whereas in other parts of the UK we had sort of backwards and forwards with Marcus Rashford and others in relation to it, Northern Ireland was the very first part of the UK to accept that there would be payments for free school meals that would be all the year round and not simply related to when children were within school. We were in many ways the brand leader within that, and I think it stands the credit of the department, of the executive as a whole. On a few of the issues I think which have also been put, there are, I suppose, a number of both in terms of the voluntary grammars, in terms of controlled schools, and indeed integrated, there are a number of potential either DPs that are currently being considered or en route in connection with that. And I suppose, perhaps in keeping as well with the trying to provide solutions that are much more geographically based, I appreciate the point that's been made by the member for Strangford in terms of area planning shouldn't be particularly confined to specific geographic boundaries, and I think that particularly some of those solutions are actually looking across in the Greater Belfast area within that. Unfortunately, I'm a little bit tight for time in relation to that. Specifically, obviously, as well, there has been community conversations that have been ongoing in terms of integrated post-primary provision. Obviously, it will then be up directly to NICE to bring forward proposals, and whether that's in relation to a transformation of a school, or whether they're looking at a wider context of a new location for a school, which may or may not be within the boundaries of South Belfast. Again, that will come forward directly from that. I know there's been work ongoing as well in terms of Breda Academy. Mention has been made, I think, of the issue of capital build. Having visited St Joseph's along with a number of the other schools, look, it is undoubtedly the case that there's a wide range of desire and a need for new capital build. I suppose one of the frustrations that all of us would have would be that there's a level of budget that is available in terms of capital build. If that budget suddenly was doubled overnight, I think that could be spent. But the aim would be then to have a new call directly for capital build later on this year, to which all schools can apply. And I think the fabric of the schools itself will be a key determinant in terms of being able to evaluate that. In terms of the issue of special educational needs, well, maybe I think there is both a need to ensure that we have something that's fit for purpose, particularly for this September, but also we're trialling additional provision within mainstream schools, and indeed I think there's consultation which is due to complete in April to take that forward. It is also the case, I share, I think a number of members have expressed concern over the slowness of area planning. That has not necessarily been helped by the situation by COVID, but hopefully we're a little bit back on track. But I think there are two other solutions in addition to those longer term solutions. Mention has been made of temporary variations, and I think that there will clearly be in the cohort, I think particularly transferring to post-primary in this September will be higher than it is previously throughout Northern Ireland. So temporary variations can proactively then deal with some of those things. But I'm also keen, I think, to try and formulate a system which operates, if you like, between the two pillars of temporary variations and area planning on that. So I'll be bringing forward through area planning a process of what is, I suppose, termed right-sizing or normalisation, which will allow either a level of uplift or reduction that would be considered on application from the schools meeting certain criteria, which can then reflect what is there in practice within the schools. Those will be brought forward fairly soon and can give, if you like, permanent solutions without having to go through the rigours of a full development proposal, because that can take an amount of time. The other advantage with that would be that it can hopefully declog the system a little bit, and where there are major systemic actions that need to be taken, that they can do it. I appreciate, Mr Speaker, my time is up, but I thank all those who contributed to the debate.
Okay, members, thank everybody for their contributions this afternoon, and to say that now that the Assembly is adjourned, could I just say La Fiala, happy St Patrick's Day.
Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly